Et cela requiert une mobilisation de fonds pour que tous les pays puissent de manière solidaire faire face à ces problèmes de santé émergents. L'Afrique doit se mobiliser en faveur de la santé parce qu'aujourd'hui, nous payons le lourd fardeau des problèmes de santé émergents au niveau de l'Afrique. L'Afrique doit se mobiliser pour faire face aux défis futurs en matière de santé et contribuer au financement par rapport à la lutte contre les pandémies.
For the upcoming period of the GPW14, pledged to confirm that Timor-Leste will continue with the estimated increased assess contribution and additionally channel $1 million to continue advancing our effort for robust response and resilient health system. With unity comes power, and surely our collective effort will bring and require results. I thank you and obrigada, Bharat.
Bon, le cycle d'investissement de l'OMS est une initiative innovante que nous saluons et qui sollicite la solidarité entre les États pour pouvoir financer de manière donc innovante l'Organisation mondiale de la santé pour que l'Organisation mondiale de la santé ne dépende pas seulement des donateurs et cela contribue également à autonomiser financièrement les États pour développer les systèmes de santé. Notre pays s'est engagé à mettre à disposition une contribution qui, par rapport à nos moyens, est assez consistante. Elle est de $500 000 américains. Quand on sait que le Tchad est confronté à beaucoup de problèmes de santé publique, à un système de santé qui est encore en train de s'organiser, c'est une contribution qui a quand même son sens et qui est importante.
You're watching this video because you care about health, because health for all is an investment, not a cost. Because we all need health. Societies, economies, families, each and every one of us. Which is why it's so clear that the World Health Organization, WHO, needs your support, so that over the next 4 years, together we can save 40 million additional lives. Thanks to a strong new strategy which all governments have created together, based on the latest science, which all governments will implement in their countries and communities, guided and coordinated by WHO. We are a uniquely representative organization. Our members are East, West, North, South, hot and cold, big and small. Our partners are diverse, each bringing important expertise to the table. If we have fully funded WHO's new strategy, by 2028, we will all be able to say, together we have created 10,000 climate and shock-resilient health facilities, trained 3.2 million more health workers, and screened more than 100 million pieces of information annually, and assessed more than 50,000 potential health threats per year, so outbreaks are identified within 7 days. But to implement the strategy, WHO needs to be appropriately and sustainably funded, with predictability, and with enough flexibility. That's why in 2024, we're launching the investment round. We are grateful to all our supporters and encourage our funders to follow those who are already committing flexible and predictable funding.
The World Health Organization is more important than ever.
We are proud to be part of the history of this great agency, the World Health Organization.
We are very cognizant of the help provided by WHO. We think that WHO has been an exemplary help to us.
We, as Welcome, relies on a strong and science-based WHO with evidence-informed policies, guidance and norms.
The World Health Organization's work benefits us all. What it needs for this work is sustainable financing that gives it the certainty to plan ahead and the flexibility to react.
I call on all member states to pledge and invest in resourcing the WHO.
If the World Health Organization did not exist before today, it would have to be created today to deal with the challenges that this world faces.
I want to thank you for being there and for seeing small countries when others didn't see us, and saving lives, hundreds of thousands, if not millions of lives across the small island developing states.
Investment in WHO yields healthy results, a prudent investment, and a moral imperative. It moves us closer to the vision of health for all. We need you, each of our member states and partners, to turn this vision into reality. All for health. Health for all.
Stronger WHO with predictable, flexible, and sustainable financing will undoubtedly be instrumental in better supporting of our nation, supporting member states, and delivering impact for countries. Our financial commitment part is part of the broader commitment that we want to enhance a well-being of our nation and our region. And Ethiopia has pledged $2 million USD over the period of the GPW14, which is over the period of 4 years, which is believed to be contributing for promoting and providing and protecting health for all and saving millions of lives at the same time. And the objective of pledge from the African member states demonstrates that we set a new model of resource mobilization for health, while countries with also fewer resources are also contributors for a common global good, which is also global health. Potentially, this will ignite similar impact to other countries where we can see more actions globally, and we remain steadfast and we will continue to contribute to share our investment, and not only to this, but the greater health agendas that our globe is discussing and our continent is discussing right now. Health for all and all for health. The pandemic agreement is really important because, as we know, agendas like this have to get everyone's voice, and we cannot leave anyone behind. Our recent experience with COVID has really taught us a lot. If one country is weak, the globe is weak. So the pandemic agreement is where we can say that we have taken our lesson from the recent pandemic and we stand together, but also we make sure that countries like Ethiopia, African continent, and other countries are not left behind. So this is an agenda that we would continue to actively participate. We hope that this will be finalized before the end of this year, or maximum during the next WHO.
par ce plaidoyer. Après, le reste va venir. Qu'on vous attrape encore un an. Vous allez partir comme ça. Vous allez nous laisser avec qui? En plus, ils veulent nommer un intérimaire, des trucs comme ça.
Et vous allez faire l'élection en mai, non?
Hein? Ouais, l'élection.
The WHO is a very important organization that member countries belong to, and it belongs to the member countries as well. So we see the WHO as our own. The WHO has been contributing immensely to health service delivery in various countries by providing all kinds of support, technical support, capacity building support, and information, giving us the right information. The Gambia is contributing $50,000 which how it is disbursed will be determined by the finance minister. But yesterday we made the pledge on behalf of His Excellency President Adama Barrow and the people of the Gambia to contribute a token to the activities of the WHO. With the increase in responsibility for the WHO, we sincerely believe that we need to look inwards, in-house, to be able to have a strong, sustainable WHO. Yes, Gambia is a small country. Gambia is a low-income country. We might not have as much, but we have a big heart to contribute to the WHO.
Hello, I'm James Chow. Once again, the World Health Organization is leading the fight against global health challenges and urgently needs our help. To continue its crucial work, WHO needs to raise $7.1 billion to fund the core of its program of work over the next 4 years. This investment will help tackle urgent health crises, reduce inequalities, and promote mental health and well-being. You see, health isn't just one piece of the puzzle, it's the foundation of all sustainable development goals. Healthy people are crucial to ending poverty, achieving quality education, and much, much more. Without robust health systems, every other effort risks falling short. So with more than 2 billion people lacking essential health services, the stakes couldn't be higher. I'm calling on governments, donors, and foundations to invest. You can help too. Your support for WHO isn't just a donation. It's a real commitment to a healthier, more equitable future. And it's a chance to get back on track to meet the 2030 agenda and once and for all to profoundly impact global well-being for every single person.
The World Health Organization seeks to support countries and draw attention to the problem of avoidable harm in healthcare. Healthcare these days is complex, fast-moving, and creates circumstances where errors do happen, even though everybody's trying very, very hard to keep them to the minimum. So a lot has been done by the WHO and the countries in addressing patient safety as a priority in their health system. A lot has been done, but there's more still to do. And that's why it's very important that in its work, the WHO is supported with the finances necessary to get the job done. And this is very much about life and death. The money that's provided helps to save lives, helps to strengthen health systems, and give many more people around the world access to health care, not just any health care, but health care that's safe. So the WHO's patient safety program is doing great work with the member states of the WHO, with the experts, and we're very proud also to have involved patients and families, many of whom have suffered harm in this endeavor. So I'm calling on governments, foundations, donors to support the WHO by donating. If you want to get involved directly, you can see the link below and find out how to get involved and how to donate. But it's very much about health for all for health, and investing in WHO.
Hello, I'm Renee Fleming. The World Health Organization is at the forefront of improving global health, and it needs our support now more than ever. To continue its crucial work, WHO needs to raise $7.1 billion to fund the core of its program of work over the next 4 years. This funding will help WHO tackle urgent health crises, reduce inequalities, support mental health and well-being. With over 2 billion people still lacking essential health services, the stakes couldn't be higher. As WHO's Goodwill Ambassador for Arts and Health, I've seen how important the arts can be in, for example, reducing anxiety and helping improve symptoms and recovery of mental health conditions. Imagine a future where everyone has access to healthcare and where physical, mental, and social well-being are prioritized. I'm calling on governments, donors, and foundations to invest. You can help too. Supporting WHO means investing in a future where everyone can access the healthcare they need. Join us in making a meaningful difference. Act now. All for health, health for all. Invest in WHO.
WHO is leading a global effort to improve health and well-being, but urgently needs your support. To continue its crucial work, WHO needs to raise $7.1 billion to fund the core of its program of work over the next 4 years. Today, over 2 million people still lack access to essential health services. The stakes could not be higher. And we must also prepare for various infectious diseases and unknown illnesses that may arise in the future, because promoting people's health is the foundation of a better life. I am calling on governments, donor agencies, foundations, and you to invest in WHO's mission. Supporting WHO means investing in a future where everyone can access the health care they need. Together, let us strive to create meaningful change in our society as we work toward realizing the vision of health for all.
Conflicts and crises threaten the health and well-being of millions of people. The World Health Organization is an important beacon of hope for some of the furthest behind communities. So that the WHO can respond to all our needs, Ireland has taken a number of steps to increase the volume and the predictability of our funding. We have tripled our contribution since the pre-pandemic period, and I am delighted to announce at least €30 million in financing for the period 2025 to 2028. Thank you.
The relationship between Kuwait Fund and WHO goes back to 1974 through many programs. We have a special relationship with many African countries, and we want prosperity of this continent. And we try to help by many means. Kuwait Fund announced its commitment to contribute $5 million for the years 2024 till the end 2028 for ESPN, which deal with 5 diseases. We were the first financiers, and we consider ESPN as our baby. The whole philosophy is partnership, and we are good at it. We Kuwait Funds are friends in need.
le Niger tire à ce que nos organisations internationales puissent répondre pleinement aux besoins de nos populations. C'est la raison pour laquelle le Niger s'est engagé à investir pleinement dans le cycle d'investissement de l'OMS pour que l'OMS puisse pleinement jouer son rôle, qui est de s'occuper de la santé de la population mondiale. Cet acte, cet engagement qui a été posé par notre pays, c'est un acte fort pour le Niger pour que l'Organisation mondiale de la santé puisse réellement s'occuper de la santé publique d'une manière globale, la santé publique de tous nos États, de tous les États qui sont membres de cette organisation. Le Niger a décidé de contribuer au cycle d'investissement.
Ready?
Good morning, Excellencies, colleagues, ladies and gentlemen. It is with great pleasure that I welcome you and declare the 156th session of the Executive Board open. It is an honor to be chairing this session in my capacity. The fact that I'm from Barbados, one of the WHO's smallest member states, sends a signal as to how important the WHO and global public health is to my small island state. Multilateralism and multilateral institutions are crucial to us all, but especially for the most vulnerable. This Executive Board meeting, at a time where the primacy of global health governance is under severe scrutiny, multilateralism as we know it, particularly in the global health sphere, is under threat, and unrelenting and unforgiving climate crisis heighten the geopolitical tensions as well as conflict within and among countries pose real and lasting risk to global health. Misinformation and disinformation on public health challenges the credibility of the WHO and its ability to build consensus on global health policy and the effective implementation of public health policies at the national level. Misinformation can have serious consequences on our populations who look to the media and increasingly social media for facts. We fail our people when we do not provide accurate information. We are meeting at a time where financing the WHO's global health agenda has demanded our full attention and has hastened the need for us to be creative in developing innovative means of financing, from broadening the donor base and reducing our dependence on a limited number of traditional donors, to challenging the Secretariat to raise more resources through new avenues. We must mobilize financing in a fiscally conservative global environment. Importantly, we need to agree to the next increase of assessed contributions for 2026-2027 by 20%. Without this increase, the objective of raising assessed contributions to cover 50% of WHO's base budget by 2030 will not be guaranteed. We all recognize the need for reform and must acknowledge the progress made thus far by the WHO Secretariat and the discussions under the guidance of the member state leads on governance reform. Colleagues, a compromised or fragmented global health system not only costs lives, but also poses one of the greatest threats to the global economy and global security. The issues before us and the decisions that we make this week will be consequential to the future of WHO as an institution, to global health governance, and to the health of billions of people across the world. We must therefore focus on concrete deliverables that redound to what we envision the WHO to be in the future. An organization that is fit for purpose, sustainably financed, and agile enough to address its program work and any health emergencies that may arise. I was delighted to exchange views with many of you during yesterday's informal meeting of the board. We discussed critical issues confronting the WHO and agreed that whilst the matters before us may not be simple, they are of utmost importance to the future of the WHO. I therefore trust our collective resolve to support WHO's functions and to develop viable solutions for sustainable financing. I will now present a summary of the informal meeting. I would like to take this opportunity to report to you on yesterday's informal meeting of the Executive Board, which I just mentioned. We met for a full day in a relaxed format, and at the outset we considered the outcomes of the PBAC last week and express our appreciation to the PBAC Chair, Dr. Catherine Loftus, for her excellent stewardship. We also acknowledge that WHO is in a challenging phase after the announcement by the United States of its intention to withdraw from the organization, and recognize the important role of the board in guiding the Secretariat during this time. To this end, we rolled up our sleeves and delved into two main topics. First, we turned to the matter of governance reform and considered the member state-led governance reform process and the proposal that member states discuss in the coming months a more sustainable model for governance reform. We express our deep appreciation for the work of the member state leads on governance reform and agreed it would be important to maintain the momentum on this important issue. We also reflected on agenda management and resolution management, paying particular attention to the financial implications of draft resolutions, including those that the board is expected to consider at its 156th session. Furthermore, we highlighted the challenge of participating meaningfully in the recent negotiations of some 20 or so draft resolutions and discussed whether there might be mechanisms for addressing such a large volume. For example, we discussed how in instances where the objective of a resolution is to raise awareness and for advocacy rather than to create new work streams, other instruments such as side events might be more prudent. While noting that proposing resolutions to the governing bodies is the prerogative of member states, we recognize that future proposals for resolutions could be informed by gap and risk analyses, clear identification of costs, and possible funding sources, priorities as expressed at the country level, and an analysis of linkages to the 14th General Programme of Work. It was also pointed out that the officers of the board might have a role to play in gathering information and having informal discussions about proposals. We discussed how the board might consider requesting the Secretariat to prepare for this week an information document providing an overview of the cost implications and options for addressing the potential challenge of additional activities for WHO in view of the current concerns about financing. In addition, we may wish to request that the Secretariat prepare a paper for our May meeting identifying reforms that have been implemented and others that are needed to help us move forward. Next, we turn to the strategic matters. We discussed the development of the proposed program budget 2026-2027 and the three options which were presented in light of the expected decrease in financing. We noted the PBAC's proposal to decrease the base segment of the program budget for 2026 to 2027 to US $4.9 million, which we will be discussing later today. We also recognize the PBAC's support for the 20% increase in assessed contributions and how such an increase constitutes a logical step in the sustainable financing journey. This would follow on from WHO's first investment round, which was launched last year. Several possible approaches to innovative financing were discussed, including a WHO endowment fund. There was a common understanding that WHO is in a difficult situation and that our consideration of the budget and on WHO reform could not be business as usual. In response, WHO would pursue the twin goals of resource mobilization and efficiency gains. In our discussions, we highlighted the need for WHO to improve its communications activities, including in country offices. We also noted that other avenues would also be explored in order to broaden the donor base and improve the quality and sustainability of funding. All in all, we had a very positive day of exchange and getting to know each other better. I would like to thank the members of the board for coming out on a Sunday afternoon ahead of a week and a half of intense discussions, as well as for their frank and active engagement that will surely contribute positively to the work before us. It is my pleasure to welcome all executive board members and their alternates and advisors. I would also like to cordially greet representatives of member states, observers, the United Nations, various United Nations bodies and specialized agencies, other intergovernmental organizations, and non-state actors in official relations with WHO, whose participation is further evidence of the close relations between WHO and these organizations. Finally, welcome to our Secretariat colleagues who are following and supporting the deliberations of this meeting. Let us now turn to the consideration of the agenda for this session of the board. In accordance with the provisions of the rules of procedure, the board has before it this session's provisional agenda contained in documents EB 156/1 and EB 156/1 annotated. In accordance with Rule 8 of the Rules of Procedure of the Executive Board, the officers of the board met with the Director General on 8th of October 2024 to review the draft provisional agenda of the 156th session of the board that had been circulated to member states on July 2nd, 2024. Proposals received from member states by the deadline of the 24th of September 2024 were considered, and the provisional agenda was agreed by the officers of the board. At this time, I would like to propose the deletion of the following agenda items, as I understand they are not needed. Sub-item 23.3, Scale of Assessment 2026 to 2027. Sub-item 23.4, Amendments to the Financial Regulations and Financial Rules. Sub-item 26.2, Independent Expert Oversight Advisory Committee Membership Renewal. These items are included systematically on the agenda in case they are needed. In this instance, they are not needed. May I take it that the proposals are acceptable? I see no objection. It is so decided. Are there any further comments on the provisional agenda? I see none. Thank you. The agenda is therefore adopted. I give the floor to Poland.
Thank you, Mr. Chair, Director General, members of the Executive Board, dear colleagues. The European Union works closely with the World Health Organization on a wide range of subjects, both within the European region and on a global level. As agreed in the exchange of letters of the year 2000 between the WHO and the European Commission concerning the consolidation and intensification of cooperation, and without prejudice to any future conclusion of a general agreement between the WHO and the European Union, the European Union delegation attends the meetings of the Executive Board as observer. As in previous EB meetings, we ask the Executive Board to kindly agree that the European Union delegation is also invited to attend and participate without vote in the deliberations of the meetings of its committees and subcommittees, drafting groups or other subdivisions thereof, addressing matters falling within Union competence in the 156th session of the Executive Board. I thank you.
Thank you very much. I understand that this is a usual practice in the Executive Board. Dear colleagues, do you agree to proceed in this way? I see no objections. Thank you. As you know, the EB 156 has a heavy agenda with 47 items and sub-items and approximately 38 draft resolutions and decisions to be considered. All participants are encouraged to be concise when taking the floor. I would like to request that statements focus on the guiding questions provided in the reports prepared by the Secretariat. We will also have these guiding questions projected on the screen during our discussions. With that in mind, EB members are encouraged to limit their interventions to 3 minutes. Individual statements by all member states not represented on the board and associate members will be limited to 2 minutes. Statements by observers, invited representatives of United Nations aid and other participating intergovernmental organizations, and non-state actors in official relations with WHO will be limited to 1 minute. Regional and group statements will be limited to 4 minutes. I would like also to inform you that as agreed, constituency statements by non-state actors in official relations will continue during this meeting and will be provided on the following selected agenda items. Item 6, universal health coverage. Item 12, health and care workforce. Item 15, WHO's work in health emergencies. Item 18, universal health and preparedness review. Item 22, climate change and health. Item 24.2, governance reform, involvement of non-state actors in WHO's governing bodies. Constituency statements delivered on behalf of a group of several NSAs will be limited to 3 minutes and will be delivered after all EB members, intermingled throughout the discussion and among statements by member states not represented on the board. In order to help speakers observe the time limits, I have asked the Secretariat to keep in place some of the innovations introduced by the PBAC chair last week, namely to provide a chime when the traffic lights change from green to yellow, and again when it changes from yellow to red. Though I don't anticipate the need to cut anyone's microphone, there is a possibility of doing so with any statements that run well beyond the time limits. When we move to the agenda items considered last week by PBAC, I propose to build on the good work of that committee by focusing our discussion on the PBAC report and its recommendations, rather than having another full discussion of each of the documents. May I take it that these proposals are acceptable? I see no objection. It is so decided. Let us now review the preliminary daily timetable contained in document EB 156/2. It is proposed that the board meet this morning until 12:30 and then this afternoon from 14:30 hours to 17:30 hours. On each of the remaining days, I propose that we meet from 10 to 1 and from 2:30 to 5:30. This morning, following the conclusion of item 1, the board will consider item 2, report by the Director General, which will be followed by item 3, report of the regional committees to the Executive Board, and item 4, report of the Program Budget and Administration Committee of the Executive Board. The board will then turn to item 24, management and governance matters, and take up sub-item 24.2, governance reform, which includes 5 bullet points. I propose that we discuss the first 3 bullet points together and then have a separate discussion on the last 2 bullets. Following the discussion on governance reform, I propose that we take up sub-item 23.1, financing and implementation of the program budget 2024 to 2025, followed by sub-item 23.2, proposed program budget 2026 to 2027. Tomorrow, Tuesday, the 4th of February, at 10 a.m., I propose that the board take up Pillar 1 items. In the afternoon, we will return to item 27, staffing matters, and consider items 27.1 and 27.2 in a private meeting concerning the appointment of the Regional Director for Africa and Europe regions, respectively. I would like to remind you that the private meeting is held in compliance with Rule 7 of the Rules of Procedure of the Executive Board, which means that members of the board, their alternates, and advisors can attend, and that member states not represented on the board and associate members can send 1 representative each without the right to participate, and that the Secretariat's attendance will be limited to essential staff only, and that no official record shall be made. Do I take it that the board agrees with these proposals? As I see no objection, it is so decided. When delivering statements, I would like to remind delegates to speak at a moderate speed that allows for its interpretation and ensures their message is conveyed clearly and accurately. Please send a copy of your written statements in advance to the email address interpret@who.int at least 30 minutes in advance of delivery. This does not prevent you from making changes on delivery, but will facilitate clarity and accuracy in all languages. If you would like your statement to be posted on the WHO website, or if you have a longer statement with supplementary information you would like to share, you may send it to the email address statements@who.int. Please be reminded that written statements will not be included in the summary record of the meeting. Are there any comments before we proceed? I see none. Thank you. I see none. Thank you. Finally, I would like to remind board members that in accordance with Rule 32 of the EB Rules of Procedure, proposals for resolutions or decisions to be considered by the board relating to items of the agenda should be introduced at least 15 days before the opening of the session, and may in any event be introduced not later than the close of the first day of the session, and these should be sent to Governance Unit at who.int by 6 p.m. today. Before moving to the next item, I understand that we will receive comments from the Office of the United Nations Secretary General, delivered by Deputy Secretary General Amina Mohammed. Thank you.
Excellencies, ladies and gentlemen, my dear brother Tedros, as we gather at a defining moment for global health and the world faces escalating threats on many fronts, geopolitical tensions, deepening inequalities, climate shocks, and the erosion of multilateralism. In these trying times, the entire United Nations stands in support of the World Health Organization and its mandate to promote, provide, and protect health in every country around the globe. Global health needs are expanding. Conflicts, disease outbreaks, and demographic shifts, which are stretching diminished resources to their limit. Whether responding to deadly disease outbreaks like Ebola, Marburg, cholera, or measles, in violent conflict or disasters mobilizing in humanitarian crises, or in the face of COVID and other pandemics, WHO is there. deploying life-saving resources, coordinating international response, and providing its unparalleled technical expertise where it is needed most. Excellencies, WHO's role extends far beyond crises and emergencies. As the world's leading public health authority, it is the guardian of global health, setting standards, coordinating international responses, and ensuring that people everywhere, no matter where they live, have access to the care that they need. Yet we know that there is still much more to do. The outcomes of the 2023 General Assembly high-level meetings on universal health coverage, antimicrobial resistance, and pandemic preparedness have strengthened our collective resolve. And in September, member states came together and agreed on the Pact for the Future, reaffirming that investing in health is investing in people, economies, and the planet. Now, the real test is implementation. This is where the UN development system, including our resident coordinators and our UN country teams, play a critical role, turning global commitments into action on the ground, in communities, and in the lives of those who need it most. With the 2030 deadline for Sustainable Development Goals fast approaching, our resolve must be stronger than ever. This is the decade of action, and the countdown is on. Health is the foundation of sustainable development. Without strong health systems, we cannot end poverty, advance gender equality, or protect our planet. There is no option B. Investing in health and in a resilient WHO is an investment in a prosperous, healthy, and a safer world for today and generations to come. I wish you fruitful deliberations. Thank you.
Thank you. This concludes our consideration of agenda item 1. Let us now consider item 2 of our agenda, report by the Director General contained in document EB 156/2. It is now my pleasure to give the floor to the Director General, Dr. Tedros Ghebreyesus. Dr. Tedros, you have the floor.
Thank you, Chair. Honorable Chair, Dr. Jerome Wolcott, honorable ministers, dear colleagues and friends. Good morning, Happy New Year, and welcome once again to your WHO headquarters. As you know, for me, 2024 ended with a narrow escape in Yemen when the airport in Sana'a was attacked while I was there, waiting for my flight home. I think starting your year with that is not funny. And I want to express my heartfelt gratitude to each of you who reached out with calls and messages of support. Your kindness provided comfort during such a frightening moment. My email, my WhatsApp, all actually, my accounts were flooded. So that just wanted to express my gratitude to you, and also I thank God for sparing me. I was fortunate, but it was a reminder of the threat that so many people live with every day in dangerous situations around the world, including many of my WHO colleagues, the UN colleagues, and humanitarian at large. For them and for WHO as a whole, 2024 was a year of significant challenges. It was also a year of significant milestones. At the World Health Assembly in May, member states approved our new global health strategy, the 14th General Program of Work, with an ambitious target to save 40 million lives over the next 40 years, over the next 4 years. You also approved a historic package of amendments to the international health regulations, and you agreed to conclude negotiations on the WHO pandemic agreement in time for next World Health Assembly. In November, we also concluded the first WHO investment round, which helped to mobilize half of the resources we need to implement GPW14 over the next 4 years. And in December, I joined President Macron to officially open the WHO Academy in Lyon, a major step towards making WHO an organization that delivers an impact in countries. There were also many achievements to celebrate in our threefold mission: promote, provide, and protect health. First, our mission to promote health and prevent disease by addressing its root causes. As you know, non-communicable diseases account for 7 of the top 10 causes of death globally, including cardiovascular disease, diabetes, cancer, and chronic respiratory disease. One of WHO's key focuses is addressing the risk factors for NCDs in the food people eat, the air they breathe, the roads they use, and the products they consume, including tobacco, the world's leading cause of preventable death. This month marks the 20th anniversary of the entering into force of the WHO Framework Convention on Tobacco Control. Over the past 2 decades, thanks to the WHO FCTC and the Empower technical package that supports it, smoking prevalence has dropped by 1/3 globally. Last year, Georgia, Laos PDR, and Oman introduced plain packaging on tobacco products. With WHO support, Vietnam prohibited e-cigarettes and heated tobacco products. And through the partnership in the Tobacco-Free Farms Initiative, we have supported more than 9,000 tobacco farmers in Kenya and Zambia to shift away from growing tobacco to growing high-iron beans. Another key focus is addressing the drivers of disease in the diets people eat. In 2024, Lebanon, Mauritius, and Nepal passed best practice policies on trans fat elimination. 34 countries have now joined the acceleration plan to stop obesity, representing 1/3 of the global population with obesity. We published a new guideline on wasting and supported 14 countries with the highest burden to implement it. We're also seeing progress in preventing deaths and injuries from drowning, road traffic crashes, and violence. We're integrating behavioral science into more areas of our work. And we continue to support countries to build climate-friendly and climate-resilient health systems. We have mobilized $150 million to support low and middle-income countries to protect the health of their people from climate risks. And at COP29 in Azerbaijan, we signed an agreement to keep health at the heart of climate negotiations. Second, our mission to provide health by expanding equitable access to health services. As you know, more than half the world's population lacks access to one or more essential health services. And 2 billion people face financial hardship by paying for care out of their own pockets. To address these gaps, we're working through the UAC partnership to support 125 countries in all 6 regions on the road towards universal health coverage. Last year, we provided support to 28 countries to develop packages of services for universal health coverage, including 8 countries with humanitarian crisis. And we are supporting countries to expand health services to refugees and migrants. Ireland and Panama integrated refugee and migrant health into national health care plans. Uganda provided a comprehensive health package to 1.6 million refugees. And Colombia issued health insurance cards to 1.5 million migrants. Just as we work to expand access to health services, so we are working to expand access to medicines and health products and to strengthen regulatory authorities around the world. We recognize Egypt, India, Rwanda, Senegal, and Zimbabwe for achieving or maintaining maturity level 3 for regulatory oversight of medicines and vaccines. As WHO-listed authorities, making them regulators of reference that meet internationally recognized standards and practices. We have now listed 36 regulators since we launched the program 3 years ago. In 2024, we pre-qualified 87 medicines and other products and performed more than 150 inspections of manufacturing sites. We launched a new platform with information on 2,000 types of medical devices, which countries are using to select devices for health interventions, procurement, or national reference lists. We issued 5 alerts on substandard and falsified medicines. And we selected 481 non-proprietary names for active pharmaceutical ingredients. The International Non-Proprietary Name Program is one of those things that WHO does that no one else can do, and that very few people know about, but is relevant to all countries. Standardized names for pharmaceutical ingredients are absolutely essential for patient safety, global trade, tracking and tracing medicines, combating counterfeits, increasing access, research, and more. It's not glamorous, but someone has to do it, and that someone is WHO. And it's helping to increase access to life-saving tools, including vaccines. On antimicrobial resistance, the UN high-level meeting on AMR resulted in strong commitments and targets. The number of countries reporting data on antimicrobial resistance, on antimicrobial use to WHO has tripled from 36 in 2021 to 98 in 2024. And countries are adapting our aware recommendations on antibiotics. Nepal, for example, has banned the use of antibiotic combinations that WHO classifies as not recommended. We also supported full implementation of surveillance for antimicrobial resistance, gonorrhea, in 13 countries. In Cambodia, implementing WHO guidelines reduced gonorrhea treatment failure from 11% to 0. We also developed the first guidance on wastewater and solid waste management for manufacturing of antibiotics. Already we have trained inspectors in 52 member states, and the AMR Industry Alliance updated its standard to align with WHO guidance. Last year, we celebrated the 50th anniversary of the expanded program on immunization. When EPI was launched in 1974, less than 5% of the world's children were immunized. Today, that figure stands at 83%. I would like to pose and ask you one question here. Do you know the Director General who started the EPI program? No? It's Mahler. So just wanted to underline that. EPI has been the single biggest contributor to infant and child survival globally, preventing 154 million deaths, an average of 8,000 a day for 50 years. And we continue to support countries to introduce new vaccines to save lives. In 2024, 4 new countries introduced HPV vaccines. Niger and Nigeria became the first countries to implement the new MEN5CV vaccine, meningitis vaccine. We pre-qualified a new vaccine against dengue, and we supported the rollout of more than 12 million doses of malaria vaccine in 17 countries in Africa. Meanwhile, we're living in a golden age of disease elimination, with more and more countries liberating their people from malaria, trachoma, leprosy, lymphatic filariasis, and more. Last year, we certified 7 countries for the elimination of neglected tropical diseases: Brazil, Chad, India, Jordan, Pakistan, Timor-Leste, and Vietnam. And just last week, we certified Guinea for the elimination of human African trypanosomiasis, and Niger for the elimination of onchocerciasis. Last year, only 11 human cases of guinea worm disease were reported from just 8 villages in Chad and South Sudan. Ghana approved a new treatment for river blindness, which was developed through 2 decades of collaboration between TDR, researchers, WHO country offices, and medicines development for global health. We also certified Capo Verde and Egypt as malaria-free, and already this year, Georgia has reached the same status. Belize, Jamaica, and St. Vincent and the Grenadines were validated for the elimination of mother-to-child transmission of HIV and syphilis. And we validated Namibia for being on the path to elimination of mother-to-child transmission of HIV and hepatitis B. For the first time, TB treatment coverage has now reached 75% globally. 79 countries have achieved at least a 20% reduction in incidence, and 43 countries have achieved at least a 35% reduction in TB deaths. And on mental health, we're working with UNICEF in 13 countries in all 6 regions, reaching 270,000 children, adolescents, and caregivers with care services. On maternal and child mortality, progress is less encouraging. After substantial improvements during the MDG era, progress has stalled. We continue to work with member states to identify the barriers and to give them the tools to overcome them. For example, to increase uptake of family planning practices, we developed a protocol to rapidly assess bottlenecks, which 27 countries are now implementing. We published a new guideline on neonatal sepsis, and we're supporting countries to implement it. And we launched guidance on midwifery models of care, which has been shown to reduce emergency cesarean section, preterm birth rates, and admissions to neonatal intensive care. Over 90 countries have developed acceleration plans to reduce maternal and newborn mortality and prevent stillbirths. Tanzania opened 30 new care units for newborns, while Pakistan, Ghana, Sierra Leone, and Malawi are also making progress. We have come a long way on maternal and child mortality, but we still have a long way to go to reach the SDG targets. For World Health Day this year, we have chosen maternal health as our theme to draw attention to the need for all countries and partners to work together and prevent these preventable diseases. Now to the third pillar of our mission, supporting countries to protect health by preventing and responding rapidly to health emergencies. In 2024, we responded to 50 graded emergencies around the world: conflicts, outbreaks, natural disasters, and more. This included delivering $48 million worth of supplies to 78 countries. We helped bring cholera outbreaks under control in 27 of 33 affected countries, leaving only 6 in an acute phase. With WHO support, Rwanda controlled an outbreak of Marburg virus disease. And as we speak, we're responding to outbreaks of Marburg in Tanzania and Ebola in Uganda, where Deputy Director General Dr. Mike Ryan has traveled to oversee the response. And as you know, in August last year, I declared a public health emergency of international concern over the outbreaks of Mpox in the DRC and other countries in Africa. Although the number of reported cases has been stabilizing in DRC, the worsening security situation has led to many patients leaving treatment centers, increasing the risks of high transmission. In response to the outbreak, WHO gave emergency use listing to the first Mpox vaccines and tests and established an access and allocation mechanism which coordinated donations of 6 million vaccine doses across 15 countries. About 500,000 doses have been delivered, and a further 1.7 million doses will soon be available. We also provided supplies to laboratories in 136 countries to quality assure their capacity for diagnosing Mpox. About 70,000 people have been vaccinated, mainly in DRC, and resource limitations in the affected countries which face multiple competing health priorities have limited the speed and scale of vaccination. The other main part of WHO's emergency response work last year was responding to conflicts and insecurity in Gaza, Haiti, Lebanon, Sudan, Ukraine, and elsewhere. We're very pleased to see that the ceasefire agreement in Gaza is holding, and we very much hope it becomes a lasting peace. Our priorities are to meet acute health needs, support the operation of hospitals and primary care facilities, and transport patients within and out of Gaza for specialized care. Since the ceasefire began, WHO has sent 63 trucks with supplies, and 30 more should arrive in the coming days. We provide 60% of all the medical supplies and 100% of the fuel for hospitals and emergency medical facilities. In total, during the conflict, we coordinated the deployment of 52 emergency medical teams from 26 organizations, which conducted over 2.4 million medical consultations, performed more than 36,000 emergency surgeries, and treated almost 86,000 trauma cases. And together with our partners, we negotiated a humanitarian pause and prevented a resurgence of polio by vaccinating more than 550,000 children. We can only hope that 2025 also brings an end to the conflicts in Sudan and Ukraine. In Sudan, an estimated 32,000 people have been killed, 30% of the population is displaced, and 20 million people need humanitarian aid. I visited Sudan in September, where I saw the effects of civil war and met people who are paying the price. The following week, I was in Chad, where I traveled to the border town of Adre and met some of the 900,000 Sudanese refugees who fled, seeking security and food. And they're just a fraction of the 122 million people globally who have been forced to flee their homes. In Gaza, Lebanon, Sudan, Ukraine, and elsewhere, we continue to see attacks on healthcare, which are becoming a new normal of conflict. Last year, we verified more than 1,500 attacks on healthcare in 15 countries and territories, with 932 deaths and 1,767 injuries. It's frustrating that almost no one is ever held to account for these violations of international law. So with our partners, we launched a new report last year with 9 recommendations for bringing to account those who perpetrate attacks on healthcare. We urge member states to implement these recommendations. Of course, responding to emergencies is just one part of our work. In response to the lessons learned from COVID-19, WHO has strengthened its work in every dimension of emergency prevention, preparedness, and response. Every day, we scan the world for public health threats. Last year, we assessed more than 1.2 million potential signals. And through the WHO Hub for Pandemic and Epidemic Intelligence in Berlin, we're supporting countries to strengthen their capacities in genomic surveillance. The International Pathogen Surveillance Network, established in 2023, now includes 230 organizations in 85 countries. We supported 19 countries to complete joint external evaluation, with another 21 scheduled for this year. And 3 countries completed pilot studies of the Universal Health and Preparedness Review. In addition to these general preparedness activities, we are also supporting countries to prepare for specific threats, including Ebola. Ebola outbreaks are often fueled by nosocomial transmission. So with Gavi, we vaccinated 150,000 health workers in 6 countries against Ebola, the first time this has happened outside of an outbreak response to prevent any future outbreak. We also supported the vaccination of 53 million people against yellow fever in 5 countries. And we have monitored carefully the concerning spread of avian influenza among dairy cattle in the United States. Through the Global Influenza Surveillance and Response System, GISRIS, we facilitated sharing of more than 100 zoonotic flu samples with WHO collaborating centers last year, and uploaded 525 influenza genetic sequence to publicly available databases. And we recommended 9 new zoonotic candidate vaccine viruses available globally to manufacturers to produce vaccines in case of an influenza pandemic. Honorable ministers, dear colleagues and friends, all of this work to promote, provide, and protect health is supported by our efforts at all 3 levels of the organization on the 4th and 5th piece of GPW 14 to power and perform for health through science, digital technologies, data, and our ongoing transformation. Last year, we conducted a review of our transformation to see what has worked and what has not. Based on the review, we have reprioritized transformation and aligned it with priorities of GPW 14. One of the successes of transformation has been the establishment of the Science Division. WHO's normative standard setting work is its bread and butter, as you know, and the Science Division is helping us make sure we give member states the highest quality, evidence-based advice as fast as possible. Last year, there were 65 million downloads of WHO publications, guidance, and other materials. We launched important new guidelines on avian influenza, artificial intelligence, tobacco cessation, mpox diagnostics, and so much more. Starting this year, we are aligning our guidelines and normative work with pre-qualification, meaning we will pre-qualify a product and issue guidelines on how to use it at the same time. This will speed up equitable access to proven interventions and increase investments from the public and private sectors as the systems will become more transparent and predictable, completed within a 12-month period. The first product under this new process will be lenacapavir, an exciting new medicine for the treatment and prevention of HIV. Although a true HIV vaccine remains elusive, lenacapavir is the nearest thing we have to it. A new injectable antiretroviral taken every 6 months that has been shown to prevent almost all HIV infections in those at risk. We have initiated the guideline and pre-qualification processes in parallel, which will support the rapid rollout of this product, which we expect in the first half of this year. Another success of transformation has been our increased focus on digital health, which will underpin health systems in every country in the very near future. Last year, the Global Digital Health Certification Network enabled Oman, Indonesia, and Malaysia to issue 250,000 international patient summaries for 2024 Hajj pilgrims, supporting emergency care for 78% of scanned records. The network now covers 82 countries, benefiting nearly 2 billion people. And I thank EU for the support in this. Another key element of our transformation has been our focus on data. We created the World Health Data Hub to make health data available to anyone, anytime, using digital technologies, including artificial intelligence. Every country in the world now accesses the hub, which is a secure and standardized pathway to increased transparency, accountability, and progress. Honorable ministers, dear colleagues and friends, as you know, 2 weeks ago, President Donald Trump signed an executive order announcing his intention to withdraw the United States from WHO. We regret the decision, and we hope the US will reconsider. We would welcome constructive dialogue to preserve and strengthen the historic relationship between WHO and the USA that helped bring significant impacts like the eradication of smallpox, and I can give you a long list. The executive order gave 4 reasons for the decision to withdraw from WHO. First, it says that WHO has failed to adopt urgently needed reforms. As this board is aware, over the course of the past 7 years, under the guidance and governance of member states, WHO has implemented the deepest and most wide-ranging reforms in the organization's history. The WHO transformation has touched every part of our work, our strategy, operating model, processes, partnerships, financing, workforce, and culture. We have also taken action on the recommendations of the Agile Member States Task Group. We have implemented 85 of the 97 reforms proposed in the Secretariat Implementation Plan on Reform, or SIP. And we're implementing the recommendations of the Action for Results group led by WHO representatives to strengthen our country offices. For us, as we always say, change is a constant. And that's what our member states told us when we started the reform. Change is a constant. We believe in continuous improvement. And we would welcome suggestions from the United States and all member states for how we can serve you and the people of the world better. So although we are doing a lot of reform, but additional is welcome. Second, the order says that WHO demands unfairly onerous payments from the US out of proportion with what other countries contribute. Member states understand how assessed contributions are calculated. And you know, some countries choose to make higher voluntary contributions than others. Addressing the imbalance between assessed and voluntary contributions and reducing WHO's overall reliance on a handful of traditional donors has been one of the major areas of transformation. Because when we started the transformation, reliance on few traditional donors was identified as a risk. And we have decided then, 7 years ago, to broaden the donor base. Last week, the PBAC recommended the next 20% of increase in assessed contributions, and we asked this board to endorse that recommendation. This is a critical element of our long-term plan to broaden our donor base and will, over the long term, reduce the burden of financing from traditional donors, including the US. We therefore continue to seek the support and engagement of all member states, including the US, for our shared vision to put WHO on a more sustainable financial footing. Third, the order refers to WHO's alleged mishandling of the COVID-19 pandemic and other global health crises. Last week marked 5 years since I declared a public health emergency of international concern. On the 30th of January 2020, and at the time, outside of China, there were fewer than 100 reported cases and no reported deaths. On New Year's Eve 2019 and New Year's Day 2020, when much of the world was on holiday, WHO was not. I think you remember that. From the moment we picked up the first signals of viral pneumonia in Wuhan, we asked for more information, activated our emergency incident management system, alerted the world, convened global experts, and published comprehensive guidance for countries on how to protect their populations and health systems, all before the first death from this new disease was reported in China on the 11th of January 2020. Of course, there would be challenges and weaknesses, and there have been multiple independent reviews of the global response to COVID-19 with more than 300 recommendations to address the challenges or the weaknesses. In response to those recommendations, WHO and our member states have taken many steps to strengthen global health security, the Pandemic Fund, the WHO Hub for Pandemic and Epidemic Intelligence, the mRNA Technology Transfer Hub, the Global Training Hub for Biomanufacturing, the Global Health Emergency Corps, the Interim Medical Countermeasures Network, and more. So all this has been established based on the lessons learned. And as I mentioned earlier, member states have committed to concluding negotiations on the pandemic agreement in time for this year's World Health Assembly. Finally, the executive order says WHO has an inability to demonstrate independence from the inappropriate political influence of our member states. As a UN agency, WHO is impartial, and exists to serve all countries and all people. Our member states ask us for many things, and we always try to help as much as we can. But when what they ask is not supported by scientific evidence or contrary to our mission to support global health, we say no politely. And you have seen me doing that many times. As member states know, that's what we have done on several occasions to countries of all income levels in all regions. Honorable ministers, dear colleagues and friends, even before the US announcement, WHO is facing a shortfall due to the economic difficulties that many countries are facing. For many months, the regional directors and I, with the support of senior management, had been working with twin strategic goals: to mobilize new resources and to tighten our belts. The US announcement has made the situation more acute, and we have announced a set of measures with immediate effect to protect our workforce to the greatest extent possible. We're conducting a strategic alignment of resources with activities. We're freezing recruitment except in the most critical areas. We're significantly reducing travel expenditure, and we're looking to renegotiate major procurement contracts and reduce capital investments. More measures will be announced in due course. Our main objective is to protect our most important asset, our people, the dedicated, talented professionals who today are working around the world to help the people we serve to breathe clean air, eat healthier diets, drink safer water, and use safer roads. And they are working to help people get the safe, quality health services and products they need, where and when they need them, without worrying about what it will cost. And they're working to stop outbreaks and deliver life-saving care in the most difficult and dangerous situations. In short, they're committed to promoting, providing, and protecting health. And I'm proud to call them my colleagues. And together, we remain committed to the vision that you, our member states, had almost 77 years ago. The highest attainable standard of health, not as a luxury for some, but a right for all. I thank you.
Thank you, Dr. Tedros. The floor is now open for discussion. Kindly raise your nameplate should you wish to take the floor. You said Cameroon? Cameroon. You said Cameroon. Start with who? I give the floor to Brazil.
Mr. Director General, Mr. Chair, members of the Executive Board. In this challenging year, Brazil reaffirms its traditional position in support of multilateralism as a fundamental driver for the well-being of our people. In this regard, we emphasize the need for sustainable and predictable funding for WTO. Brazil hosted an event on WTO's investment round during the G20 Leaders Summit last November. During Brazil's G20 presidency, health ministers endorsed the creation of the Global Coalition, a strategic initiative to foster innovation and local and regional production necessary for the development and access to health technologies. Brazil will propose a following upside event on the coalition during WHA. In this regard, we commend South Africa for this year's G20 presidency and for the priorities outlined, which are closely aligned with Brazil's vision for health. Mr. Director General, we must prioritize in our countries equitable, integrated, and high-quality health services based on digital technology and the continuously trained and retaining the health and care workforce. Additionally, we must strengthen social participation as they understand the reality of the most vulnerable population. The Brazilian Universal Health System highlights its family health strategy, and we can support the Secretariat in prioritizing this agenda. We must work together on all the topics we will discuss in DZB, including discussion on UHC, non-communicable disease, health emergency PPR, climate change, health and care workforce, mental health, and strengthened regulation on the digital marketing of breast milk substitutes. Brazil is committed to climate and health agenda, and during our G20 presidency, ministers agreed on the historic health ministerial declaration on climate change, health and equity, and on One Health. The Brazilian Minister of Health will emphasize the discussion at COP30 and during a side event on WHA. The current Brazilian strategy puts together universal access, local production and innovation, and climate change placing health as a key area of sustainable development. Finally, I want to emphasize the Brazilian commitment with peace, science, democracy, sustainable development, and health as a human right. Thank you very much.
Thank you, Brazil. I now give the floor to sorry, I just saw Senegal. No, I'm seeing Canada. Sorry, I now give the floor to Canada to be followed by China.
Thank you very much, Chair. Thank you very much, Dr. Tedros, for your comments. The WHO is central to the global health architecture and serving a core role of stewarding multilateral cooperation in health and convening member states to set the common ground of global health agendas grounded in science and evidence. The world needs an effective, accountable, inclusive, and well-governed WHO, and we are here with you to support these efforts. Indeed, the hard work over recent years to strengthen organizational integrity, transparency, and accountability is recognized, and this must be maintained. Reform of the organization, of any organization, never stops. Workplace well-being is essential, as it is in any organization, and an organization's future success are predicated on this. There's a reason why we're all advised to put on oxygen masks first before helping others. To fellow member states, we are here to return to first principles. We're here to strategically guide the organization so it can implement the direction and priorities we set and deliver what we want it to do. This should be driving our actions and our interventions. We have an imperative to continue to work on giving the organization a single set of clear instructions. Splitting our energies across multiple resolutions doesn't help us. This may drive the work forward on specific issues, but is leading to a piecemeal approach, putting additional competition on resources and undermining the drive for efficiency gains. And yet, these resolutions are all rightly premised on the same fundamental approach: promotion, prevention, treatment, rehabilitation, palliation, delivered on partnership with our communities, guided by strong evidence, and implemented via primary healthcare approaches in strong health systems. Let us continue to give our overall guidance and signal our priorities in a consolidated fashion as possible through our core governance documents of the GPW and program budget. Thank you.
Thank you, Canada. I now give the floor to China to be followed by Chile.
Thank you, Chair. Dear colleagues, the Chinese delegation wishes to thank the DG for the report. We commend the Secretariat for its long-standing efforts in coordinating global public health emergency responses, advancing UHC, and promoting governance reforms at the WHO. Diseases know no borders. Humanity constitutes a close community of shared future. At the national, regional, and global level, we must jointly shoulder the responsibility of safeguarding global health security. At present, the gap between developed and developing countries in accessing equitable and affordable health services remains significant. The most vulnerable populations still face many difficulties in obtaining essential health services. In this regard, China has always firmly supported the multilateralism and the WHO in playing a central leading role in advancing health equity. Simultaneously, it is hoped that the WHO Secretariat further enhances its work efficiency, focuses on its core responsibilities, continuously improve transparency and accountability, increase the representation of developing countries with more efforts, and involve more experts from these nations in WHO's work. Additionally, China hopes that the WHO can further define performance indicators for the cost effectiveness in the use of member states' contributions and promote member states-led, more open, transparent decision-making so as to better advance the health sector in developing countries and to ensure the timely achievement of health-related goals of the 2030 SDGs. China is willing to continue strengthening communication cooperation with all parties, further improve governance and reform process of the WHO, and advance the building of inclusiveness and equity of global health, and advance the building of a community of shared future for the human health. Thank you.
Thank you, China. I now give the floor to Chile, to be followed by Ukraine.
Thank you very much, Chairman. Chile is grateful to be able to participate in this session of the WHO Executive Board and be part of a dialogue on the global health challenges which we all face. Our government supports the work being done by the World Health Organization as the guardian of global health. And we would like to underscore the importance of international cooperation, which is fundamental for the well-being and full development of individuals. We would like to reiterate our commitment not to leave anyone behind and put all our abilities available to the organization to tackle communicable diseases, non-communicable diseases, expand universal health coverage, and refer to and tackle or help to tackle emerging challenges and international health emergencies. We recognize the need to adapt the governance of the World Health Organization to current changes. We appreciate the work the organization has been doing on this and the transparency in respect of necessary reforms. Chile would like to reiterate support to multilateral dialogue and health policies to support the health of all individuals wherever they may be. Thank you.
Thank you, Chile. I now give the floor to Ukraine, to be followed by the Maldives.
Thank you, Chair, for the floor. Chair, Directors General, Excellencies, colleagues. On behalf of Ukraine, I would like to express my sincere gratitude for the critical priorities highlighted in your report. We are deeply concerned about the potential impact of possible changes to WHO's membership and funding structure, and remain mindful of the broader consequences for global health initiatives. Since the Russia full-scale invasions of Ukraine, WHO actions implemented in close collaboration with key partners have played a crucial role in emergency response, humanitarian aid, and strengthening the resilience of Ukraine's healthcare system. These efforts have been both visible and effective, and for this we are profoundly grateful. Dr. Tedros, Ukraine continues to fight for its future. The ongoing war affects millions of lives, making WHO's unwavering support essential in ensuring access to medical care and preserving human capital. This support is not only vital for Ukraine, but also for stability of the European region and global health security. It must be continued. At the same time, Ukraine remains committed to rebuilding its medical infrastructure and restoring the healthcare sector. A process is already underway in partnership with the international community. Even after the war ends, sustained collaboration will be necessary to ensure long-term recovery and resilience. Thank you, Dr. Tedros, for your leadership, your dedicated and your steadfast support for Ukraine. Thank you so much.
Thank you, Ukraine. I give the floor now to Maldives, to be followed by Cameroon.
Honorable Chair, Director General, Excellencies, distinguished delegates, the Maldives extends its sincere appreciation to Director General Dr. Tedros and his team for their insightful report and steadfast leadership in addressing global healthcare challenges. The past few years have been turbulent, presenting unprecedented challenges to global health and the WHO, from the COVID-19 pandemic to the multiple health emergencies against a backdrop of geopolitical tensions. Despite these difficulties, the WHO has not only supported member states, but also effectively implemented much-needed organizational reforms. The reorientation of WHO programming through successive general program work initiatives has been pivotal. The Maldives is encouraged by the prioritization of critical areas under GPW 14, including climate change and health, mental health, health emergencies, injury prevention, and health equity. These areas are particularly important for small island developing states like the Maldives. Guided by GPW and aligned national, regional, and global policies, the Maldives has made significant strides toward health equity, ensuring no one is left behind. Given the geographic isolation of our island communities, accessible healthcare closer to home is paramount. Our primary healthcare initiative shows great promise as PHC remains the foundation for achieving universal health coverage and strengthening health systems. Despite these achievements, significant challenges remain. Non-communicable diseases, mental health issues, and emerging public health threats continue to strain our fragile health system. Global warming, rising sea levels, and associated flooding contribute to the spread of vector-borne diseases, posing significant threats to our healthcare systems and the well-being of our communities. We urge fellow member states and the WHO to support climate-vulnerable countries in mitigating these climate-related hazards and their impacts. The Maldives welcomes the WHO's strong focus on global health security. As discussions on the pandemic agreement progress, it is essential to ensure inclusivity, prioritize vulnerable populations, and uphold the principles of equity and solidarity. As we participate in the next high-level meeting of NCDs, we recognize the WHO's leadership in tobacco control under the Framework Convention on Tobacco Control and the critical link between tobacco use and the chronic diseases. Recognizing the devastating impact of tobacco on health and communities, especially young people, the Maldives has taken decisive measures, including a comprehensive ban on e-cigarettes. As the WHO and global health face new geopolitical realities, we must remain steadfast in safeguarding the health and well-being of our communities worldwide. The Maldives reaffirms its commitment to achieving our shared vision for global health. Through concerted action, resilience, and collaboration, we can build healthier populations and stronger health systems for generations to come. Thank you very much.
Thank you, Maldives. I now give the floor to Cameroon, to be followed by Micronesia.
Merci, Monsieur le Président.
Thank you, Chair. Chair, the Republic of Cameroon has the honour of making this statement on behalf of the 47 countries within the African group. We congratulate the Secretariat of WHO for the dynamic work that it does. We also thank the Director General for the comprehensive report submitted to us, and we reiterate our support for him in his endeavours. Chair, the African group wishes to thank the Director General for all of his work and the significant achievements made in the course of 2024. In the wake of the COVID-19 pandemic, health and well-being are of increasing increasing importance today, and the demand for health services is continuing to increase, with calls for a more holistic, inclusive and equitable approach being taken to health. Also appeals to ensure that health and well-being guide humanitarian, economic and development programs. This is particularly important in the light of emerging communicable diseases as well as re-emerging diseases, also the growing burden of neglected tropical diseases, NCDs, hunger and climate change. The ongoing increase in the debt burden in all countries, particularly in sub-Saharan Africa, further compromises the ability of these countries to invest more in their health systems and hinders progress towards achievement of the SDGs by 2030. We note that recent ongoing progress has been made when it comes to technology, digitization and AI. Also behavioral sciences, fundamental sciences, translational sciences, and all of these things provide opportunities to make further improvements and to accelerate progress when it comes to health and well-being for all. Nonetheless, given the differences in digital and health structure between countries, even these new technological advances may deepen inequalities. We recognize and appreciate the leadership of the Director General in making positive progress in the African region, and we thank the DG for having presented to us progress made in the course of the past year with reference to the 5 key pillars. Strengthening primary health care in order to achieve UHC remains important for our region. African member states fully support conclusion of the negotiations on a pandemic treaty. This is something that will be considered by the WHO in May this year. We reiterate the fact that we believe that this treaty should be equitable, focus on innovation and technology, access to medical products, human resources on health and funding and financing issues. Chair, we welcome the proposed programme and budget 2026-27, and we note, however, with concern the significant reduction in the base segment. That being so, we support the 20% increase in assessed contributions, but we very much recommend that budgetary allocations be undertaken in accordance with priorities ranked by countries. There can only be significant achievement in this area if we have close coordination with national health authorities and support for them. This is the kind of approach that will allow us to achieve the goals of GPW 14 while meeting expectations that exists when it comes to all of the work that we are doing. We wish to ensure the Director General of our full support in moving towards achievement of all of the elements of the GPW when it comes to health in accordance with the priorities that have been agreed. Thank you.
Thank you, Cameroon. I now give the floor to Micronesia, to be followed by Barbados.
Honourable Ministers, colleagues, ladies and gentlemen, Federated States of Micronesia thanks and appreciates the report from the DG. It's clear the WHO has made difference and achieved impacts at country level. It takes financial and human resources, access to technology, but more importantly, cooperation among the global family to deliver success. The WHO has been able to uplift countries to reach new heights in reducing mortality, setting standards, controlling deadly outbreaks, making life-saving vaccines affordable, and supporting countries in implementing new guidelines, and the list goes on. This is not to say that the WHO does not need improvement. It's a statement of appreciation for the work of the WHO to stand up for the most vulnerable, responding to outbreaks where country capacity is limited and geographic isolation impedes access. Clearly, the WHO is technically and morally fit for this purpose. In the coming days, the WHO must make difficult choices by prioritizing its program of work. I hope and pray the WHO does not lose sight of the importance of being the guardian or voice of the most vulnerable, those with greater health disparity and in greater need. Lastly, Mr. Chair, we support a 20% increase in AC contribution. Thank you.
Thank you, Micronesia. I now give the floor to Barbados, to be followed by the Democratic People's Republic of Korea.
A special thank you to the chair of the EB, Dr. Jerome Walcott, Director General, distinguished colleagues, Barbados expresses its deep appreciation for the report of the Director General Tedros. Your careful listing of achievements gives member states the comfort that WHO remains extremely relevant in our changing world. The ambitious agenda of over 20 resolutions and 47 agenda items, we are sure that collaboration and solidarity, we can accomplish the goals and objectives of the 156th Executive Board. Barbados remains concerned that in a new geopolitical climate, the role of the WHO must not be diminished or sidelined. Assessed contributions and voluntary contributions need a fundamental review, along with prioritization of programmatic areas, particularly for the region of the Americas. The 70% reliance on voluntary contributions needs to be relooked and renegotiated. The investment round agreed by WHO is more critical than ever. One of the Pan-American Health Organization strategies is to increase and improve the governance and technical capability of country offices. This must continue. Program budgets must be more responsive to individual member states, and Barbados is willing to be part of a review to increase its assessed contributions by 20%. Prioritization of needs as it relates to small island developing states must include responses to non-communicable disease and mental health, antimicrobial resistance, sustainability of the health workforce, responses to health emergencies, climate change, and digitization in healthcare. Barbados will continue to play its part as we chart new courses for public health in an uncertain global environment. I thank you.
Thank you, Barbados. I now give the floor to the Democratic People's Republic of Korea, to be followed by Senegal.
Thank you, Mr. Chair. DPR Korea would like to thank you, WHO DG, for the report outlining the achievement made by efforts of WHO and member states. We also commend the outstanding efforts and leadership by DG and his team to protect, provide, and promote the health of the people globally, in line with the overall mission of health for all, no one behind the left. We could identify many success stories in responding to emerging health challenges and conducting the investment round for sustainable financing for GPW14. In DPR Korea, building the county hospitals equipped with advanced medical instruments and supplies is being pushed ahead as per the government new regional development policy, which is aimed at providing the more affluent, healthy, and well-being to all local people living at counties of the country in coming 10 years. It will definitely bring remarkable achievement with a contribution to improvement of UHC and PHC in the country. WHO is recently facing financial constraints, which will make it more challengeable for WHO program, in particular for the next biennium, 2026 to 2027. It will be more challengeable for WHO in the next biennium, 2026 to 2027, with the financial and economic conditions. However, now that there is the strong commitment
to increase aid made by all member states and potential instrument to secure and mobilize more resources, as well as able excellent leadership of the WHO Director General, we are sure that will be very forward. As you know, challenges bring another opportunity for turning adversity into favorable conditions. We suggest the Secretariat to take the accountability to address the financial constraints in more active, transparent manner with the engagement of various donors and stakeholders as well as member states. We also call for all member states to strengthen the solidarity with WHO for providing healthy life and well-being of the people in their country. And DPR Korea, as a WHO member state, is committed to actively participating in global health improvement. Thank you.
Thank you, Democratic People's Republic of Korea. I now give the floor to Senegal, to be followed by Poland.
Thank you very much, Chairman. Director General, Secretary, Ministers and representatives of delegations, Senegal would like to endorse the statement made by Cameroon on behalf of the 47 member states of the African region, and we should like to thank the World Health Organization and the Director General and congratulate them on all the efforts they have made to promote global health. WHO is now facing difficulties in respect of resource mobilization, and the recent decision of the United States of America to withdraw from the organization is not going to make things any simpler. In the face of what is a difficult situation, Senegal would like to propose that we mobilize health diplomacy around the world to urge the United States to change its decision given the efforts that it's been asking WHO to make and which it has already made. Discrepancies in access to health care between people around the world is not just a question of health or of money, indeed. It's a question of health security, and that affects the United States as much as anyone else. The United States cannot really remain outside the global health policy being implemented by the World Health Organization. We urge the Executive Board to take a constructive and sincere initiative to talk to the U.S. authorities, including the U.S. Congress and the Senate, to encourage the country to remain within WHO and to urge other countries to think about the legacy that all of us, with no exception, are going to leave to future generations. Thank you for your attention.
Thank you, Senegal. I now give the floor to Poland, to be followed by Norway.
Thank you, Chair. Chair, Director General, Excellencies, colleagues. I am delivering this statement on behalf of the European Union and its 27 member states. The candidate countries, Georgia, Montenegro, Macedonia, Republic of Moldavia, align themselves with this statement. Every human being has the right to the highest attainable standard of health. The EU thanks the Director General for the report and commends WHO's tireless efforts to achieve SDG 3. The EU reaffirms its strong commitment to WHO in these challenging times. International and regional cooperation complements national action. Inclusive collaboration ensures no one is left behind. A common agenda is increasingly important in the face of growing health challenges and constrained financing. The announcement withdrawal from WHO, expressed by the organization's single largest donor country, may have an impact on the organization's financing amid WHO's growing actions. Predictable funding is vital for WHO to plan effectively and fulfill its mandate. We urge all stakeholders to focus on the WHO's comparative advantages and support WHO financial flexibility and predictability while prioritizing core functions and strategic objectives. The cost implications of new actions must be assessed to ensure continuity of essential programs. Addressing determinants of health is crucial to promoting health and preventing disease. Non-communicable diseases, including those with low prevalence, must remain high on the agenda, particularly with this year's UN high-level meeting. Mental health, especially for children and youth, requires urgent attention, particularly given the impact of conflicts. AMR and climate hazards are severe global threats that require coordinated response through the One Health approach. In an interconnected world, global health security is critical. The COVID-19 pandemic exposed health system vulnerabilities, while the Mpox emergency underscored the need for vigilance. The WHO Pandemic and Epidemic Intelligence Hub and the European Surveillance System provide vital guidance. The EU and its member states remained committed to a successful conclusion of the INB negotiations. The adoption of the IHR amendments at the 77th WHA provides a solid basis for future work. The EU deplores the rising number of health emergencies caused by armed conflicts, resulting in devastation in Ukraine, in the Middle East, the DRC, Sudan, Yemen, and elsewhere. We commend WHO's life-saving work and call on all parties to uphold international humanitarian law, protect health personnel and facilities, and respect humanitarian principles. To achieve SDG 3, amid climate change, we need robust health systems, prioritizing prevention, health promotion, and primary health care. Equitable access to essential services and gender equality are vital for universal health coverage. The EU remains committed to the promotion, protection, and fulfillment of all human rights, and to the full and effective implementation of the Beijing Platform for Action and the Programme of Action of the International Conference on Population and Development, ICPD, and the outcomes of their review conferences, and remains committed to sexual and reproductive health and rights in this context. Research and innovation, underpinned by appropriate governance, ethical standards, and equitable access, are key to developing affordable medicines, treatment, and technologies, including responsible AI use. A skilled and motivated health workforce is critical for quality healthcare and resilient health systems. The EU supports WHO's efforts, such as the WHO Academy, to improve workforce planning, education, and working conditions. Recognizing WHO's leadership in developing evidence-based standards and guidelines, we are concerned about the recent politicization of discussions, which detract from WHO's essential work. We urge all member states to prioritize public health. With appreciation for the development of GPW14, the EU and its member states remain committed to working closely with WHO and partners to build a healthier future for all. Thank you very much.
Thank you, Poland. I now give the floor to Norway, to be followed by Israel.
Thank you, Chair. We thank the Director General for his report and express our gratitude to all WHO staff for their tireless work. The most important task for this Executive Board is to support the organization in making difficult but necessary prioritizations, and to preserve the functions only WHO can provide and the support WHO provides to countries. We support the PBAC's recommendation of a realistic program budget for 2026-27, including the scheduled 20% increase in assessed contribution. We urge the EB to do the same. Further reform towards more transparency, accountability, and efficiency is necessary to create trust, and as the premise for flexible and predictable financing. Adopting the procedures for potential allegation against DGs at the Health Assembly 78 is an important step. Member States also need to take responsibility. We need to rethink the way forward to improve the efficiency of the governing bodies. The right to health cannot be achieved without universal health coverage. Underpinning the sustainable financed health system with a focus on primary health care, ensuring access to preventative and integrated services, including sexual and reproductive health and rights, is essential. To end, we are extremely worried about the increasing attack on health facilities as we have seen in Gaza, Sudan and Ukraine. This is completely unacceptable. Hospitals and health facilities must remain safe havens for patients and health workers. Thank you.
Thank you, Norway. I now give the floor to Israel, to be followed by Ethiopia.
Thank you, Chair. Israel welcomes the Director General report. I'll drop my written message, and I would just go to the main point of the week in our eyes, and that is the withdrawal of the United States, which is not just a budgetary issue, as by some members could be understood the main problem. The main problem is not the budget. The budget is a huge problem, but still, leaving this organization, the most relevant health organization in the world, and avoiding a domino effect of other states not necessarily withdrawing, but rather losing interest in this organization, and as well other international bodies, companies, industry, academia. In the sake of this organization, we must find the route to have I would say, a productive discussion with our American colleagues and see if there is a path to revise their decision and how to go and take the next steps. In our eyes, there are 5 pillars for this discussion. We have to speak about accountability on all levels. We have to speak about budgetary issues, and I do believe that PIVAC did a great job, and here we'll have a chance to further discuss the budget. But we really have to show that we have clear budgetary reforms in front of us. Structural reforms were widely discussed, and indeed during the last 7 years, the current Director General did lead a structural reform in the organization, but much more should be done, and that includes focusing of this organization to its core functions, mostly in public health emergencies and other health issues where there's nobody else to take the beacon ahead. We have to be more inclusiveness. We have to depoliticize, much depoliticize, in order to look a professional organization, a professional agency, which can take the world for a better place in sense of health. The last issue, which was not mentioned here today enough, is the issue of disinformation, of misinformation. We must tackle in a much better way this issue, because there's a wide campaign against public health, against this organization, against vaccination in many of our societies. It is not true only for rather professionals, but also for the wide public and our politicians. We have to explain better who are we and what is the future and what are our plans to facilitate this future. Thank you.
Thank you, Israel. I now give the floor to Ethiopia, to be followed by Bulgaria.
Thank you, Chair. Ethiopia aligns with the regional statement delivered by Cameroon on behalf of the 47 member states of the African region. And we also thank the Director General for the chairmanship and also for the comprehensive report. We have taken note of the achievements and the challenge and the continuous evolving political dynamics that this has been bearing in our discussions and the discussions to come over the days. Ethiopia has been working with WHO and other partners to ensure that healthy and prosperous society with a focus of primary health care, service integration, and also addressing social determinants of health and well-being. However, a multifaceted challenge with increasing triple burdens of the disease has been increasing significant challenge in health system strengthening and health resilience over the years. And this also adds to misinformation, as an additional challenge that our globe is facing now. We deem enhanced collaboration and support especially in equitable access to health products, local manufacturing, strengthening health and workforce, health financing, primary health care as a very crucial and requesting enhanced support with a focus of strengthening country capacities. We believe that we are at a critical junction to redefine our global health, emphasizing that health is at the investment of significant contribution for economic growth and achieving SDG. WHO's role as a scientific and evidence organization and its role in setting global norms and standards and supporting this adoption and implementation of impacts in countries is becoming more important more than ever. Ethiopia has been supportive of efforts to have sustainable, predictable and flexible financing to WHO, and we call upon all member states to support the investment round and honor a collective commitment of increasing access contribution. We view the recently amended International Health Regulation and the Pandemic Agreement as an important milestone for global health security and health system resilience. We also urge all member states to accelerate implementation of the IHR, but also finalizing negotiation of the Pandemic Agreement with a view of adoption possibly by 2025. Ethiopia stands ready to strengthen collaboration and partnership in health and looks forward for fruitful discussion in this EB week. I thank you.
Thank you, Ethiopia. I now give the floor to Bulgaria, to be followed by Brunei Darussalam.
Thank you, Chair. Distinguished Director General, Excellencies, Bulgaria aligns with the statement on behalf of the European Union and its member states. Today's world is an arena of multiple crises affecting health, which shape complex hazards that go beyond the scope of national governments and require consistent and effective preparedness and concerted response actions across sectors and borders. While we are highly concerned about the rising number of health emergencies, we commend the courageous work of WHO in saving lives and alleviating human suffering. Bulgaria considers health security a major priority. Along with building core capacity and developing fit-for-purpose national health systems, Bulgaria actively participates in the INB negotiations, and we still hope to achieve consensus on meaningful provisions with added value. However, addressing global health threats and multilateral actions should not duplicate initiatives and avoid unnecessary overlap, especially in time of limited resources. We acknowledge the necessity to secure sustainable funding for WHO global health functions. Bulgaria considers that WHO budget should reflect the link between global health priorities and the expected outcomes toward achieving better health and well-being for all. Performance indicators for budget programs need to provide an objective assessment. In view of recent developments related to withdrawal of major contributor, a strict financial discipline is required to stronger monitoring and accountability. We welcome WHO efforts to reform its governance. We call for closer coordination with governments on domestic health challenges to better address their needs and enhance country impact. Strengthening the effectiveness of WHO governing bodies calls for strict agenda and time management, along with introducing housekeeping rules to optimize their work, which we remain available to support. Similarly to other health systems globally, the Bulgarian healthcare system as well continues to struggle with an aging workforce in the health sector, insufficient attractiveness of some health professions, uneven territorial distribution, migration of health workers. We recognize and support WHO targeted actions to ensure an effective, well-trained, motivated and protected professional healthcare workforce. Among other critical issues we identify as key, the MRR, mental health and climate change, which need an urgent international response to prevent further devastating impact. Bulgaria remains committed and stands ready to support WHO in addressing these challenges and continue collaborating with the organization and its member states for better health for all, targeted at tangible results, mindful of the specific national context. Thank you.
Thank you, Bulgaria. I now give the floor to Brunei Darussalam, to be followed by the Republic of Korea.
Thank you, Chair. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh, and a very good morning. Chair, Excellencies, delegates, ladies and gentlemen. Brunei Darussalam wishes to congratulate the Director General and the Secretariat for their steadfast leadership and tireless efforts in navigating complex global health challenges. We take note of the extensive report provided by the Director General. The discussions at the 7th World Health Assembly last year highlighted critical priorities, many of which remain central to our agenda today. From addressing the persistent threat of pandemics and strengthening preparedness under the international health regulations, to advancing universal health coverage, combating non-communicable diseases, and mitigating the health impacts of climate change. These are the shared challenges that demand collective action. Brunei supports the development of the Global Action Plan on Climate Change and Health. Climate change is not just an environmental issue, but a profound health crisis, as evidenced by its exacerbation of disease burdens and its disproportionate impact on vulnerable populations. We urge Member States to accelerate efforts to integrate health consideration into climate adaptation and mitigation strategies, with strong technical and financial support from WHO. Similarly, the alarming burden of NCDs, coupled with growing mental health challenges, requires urgent attention. Brunei commends WHO's leadership in advancing various NCD initiatives, including those targeting cervical cancer and mental health. We believe these programs must remain at the forefront of global health priorities, supported by sustained funding and innovative partnerships. Brunei also commends the WHO for its exceptional work under the Health Emergencies Program, which continues to save lives in some of the most challenging contexts. The unwavering commitment to delivering health services to those affected by emergencies and disasters reflects the essence of WHO's mission. In this regard, we emphasize the urgent need to address the humanitarian crisis in the Gaza Strip and other areas of conflict. The health system has been disseminated, and rebuilding them are essential to ensure access to basic life healthcare and basic life sciences service. We urge all nations to uphold the principles of humanity and solidarity and to strive for lasting peace, as it is the cornerstone of health and well-being for all. Chair, ladies and gentlemen, as we look to the future, it is imperative to reaffirm our commitment to solidarity and multilateralism. While we recognize the diverse circumstances of Member States, we firmly believe that global health can only be safeguarded through unity and shared responsibility. The WHO remains the cornerstone of the global health governance, and its strength lies in our collective contributions, guided by equity and compassion. Brunei reiterates its commitment to fostering global solidarity and ensuring that no community is left behind in our collective efforts to safeguard health security based on the principles of equity, solidarity, and resilience. Thank you.
Thank you, Brunei Darussalam. I now give the floor to the Republic of Korea, to be followed by Australia.
Thank you, Chair and DG Tedros. The Republic of Korea, as an executive board member, is attending this board meeting with a strong sense of responsibility to help WHO better manage our crisis at a time when WHO is facing financial pressures. The ROK is confident that GPW14 will mark a turning point for significantly advancing SDGs, including UHC achievement by 2030. As the progress of UHC-related indicator was somewhat hindered during COVID-19 response, it is a critical task to bring it back on track. Additionally, we believe that active cooperation among member states is required to tackle emerging health threats such as chronic disease, mental health, and climate change. Currently, the ROK is domestically undergoing 4 major healthcare reform initiatives to address health risks, including insufficient and imbalanced medical infrastructure. In specific, we will expand the healthcare workforce, establish a comprehensive community healthcare delivery system, enhance reimbursement for essential medical services, and fortify the safety net against medical malpractices. In addition, the ROK will join the effort to strengthen the global health for effective future pandemic PPR. And we will be actively engaged in the remaining INB meetings to establish a workable pandemic agreement that all member states agree on. During this executive board meeting, the ROK looks forward to discussing WHO's fundamental mandate and core functions, and how we should prioritize WHO's work so that we can contribute to turning this crisis into an opportunity. Thank you.
Thank you, Republic of Korea. I now give the floor to Australia, to be followed by Lebanon.
Thank you, Chair. I'd like to cover off 3 issues: strengthen the global health system, health policy priorities, and the governance and sustainable financing of the WHO. First of all, with respect to strengthening global health security, we commend the WHO for its tireless efforts in responding to ongoing and increasing urgent health needs, including in conflict and humanitarian settings. One couldn't help but listen to the Secretary-General's comments today about the breadth of activity of the WHO to realise how important that action on global health security is. The current H5N1 outbreak and Mpox fake are important reminders of the need to enact lessons and achieve better outcomes when responding to future emergencies. Last year's amendments to the international health regulations demonstrated what can be achieved when we work collectively. We encourage all member states to continue this momentum to secure the pandemic agreement. Board members here can play an important role in leveraging this momentum by guiding regional counterparts. Australia ourselves will continue the vital and open collaboration necessary to land a robust agreement, particularly through our INB Bureau Vice Chair role. On health policy priorities, the 2030 Agenda for Sustainable Development and the GP14 work program lay strong foundations for our shared goals. Australia welcomed WHO's work to support member states in reorienting health systems towards primary health care. This is the cornerstone of universal health care and the most equitable and efficient path to achieving universal health care by 2030 under SDG 3. In concert with Poland, Australia is a long-standing supporter of sexual and reproductive health and rights for everyone, everywhere. With respect to governance and sustainable financing, I note the comments by our Canadian colleague about the breadth of resolutions before us and our colleague from Norway urging us to be able to prioritise. I think the conversation about governance and financing really has talked about three topics. One, how we look to resource mobilisation, particularly in the context of the current challenges. Two, how we can drive further efficiency in the WHO. And three, how we can do prioritisation. With respect to this last part, including that comment about new resolutions, I welcome the comment by the EB Chair reflecting on yesterday's informal retreat about the possibility of the Secretariat bringing forward advice to the meeting in May, the WHA, on the way forward. I think it would be very good if this advice could deal systematically with three key topics. One, a clear articulation of the decision rights of the various bodies, players and member states, with a clear recognition that this is a member state-driven organisation where ultimate decision rights must rest. Secondly, clear guidance on the form of transparency and the issues that need to come forward to provide guidance. These include clear proposal, clear costings, clear indication of sources of finance, gaps, and the alignment with GWP 14. And finally, clear guidance on the process and timing to ensure that we have a member state-driven process. Finally, Australia provides long-term flexible voluntary funding. To reach the full potential of member state-led sustainable financing agreement, it is important that we achieve an increase in assessed contribution by member states to ensure critical programs are funded. We must ensure WHO can play the role that only it can and that the world expects of it. Thank you, Chair.
Thank you, Australia. I now give the floor to Lebanon, to be followed by Thailand.
Thank you, Mr. Chair. Honourable Ministers, colleagues, ladies and gentlemen, Lebanon commends the Director General's report that details the outstanding achievements of WHO over the past year, despite increasing needs, challenges and threats. And this is no news, as we are all used to the many achievements of WHO. We are now more than ever in need of more solidarity, of stronger commitment to global health, as well as to the right to health and to human rights at large, and to bring the best of this organization's 77 years of commitment to improve our population's health. It goes without saying that WHO needs more resources to achieve the health programs in view of the global challenges, including acute emergencies that the world is facing. Accordingly, we support now more than ever the increase in assessed contributions according to the previously agreed timelines. We are now faced with an expected WHO budgeting gap that compels us to find innovative solutions. We would like to see difficult circumstances as an opportunity to innovate and to grow. Improvements should be dynamic and never stop. It is a journey rather than a destination. What is important above all is to be able to sustain the improvements that we all invested in over time. The advancement in medical technologies necessitates a dynamic approach in human resources, in data and innovation, and in innovative financing. With more physical and mental health threats we are facing, including conflict-driven disasters, climate change, and other such drivers, prevention and preparedness to emergencies remain the best approach. Though we support the restructuring that you are intending to do, we urge us all to safeguard WHO's role and mandate in the global health system in our ever-complicated world. With the increase in needed resources and the scarcity of these resources worldwide, we believe that it is not wise to disaggregate the world's funds under many names and umbrellas. We grant WHO our full support as our world needs WHO now more than ever. Thank you, Chair.
Thank you, Lebanon. I now give the floor to Thailand.
Thank you, Chair. Thailand would like to say thank you, and thank you. Thank you 3 times to the DG and the Secretariat for their hard work with concrete results. We will not thank or commend the Secretariat again throughout this EB to save time. Chair, Thailand wants to see the WHO walks more of its talk. The WHO recommends that there is no safe limit of alcohol. Strongly recommend. But last night, at the reception, at the dinner for the executive board retreat, wines were served, which I also drank, as it is served free. Chair, 4 regional offices have stopped serving alcohol to show their leadership, and Thailand would like to see the headquarters follow their track. We will definitely say thank you, and thank you 4 times. If this practice becomes the norm throughout the WHO offices. Thank you, Chair.
Thank you, Thailand. I see no further requests from the board to speak, so I now move to the member states that are not members of the board, and I give the floor to Spain, to be followed by France.
Muchas gracias. Thank you very much, Chairman. Spain would like to endorse the statement made by the European Union. We're sincerely grateful to the Director General for having submitted a very detailed report. Thank you, Dr. Tedros. We'd also like to thank all the staff of the World Health Organization for their hard work on a daily basis. As member states, we must all strengthen the authority of WHO as the core agency responsible for global health and guarantee her the resources necessary to do her work. All of us are aware that we're facing many different challenges which require a coordinated response. NCDs, mental health, antimicrobial resistance, neglected tropical diseases, polio eradication, and the impact of climate change on health are just a few examples. Approaches such as One Health and Health in All policies are essential if we are to tackle these threats in an effective manner. Turning to equity, achieving universal health coverage through strengthening primary health care and community health, and focusing on policies which take into account the social determinants of health is essential. As a country committed to a feminist foreign policy, we believe that all health policies should include a gender aspect with coverage of both sexual and reproductive rights. We also urge member states not to forget the consequences of a lack of international coordination on preventing, preparing for, and responding to health emergencies. We urge a successful outcome to an international pandemic treaty which is both ambitious and fair. Global health cannot be endangered by political, economic, or religious interests. It's a fundamental right and must remain a priority on our agendas. We urge all member states to step up their commitment to and with WHO and health multilateralism for a more healthy, fair, and resilient future for everyone. Thank you.
I'll give the floor to France, to be followed by Denmark.
La France.
Thank you. France wishes to align itself with the statement delivered on behalf of the EU and its member states. We are indeed at a turning point in terms of the crisis raging in the world today. We need more than ever a strong, legitimate and effective WHO, and France certainly will do its utmost to support the organisation, its teams and its Director General, Dr. Tedros. WHO remains a normative benchmark for public health. That is a key role that it plays, and it's something we must continue to defend. As things stand today, we have a historic opportunity to adopt an ambitious international instrument on pandemic prevention, and we would call upon all member states to do as much as they possibly can in order to ensure that this decisive instrument can enter into force and that prevention can be given its due place. We recall the fact that health emergencies are no longer indeed restricted to pandemics. Look at the cyclone that took place recently, and we saw the emergency that caused, and I would like to thank WHO for their support in that event. We need to anticipate better and to build better the resilience of our system so that we can overcome challenges that we face today and in the future. If that is to happen, then WHO needs resources so it can be sustainable in the long term. We continue to support ambitious reform of funding for WHO, which is an organisation that must not be weakened, because if it is weakened, then the health of all is endangered. We support in particular training. We know that WHO has a new tool, that is to say the Academy in Lyon, that can contribute to training ambitions. We have supported the establishment of that academy, and we call on all member states to support it fully. We have to make decisive choices. We need the WHO to play its role within the global health architecture. That is vital for our future, and we will continue to defend effective and solidarity-based health multilateralism so that we can have an effective international system where no region is left behind.
To Denmark, to be followed by the United Kingdom of Great Britain and Northern Ireland.
Thank you, Chair, Director General, dear colleagues. Denmark aligns itself with the statement made on behalf of the EU and the member states. The state of global health is severely challenged, not only because of numerous humanitarian and health emergencies that arise at what seems to be an ever-increasing speed, but also because the most important global health actor, the WHO, is facing a difficult financial situation that will require tough strategic choices. We deeply deplore the increasing number of human-made emergencies with immense impact on human health, in particular Russia's unprovoked, unjustified and illegal war of aggression against Ukraine. We also reiterate our gravest concern about the deep humanitarian catastrophe in Gaza. War and conflict have fatal consequences for our health. In addition to the many direct victims, war and conflict bring destruction of hospitals, disruption of access to health services, and increasing mental health issues, to name a few. Our support for civilians and aid workers is crucial. Multilateral cooperation is increasingly important to secure the resilience and sustainability of our health system, and so is innovation. In Denmark, we recently passed a healthcare reform that introduces an entirely new structure and a redistribution of tasks. A significant element is better integration and equal prioritization of psychiatric and somatic healthcare. Strengthening healthcare system is of relevance across the globe, and the support of WHO is crucial in this regard. We remain fully committed to working with WHO to create a healthier future for all. Thank you.
Thank you, Denmark. I now give the floor to the United Kingdom of Great Britain and Northern Ireland, to be followed by Mozambique.
Thank you very much, Chair. The UK would like to thank the Director General for his report and commends the organisation and WHO staff for their unwavering commitment to championing health for all. The UK is proud of our long-standing partnership with WHO and are committed to supporting the organisation to deliver for today's health challenges. That is why the UK pledged £310 million in fully flexible funds in the investment round in November. Our funding will help to support the delivery of WHO's transformation efforts. We thank WHO for responding to numerous health emergencies over the past year, including the ongoing humanitarian crises in Sudan and Gaza, and the devastating impacts of Russia's illegal invasion of Ukraine. We commend WHO's rapid intervention in the outbreak of Marburg virus disease, releasing vital funds and supporting response teams, as well as in the current Ebola outbreak, and recognise the vital role of health system strengthening in better preparing for health emergencies. 2025 will be a critical year for protecting global health. The UK remains committed to improving global health outcomes for everyone and protecting global health security, including for a new pandemic accord, implementation of last year's high-level meeting declaration on AMR, and continuing to tackle the health impacts of conflict. We also remain dedicated to tackling NCDs. Domestically, the UK is set to create the first smoke-free generation, and internationally, we hope to secure strong consensus to agree actions at the high-level meeting on NCDs in September. The UK looks forward to continued collaboration and exchange with WHO and member states throughout this week and beyond, including on prioritisation efforts in light of WHO budget pressures. International collaboration is crucial for achieving our collective goal of health for all. Thank you, Chair.
Thank you, United Kingdom of Great Britain and Northern Ireland. I now give the floor to Lesotho to be followed by Mozambique.
Mozambique.
I'm giving the floor to Lesotho.
Thank you very much, Mr. Chair. I just raised my hand, so I think it's supposed to be Mozambique before Lesotho. Thank you.
No, you are a member of the EB, so you get precedence.
Thank you very much, Mr. Chair, Director General, Honorable Ministers, Excellencies, and distinguished delegates. The Kingdom of Lesotho expresses its gratitude to the Director General for his comprehensive report, which highlights the progress and challenges in global health for the past year. We commend the World Health Organization for its leadership in advancing universal health coverage, responding to health emergencies and strengthening health systems worldwide. Lesotho aligns itself with the statement made by the distinguished delegate of Cameroon on behalf of the 47 member states of the Africa region and wishes to highlight the following key areas. Universal health coverage. We acknowledge WHO for efforts in accelerating universal health coverage and emphasize the importance of primary health care as a cornerstone of resilient health systems. In Lesotho, we continue to implement policies that prioritize equitable access to quality health care, particularly for vulnerable populations in remote areas. However, we call for increased technical and financial support to strengthen our health infrastructure and human resources. And also health emergency preparedness and response. The COVID-19 pandemic underscored the importance of preparedness and response mechanisms. Lesotho supports the continued negotiations on the pandemic accord and amendments to the International Health Regulations 2005 to ensure a coordinated and equitable response for future healthcare crises. We urge WHO and development partners to enhance support for low and middle income countries to strengthen their public health emergency preparedness and capacities. And also non-communicable diseases and communicable disease. The burden of non-communicable disease alongside the persistent challenges of HIV/AIDS, tuberculosis, and malaria remains a significant concern for our country and the region. We appreciate WHO for the continued support in addressing these challenges and reiterate the need for sustainable financing mechanism to scale up prevention, diagnosis, and treatment efforts. Thank you very much.
Thank you, Lesotho. I now give the floor to Mozambique to be followed by Eswatini.
Thank you, Chair. Mozambique aligns itself with the statement delivered by Cameroon on behalf of 47 WHO African states. We would like to take this opportunity to thank this comprehensive report by the Director General, which fully reflects the work WHO work carried out around the world, particularly in developing countries and in those hardest hit by epidemics, natural disasters, armed conflicts, and humanitarian crises. Mozambique also takes this opportunity to express our gratitude to WHO support, particularly during the outbreaks of cholera, polio, and natural disasters related to climate change. In the last 3 months, WHO supported Mozambique in the response of 2 cyclones. As the Director General said, the WHO reached where no one else, often putting the lives of its employees, including himself, at risk for the sake of saving those who desperately suffer and have practically nothing then can relieve themselves except through external aid. And this aid comes through WHO and is based on the support from member states and institutions of goodwill to whom we are very grateful. We all members shall make an effort to improve our contribution and mobilize more partners to allow WHO to accomplish its purpose to promote health, prevent disease, and save lives, particularly in the light of the current financial crisis. To accomplish the global health targets, including the 14 global program of work, Mozambique is working towards increasing its access contribution by 20% and making every effort to properly contribute to investment round. To conclude, Mozambique remains committed to work with other member states to conclude the pandemic accord by May 2025, one of the fundamental instruments for WHO and the member state to operationalize equity and reduce dependence. Thank you very much.
Thank you, Mozambique. I now give the floor to Eswatini to be followed by Finland.
Thank you, Mr. President. It is a privilege for the Kingdom of Eswatini to address the 156th session of the WHO Executive Board. Eswatini aligns itself with the statement delivered by the distinguished delegate of the Republic of Cameroon on behalf of the 47 members of the African region. We extend our appreciation to the Director General and the Secretariat for their continued leadership in advancing global health. As a small developing nation, with a strong commitment to universal health coverage, Eswatini has made significant strides in strengthening our health system, particularly in combating HIV/AIDS, tuberculosis, and non-communicable diseases. However, we remain aware of the challenges posed by emerging health threats, climate change, and the need for sustainable health financing. In alignment with WHO's priorities, Eswatini reaffirms its dedication to 1. Strengthening primary health care as the foundation for resilient health systems, ensuring services reach the most vulnerable. 2. Enhancing pandemic preparedness and response through regional collaboration and investment in health security. Addressing the double burden of disease and integrating non-communicable disease prevention with infectious disease control. As we engage, Mr. President, in these critical discussions, let us ensure that our decisions translate into tangible improvements for all our people. Global health equity must remain at the center of our collective efforts, and we look forward to constructive deliberations and reaffirm Eswatini's commitment to working with WHO and all our partners to achieve health for all. I thank you.
Thank you, Eswatini. I now give the floor to Finland to be followed by Uruguay.
Thank you, Chair. DG. Finland aligns itself with the statement of the European Union. We join others in appreciating the commitment of Dr. Tedros and WHO staff. As a global health community, we are faced with multiple challenges in safeguarding the health and safety of people around the globe. The potential to reach the Sustainable Development Goals in health by 2030 seems to be slipping away. We expect WHO to guide us, to provide accurate and up-to-date information, and to assist us in response to health threats. WHO and multilateral cooperation are also key to ensuring sustainable and timely access to the benefits provided by innovation and new technologies to address health challenges. The economic situation in many member states limits their ability to increase their contributions to global health institutions. The withdrawal of WHO's biggest financial contributor is leaving a gaping hole in the finances. WHO is also losing many of its critical experts. WHO's cost structure and activities must be adjusted. We need to pull together as a community to ensure that the crucial work of WHO can continue, while taking a pragmatic approach on prioritization at all levels of the organization. Finland remains a strong supporter of multilateralism and WHO's role as the leading global health agency. Thank you.
Thank you, Finland. I now give the floor to Uruguay to be followed by Japan.
Thank you very much, Chairman. Distinguished ladies and gentlemen, it's an honor for Uruguay to be able to participate in this meeting of the WHO Executive Board. I should like to begin by putting on record our gratitude for the efforts which have been made in order to tackle priority issues which affect global health and which we have been briefed about by the Director General. We'd also like to highlight one or two of the measures that our country has taken in step with the overall policy of this organization. Uruguay would like to reiterate her commitment to universal health coverage through initiatives such as our law which strengthens prevention and treatment of non-communicable diseases, guaranteeing equitable access to essential drugs and medicines. We are also putting health information on foodstuffs, and we have a policy to promote healthy lifestyles which will help to further combat this kind of illness. We are promoting mental health too, including suicide prevention and the strengthening of primary health care. We participate actively in the Mercosur strategy on health and climate change, and we have national plans helping us to mitigate the effects of climate change on health. As far as traditional medicine is concerned, Uruguay regulates practices such as homeopathic treatment and acupuncture in accordance with the 2023-2023 program. We've also been boosting our response capacity to deal with health emergencies and natural disasters by appointing national focal points for our emergency medical teams. And we've also been furthering cooperation between our institutions and our overall national emergency ministry. Last but not least, we would like to reiterate our commitment to the goals and principles of this organization and to working together with other countries and the organization to build a healthier and fairer future for us all. Thank you.
I just want to remind member states that try to limit your contributions to 2 minutes. I now give the floor to Japan to be followed by Bangladesh.
Thank you, Mr. Chair, Dr. Tedros, and colleagues. Japan would like to express gratitude for this opportunity. First, I extend our appreciation to Director General and the WHO Secretariat for their unwavering commitment and efforts in addressing global health challenges.
Uruguay, could you switch your microphone off, please? Thank you. Excuse the interruption.
Thank you. As a member of the international community, Japan remains steadfast in dedication to working closely with the WHO and member states. We will continue to contribute to the achievement of UHC, the pandemic PPL, as well as tackling the complex global challenges, including those posed by climate change and population aging. Japan believes that WHO, as the leading agency of the United Nations in the field of health, must fully leverage its experience and take the lead based on scientific evidence on addressing global health challenges. In this context, Japan would like to emphasize 3 key functions that WHO should prioritize moving forward. The first is infectious disease crisis management, the global response to COVID-19 pandemic, as well as the ongoing efforts to tackle mpox, have underscored the critical importance of infectious disease PPL. The second is WHO's agenda-setting role. This year, the UNGN high-level meetings will be convened. Alongside UHC, WHO is expected to tackle the lead in shaping these crucial agendas in providing clear visions in convening the global efforts to tackle global health issues. The third is global WHO's norm-setting functions. This includes the international health regulation as well as the development of the data system, national health accounts. We would like to once again emphasize the role of the setting these norms and standards is a fundamental responsibility that only WHO can fulfill. Thank you, Mr. Chair.
Thank you, Japan. I now give the floor to Bangladesh, to be followed by El Salvador.
Thank you, Chair. We thank the Director General for the report and WHO team for their services, even risking their lives in war zones and conflict-stricken areas of the world. Health issues are uncompromising. Health issues are uncompromising when it comes to an individual person. Similar spirit is essential at national level. When countries are resource constrained at national level, international support is exigent. That is why international organizations came into being. Naturally, if the countries and people in need of external support don't receive support anymore, it will cost their reliance and trust on traditional international partners. Based on COVID-19 pandemic experience, we all came together for mobilizing resources for equitable access to health services, particularly access to vaccines, therapeutics, diagnostics, etc. at an affordable cost. Hence, we strongly advocate for diversification of production facilities across the continents to make them available to the people. We are deeply concerned at the attacks on hospitals and health services in conflict-stricken areas of the world. Bangladesh urges for necessary support to the people of Gaza and Palestine so that the dilapidated health facilities become functional as soon as possible. Despite financial constraints, any punctuation to the vital ongoing WHO program in vulnerable societies is unfortunate. It is the responsibility of the entire membership to strive for saving this program. We caution against fitting WHO staffs within financial envelope. We apprehend that in future, experts might not choose to be in IOS like WHO because of uncertainty in career. Finally, we hope that we all can join our hands to augment low-cost solutions as per the first WHO Global Status Report to minimize preventable deaths from drowning. I thank you, Chair.
Thank you, Bangladesh, sorry. I now give the floor to El Salvador, to be followed by Botswana.
Thank you, Chairman. It's a pleasure to greet you, Dr. Tedros. We recognize and acknowledge the report you made, and we're happy to know that the pillars illustrated in your report are in line with the general approach that the Ministry of Health of El Salvador is taking, helping to paint a lighter picture than the dark one left to us by the pandemic. We've been doing a lot of work on NCDs, for example, with the support of WHO and PAHO, and that has helped us to gain recognition by the World Hypertension League. We've also been looking very closely at illnesses related to climate change, which are coming to add to the current public health burden. We also are eager to continue making headway on digital training and on using AI as a tool which will help us to improve our health services. Lastly, we acknowledge the budgetary challenges that all of us are facing, and we hope that your expertise will help us to achieve the best, most efficiently achieved and fairest possible results for your work. Thank you.
Thank you, El Salvador. We now give the floor to Botswana, to be followed by Germany.
Thank you, Chair. Botswana aligns with the statement delivered by Cameroon on behalf of the WHO Africa member states. We thank the Director General for the comprehensive report and the notable progress that has been achieved during the previous year. In this regard, we note with appreciation the central role of WHO in global health governance. Botswana has made important strides in improving the health status of its population. This is through improved health financing for financial risk protection, decentralized governance structure to ensure delivery of essential health services, and human resource development. We are pleased of the collaboration between the WHO and Botswana with respect to the Botswana National HIV Reference Lab and the WHO Collaborating Center for Nursing and Midwifery Development. Chair, the attainment of universal health coverage everywhere and for everyone has always been and remains the underlying principle that should underline our work. However, Botswana, like many low and middle-income countries, face a disproportionate high burden of non-communicable diseases, including cancer, diabetes, cardiovascular disease, and other NCDs, which are the leading causes of mortality and morbidity. As we prepare for the UN high-level meeting on NCDs this year, we call on the WHO to prioritize supporting member states in order to meet our NCD targets for 2025. Member states have been working hard to negotiate a pandemic agreement. We thank the Bureau and the Secretariat for the dedication to this important work. We remain optimistic that the INB will build on the consensus reached so far and complete the outstanding work for consideration at this year's World Health Assembly. In closing, Botswana remains committed to work with the WHO, other member states, and partners in order to deliver on the 6 strategic objectives of the GPW14. I thank you.
Thank you, Botswana. I now give the floor to Germany, to be followed by Ireland.
Dear Chair, dear Director General, dear colleagues, Germany aligns itself with a statement delivered by Poland on behalf of the European Union and its 27 member states. In these times of crises, we emphasize our unwavering commitment to WHO as the cornerstone of global health governance and an indispensable pillar of multilateralism. As an advocate of multilateralism, we will continue to support the WHO financially, politically, and technically. We call on all member states to join us in providing robust and sustainable financial support so that WHO is able to truly fulfill its mandate. Adequate funding is essential for the organization to maintain its independence and to respond to health emergencies effectively. Financing WHO means investing in a healthier future for global health, but also for each of our national health systems. We have a shared responsibility here. No single country can address global health challenges alone, and no single country can sustain WHO alone. We're concerned about the current challenging financial outlook and must prioritize. But simultaneously, we also see increasing demands from member states. Now more than ever, it is important to prioritize continuity of the essential programs, and it is also important to assess the cost implications of new suggested actions. This must also apply to resolutions. A comprehensive understanding of the real impact and costs of proposed new resolutions, such as detailed estimates of implementation costs and resource requirements for staffing, are fundamental. And we would suggest fewer resolutions and clear costing estimates from the beginning. Now, finally, let us stand together in our mission to achieve health for all. Thank you very much.
Thank you, Germany. I now give the floor to Ireland, to be followed by Chad.
Thank you, Chair. Honourable Chair, distinguished Director General, distinguished delegates. Ireland aligns itself with the statement delivered by Poland on behalf of the European Union and its member states. We thank the Director General and his team for the comprehensive report which reflects the breadth of work undertaken by the WHO. There is no doubt that we are facing challenging times for the WHO and for the multilateral community as a whole. In our view, the WHO plays an essential role in the cooperative global health architecture and the profound and positive impact on all our health and well-being since its formation in 1948 cannot be overstated. We've taken note of President Trump's decision to withdraw the United States from the WHO. We remain firmly a strong supporter of the WHO. Global health challenges require us to work together. We are affected by geopolitical conflicts and infectious disease outbreaks that threaten human security, as well as climate-related disasters, increasing non-communicable diseases and demographic shifts. The impacts of such challenges do not respect our national boundaries and fall heavily upon our young and old, rich and poor, to our collective detriment. It is vital, therefore, that we face these challenges in solidarity, with consistency and for our shared benefit. We must come together to strengthen our ties, to remain conscious of our interdependence, and to strive for the collective health of our national, regional and global communities. WHO's growing responsibilities makes financial sustainability crucial, and as such, predictable funding is vital for WHO to plan effectively and to fulfil its mandate. The cost implications of any new action should therefore be assessed to ensure the continuity of existing and essential programmes. In conclusion, Ireland is committed to strengthening our collaboration with WHO and fellow member states. We will continue to improve our ability to access invaluable technical support, implement best practice and global efforts across public health spectrum to build a healthier future for all. Thank you.
Thank you, Ireland. I now give the floor to Chad, to be followed by the Russian Federation.
Thank you very much, Chairman. Chairman, WHO Director General, ladies and gentlemen, members of the Executive Board. To begin with, thank you to the Director General and well said, sir, for your report, your very detailed report, which you provided to us. You've given us such reports over many years. We're very grateful for them and for the work done by your organization over all that time. We would like to align ourselves with the statement made by Cameroon on behalf of the African Group. As far as our country, Chad, is concerned, yes, health is a priority for us, but we are facing a lot of problems and challenges. As you know, we're trying to strengthen our health system. We're having to tackle neglected tropical diseases. We have a rise in non-communicable diseases, and we need to improve our primary healthcare system too. We're very grateful to WHO for having set up the WIPO Academy in Lyon, because we're pretty sure that that will be of great help for us in developing the skills of our colleagues in the field and on the ground. As you know, Chad is a peaceful country surrounded, unfortunately, by countries in conflict in the north, in Libya, in the west, the Lake Chad with Boko Haram in the center, Central African Republic, and to the north, Sudan. So one major problem we have is a mass flow of refugees into our country, of Sudanese in particular, and this causes major problems for the locals too. If you look at the city of Hatre, which is a border country, that is a city which has 100,000 inhabitants normally. It now also has to cope with 250,000 refugees. It goes without saying that that creates a problem for everyone, and we have internally displaced people too. WHO gives our Ministry of Health much needed support, and we urge others to offer our country support in its attempts to meet all these challenges. WHO's work has a great positive impact on the health of African peoples, bringing down death among young people and mothers and children in particular. Thank you.
Thank you, Chad. I now give the floor to the Russian Federation, to be followed by Namibia.
Thank you very much, Chairman. Chairman, Director General, distinguished colleagues, we are grateful to the Director General for the report which he has submitted to us and for the work of the organization carried out over the last few years. We are convinced that the international community is interested in WHO's retaining its leading role as the main organization responsible for tackling substantive problems relating to global health. For this reason, The selection of the organization's priorities and making that process effective is extraordinarily important. At the 77th WHA, we have had a new GWP adopted, setting the priorities of the organization, and we are happy to continue to provide expert assistance and support to the organization and to countries, particularly in fighting infectious and non-communicable diseases. At the same time, and in respect of the agenda of the organization, we have noted some irrelevant issues and some politicized issues which have led to ignoring more important issues. There are several items of the agenda under the heading climate change, for example, including certain thematic questions, and that makes it difficult to actually hold discussions having everything all mixed up. Some countries have mentioned the negative effect on health of certain restrictive or coercive measures which have been taken by individual countries. This affects not only ordinary people who cannot get access to the medical assistance they need, but furthermore, it makes it impossible to provide sustainable financing to the organization, that in its turn undermines the organization's ability to react quickly to health emergencies. We need to remember that the decisions of this organization need to be based on consensus, taking into account the positions of all countries, and this is a position which should underlie all decisions, include those taken in the INB on an international pandemic treaty. Thank you.
Thank you, Russian Federation. I now give the floor to Somalia.
Chair, Director General, and esteemed delegates, Somalia warmly welcomes the Director General and thanks him for his comprehensive report. We deeply appreciate the ongoing work of the WHO, which continues to be an invaluable partner in strengthening global health systems and enhancing the capacities of individual countries. The guidance provided by WHO in critical areas such as health system strengthening, emergency preparedness and response has been essential. We recognize and commend the significant technical contributions made by WHO, which have supported countries in addressing complex health challenges. We also extend our gratitude to WHO for its timely response on multiple emergencies and outbreaks around the world. These efforts have been instrumental in saving lives and protecting communities. We emphasize the importance of prioritizing universal health coverage to guarantee health for all. Thank you.
Thank you, Somalia. I now give the floor to Namibia.
Many thanks, Chair, for the floor. Namibia aligns with the statement delivered by Cameroon on behalf of the African region. We thank the DG for his report and commend the WHO's continued commitment to addressing global health challenges. Namibia strongly aligns with the goals of promoting, providing, and protecting health under the UHC umbrella. The DG's report highlights the importance of strengthening primary healthcare systems, a focus that resonates deeply with our national priorities. We take note of the theme for the 2025 World Health Day, which is timely, considering that the deadline to meet the SDGs is around the corner. We welcome the proposed program budget 2026 to 2027 and appreciate the efforts to ensure transparency, efficiency, and accountability in its formulation. The 20% increase in assessed contributions, which we support, reflects the collective commitment by member states to support health system strengthening in countries. We urge for budget considerations that address country-specific health priorities and challenges enabling impactful outcomes tailored to regional needs. Namibia underscores the importance of predictable, flexible, and sustainable financing for WHO, which is the only member state-led organization mandated to promote health, keep the world safe from public health emergencies, and serve the vulnerable by addressing global health issues. We thank donors for their contributions towards the investment round and express support to the Secretariat's resource mobilization efforts. In closing, a strong and well-supported health workforce is a cornerstone of effective health care delivery. Investments in training, retention, and equitable distribution of health professionals remain crucial to a strong and resilient health system. Thank you.
Thank you, Namibia, and I'll give the floor to Belgium.
Thank you, Mr. Chair. Mr. Director General, Belgium aligns itself with the statement delivered by Poland on behalf of the EU and its member states. Belgium would like to begin by thanking the DG and the entire WHO staff for their invaluable work. In these times of geopolitical tensions and increasing misinformation, our support for WHO remains steadfast and indispensable. We also welcome the ceasefire in Gaza and strongly condemn all attacks on healthcare professionals and infrastructure. Belgium is deeply concerned about the humanitarian situation in Eastern Democratic Republic of the Congo. We are alarmed by the devastating impact on public health and call for the respect of international humanitarian law and human rights. We also deeply regret the withdrawal of the United States, a decision that weakens both multilateralism and global health. In these challenging times, it is more important than ever to focus on our core mission. Together, we must strive to foster meaningful multilateralism that delivers concrete results on the ground. We also stress the critical importance of WHO's efforts to combat misinformation, a major challenge undermining public health. Finally, we share the concern expressed by many others about the demanding agenda of the 23 resolutions, characterized by sensitive and lengthy discussions that consume valuable time and energy. We would welcome a more streamlined decision-making process with fewer resolutions to obtain a realistic set of priorities. I thank you for your attention.
Thank you, Belgium. Members of the board, colleagues, earlier this morning when I started, I said that we would break for lunch at 12:30. It is now 12:30, and I propose that we will suspend further consideration of this agenda item number 2 until after lunch, with the intention to resume at 2:30, exactly at 2:30. I thank you. We now break for lunch.
Thank you.
We have one or two teeth problems. We have some teeth problems.
So I would like to pledge the same amount as already said by Samo.
Les pays africains font face à des enjeux sanitaires énormes. Et ces enjeux sanitaires requièrent des financements importants. Donc on s'est dit qu'on ne peut pas laisser seulement ces financements à l'OMS ou aux autres partenaires au développement. Donc on s'est dit que la meilleure manière de mobiliser les pays autour de ce cycle d'investissement, c'est aussi de demander aux pays de contribuer. Et comme ça, ils vont vraiment se sentir concernés dans le financement du secteur de la santé, même si on sait qu'ils ont des budgets nationaux. Mais il y a souvent des problèmes de santé qui demandent une réponse coordonnée, comme quand on parle de pandémie. Et cela requiert une mobilisation de fonds pour que tous les pays puissent, de manière solidaire, faire face à ces problèmes de santé émergents. L'Afrique doit se mobiliser en faveur de la santé parce qu'aujourd'hui, nous payons le lourd fardeau des problèmes de santé émergents au niveau de l'Afrique. L'Afrique doit se mobiliser pour faire face aux défis futurs en matière de santé et contribuer au financement par rapport à la lutte contre les pandémies.
For the upcoming period of the GPW14, pledged to confirm that Timor-Leste will continue with estimate increased assess contribution and additionally channel $1 million to continue advancing our effort for robust response and resilient health system. With unity comes power, and surely our collective effort will bring and require results. I thank you and obrigada, Bharat.
Bon, le cycle d'investissement de l'OMS est une initiative innovante que nous saluons et qui sollicite la solidarité entre les États pour pouvoir financer de manière donc innovante l'Organisation mondiale de la santé pour que l'Organisation mondiale de la santé ne dépende pas seulement des donateurs et cela contribue également à autonomiser financièrement les États pour développer les systèmes de santé. Notre pays s'est engagé à mettre à disposition une contribution qui, par rapport à nos moyens, est assez consistante. Elle est de 500 000 $ américains. Quand on sait que le Tchad est confronté à beaucoup de problèmes de santé publique, à un système de santé qui est encore en train de s'organiser, c'est une contribution qui a quand même son sens et qui est importante.
You're watching this video because you care about health, because health for all is an investment, not a cost. Because we all need health. Societies, economies, families, each and every one of us. Which is why it's so clear that the World Health Organization, WHO, needs your support, so that over the next 4 years, together we can save 40 million additional lives. Thanks to a strong new strategy which all governments have created together, based on the latest science, which all governments will implement in their countries and communities, guided and coordinated by WHO. We are a uniquely representative organization. Our members are East, West, North, South, hot and cold, big and small. Our partners are diverse, each bringing important expertise to the table. If we have fully funded WHO's new strategy, by 2028, we will all be able to say, together we have created 10,000 climate and shock-resilient health facilities, trained 3.2 million more health workers, and screened more than 100 million pieces of information annually, and assessed more than 50,000 potential health threats per year, so outbreaks are identified within 7 days. But to implement the strategy, WHO needs to be appropriately and sustainably funded, with predictability and with enough flexibility. That's why in 2024, we're launching the investment round. We are grateful to all our supporters and encourage our funders to follow those who are already committing flexible and predictable funding.
The World Health Organization is more important than ever.
We are proud to be part of the history of this great agency, the World Health Organization.
We are very cognizant of the help provided by WHO. We think that WHO has been an exemplary help to us.
We, as Welcome, relies on a strong and science-based WHO with evidence-informed policies, guidance and norms.
The World Health Organization's work benefits us all. What it needs for this work is sustainable financing that gives it the certainty to plan ahead and the flexibility to react.
I call on all member states to pledge and invest in resourcing the WHO.
If the World Health Organization did not exist before today, it would have to be created today to deal with the challenges that this world faces.
I want to thank you for being there and for seeing small countries when others didn't see us, and saving lives, hundreds of thousands, if not millions of lives, across the small island developing states.
Investment in WHO yields healthy results, a prudent investment, and a moral imperative. It moves us closer to the vision of health for all.
for a common global good, which is also global health. Potentially, this will ignite similar impact to other countries, where we can see more actions globally, and we remain steadfast, and we will continue to contribute to share our investment, and not only to this, but the greater health agendas that our globe is discussing and our continent is discussing right now. Health for all and all for health. The pandemic agreement is really important because, as we know, agendas like this have to get everyone's voice, and we cannot leave anyone behind. Our recent experience with COVID has really taught us a lot. If one country is weak, the globe is weak. So the pandemic agreement is where we can state that we have taken our lesson from the recent pandemic and we stand together, but also we make sure that countries like Ethiopia, African continent, and other countries are not left behind. So this is an agenda that we would continue to actively participate. We hope that this would be finalized before the end of this year, or maximum during the next WHO.
The WHO is a very important organization that member countries belong to, and it belongs to the member countries as well. So we see the WHO as our own. The WHO has been contributing immensely to health service delivery in various countries by providing all kinds of support, technical support, capacity building support, and information, giving us the right information. The Gambia is contributing $50,000, which how it is disbursed will be determined by the finance minister. But yesterday we made the pledge on behalf of His Excellency President Adama Barrow and the people of the Gambia to contribute a token to the activities of the WHO. With the increase in responsibility for the WHO, we sincerely believe that we need to look inwards, in-house, to be able to have a strong, sustainable WHO. Yes, Gambia is a small country. Gambia is a low-income country. We might not have as much, but we have a big heart to contribute to the WHO.
Hello, I'm James Chow. Once again, the World Health Organization is leading the fight against global health challenges and urgently needs our help. To continue its crucial work, WHO needs to raise $7.1 billion to fund the core of its program of work over the next 4 years. This investment will help tackle urgent health crises, reduce inequalities, and promote mental health and well-being. You see, health isn't just one piece of the puzzle, it's the foundation of all sustainable development goals. Healthy people are crucial to ending poverty, achieving quality education, and much, much more. Without robust health systems, every other effort risks falling short. So with more than 2 billion people lacking essential health services, the stakes couldn't be higher. I'm calling on governments, donors, and foundations to invest. You can help too. Your support for WHO isn't just a donation. It's a real commitment to a healthier, more equitable future. And it's a chance to get back on track to meet the 2030 agenda and once and for all to profoundly impact global well-being for every single person.
The World Health Organization seeks to support countries and draw attention to the problem of avoidable harm in healthcare. Healthcare these days is complex, fast-moving, and creates circumstances where errors do happen, even though everybody's trying very, very hard to keep them to the minimum. So what has been done by the WHO and the countries in addressing patient safety as a priority in their health system A lot has been done, but there's more still to do. And that's why it's very important that in its work, the WHO is supported with the finances necessary to get the job done. And this is very much about life and death. The money that's provided helps to save lives, helps to strengthen health systems, and give many more people around the world access to health care, not just any health care, but health care that's safe. So the WHO's patient safety program is doing great work with the member states of the WHO, with the experts, and we're very proud also to have involved patients and families, many of whom have suffered harm in this endeavor. So I'm calling on governments, foundations, donors to support the WHO by donating. If you want to get involved directly, you can see the link below and find out how to get involved and how to donate. But it's very much about health for all for health, and investing in WHO.
Hello, I'm Renee Fleming. The World Health Organization is at the forefront of improving global health, and it needs our support now more than ever. To continue its crucial work, WHO needs to raise $7.1 billion to fund the core of its program of work over the next 4 years. This funding will help WHO tackle urgent health crises, reduce inequalities, support mental health and well-being. With over 2 billion people still lacking essential health services, the stakes couldn't be higher. As WHO's Goodwill Ambassador for Arts and Health, I've seen how important the arts can be in, for example, reducing anxiety and helping improve symptoms and recovery of mental health conditions. Imagine a future where everyone has access to healthcare and where physical, mental, and social well-being are prioritized. I'm calling on governments, donors, and foundations to invest. You can help too. Supporting WHO means investing in a future where everyone can access the healthcare they need. Join us in making a meaningful difference. Act now. All for health, health for all. Invest in WHO.
WHO is leading a global effort to improve health and well-being, but urgently needs your support. To continue its crucial work, WHO needs to raise $7.1 billion to fund the core of its program of work over the next 4 years. Today, over 2 million people still lack access to essential health services. The stakes could not be higher.
Colleagues, when we suspended for lunch, there were a number of requests for the floor from a number of member countries pertaining to agenda item 2. We will now resume discussions on item 2, and I give the floor to Guinea-Bissau, to be followed by Philippines.
Merci, le Président.
Thank you, Chair. Thank you to the Chair of the Executive Board. Thank you to the Director General. Guinea-Bissau would like to echo the statement made by Cameroon, and it would like to say that it's a great honor to participate in this meeting, that is the 156th session of the Executive Board of the World Health Organization. At the outset, I would like to congratulate all of the team at the WHO for their great stewardship and their contribution to responding to the numerous health challenges that the world is facing. The organization has proved to be an essential player in finding solutions to the health issues that we face and in coordinating efforts to respond to emergencies, as well as to ensure that countries are better prepared to face public health crises. The work carried out by the organization to bolster health services is helping to save lives, control crises, develop vaccines, develop diagnostic testing, and make medication available. And all of this has been very important. There is no doubt that the efforts of the organization have had a positive impact on the lives of millions of people around the world. Over the last few years, we have been facing major challenges such as the public health emergencies, pandemics, and various crises. All of the WHO's commitment to working with the member countries has enabled us together not just to mitigate the crisis effects, but also to create effective strategies to prevent crises in the future. We are persuaded that continued investment in public health is essential to save lives, and the work of the WHO in this respect is an example for us to follow. Fighting for equity in the context of health.
Thank you, Guinea-Bissau. And I'll give the floor to Philippines, to be followed by Portugal.
Thank you, Mr. Chair. Our collective resilience as a WHO will enable us to face sustainable financing challenges with a determination to achieve the health-related SDGs and universal health coverage through transformative primary health care. The Philippines believes in the WHO's capacity to advance health equity and strengthen health systems resilience, especially among vulnerable populations in lower and middle-income countries. Working closely together with member states and guided by the compass of the 14th General Program of Work, the WHO can fulfill its obligation in global health governance, improving access to essential health services, providing appropriate health and care workforce, and broadening primary health care to cover emerging concerns such as NCDs and mental health. The realization of WHO's mandate hinges upon consistent and sustainable financing. Member states must take bold yet decisive actions to ensure greater investments in health. We must invest in multilateral actions through increased access, contributions, and additional voluntary contributions to achieve the outputs and priorities set forth in the GPW14. By supporting the investment round, the Philippines has demonstrated that every economy can substantially contribute to sustaining regional and global efforts, especially with the looming threats of hurdles in financing WHO. We believe in the value of multilateralism to address shared health challenges and collective actions such as the UN General Assembly High-Level Meeting on UHC and the Intergovernmental Negotiating Body for the Pandemic Agreement. For these initiatives, our priority at this point should be to sustain an efficient managed, and adequately resourced WHO with a strong focus on results, value for money, and equity. Thank you, Mr. Chair.
Thank you. I now give the floor to Portugal, to be followed by Singapore. Portugal.
Yes, sorry. Portugal aligns itself with the statement delivered on behalf of the European Union. The Director General's report highlights progress and persistent challenge, reaffirming that health is a fundamental human right and the foundation of sustainable development. Portugal is committed to strong, resilient health systems based on primary health care and equitable access to essential services, key pillars of the universal health coverage. We commend WHO's leadership in workforce planning and education, including the WHO Academy, and support initiatives addressing workforce shortage and inequities. Climate change is a growing threat to health. Urgent action is needed to integrate health into climate policies, ensuring mitigation and adaptation efforts protect vulnerable populations. The burden of non-communicable disease, including mental health, continues to rise. The 2025 UN high-level meeting on NCDs is a critical opportunity for strong commitments to prevention, early detection, and equitable care. Mr. Chair, active conflicts worldwide are devastating health systems and lives. Portugal calls for an end to hostilities and the protection of healthcare under international law. At this crucial moment, Portugal reaffirms its commitment to multilateralism and WHO. Global health challenges demand solidarity, and WHO role in uniting nations is indispensable. Now more than ever, we must rely behind WHO to strengthen its mandate and safeguard global health. Thank you.
Thank you, Portugal. I now give the floor to Singapore, to be followed by Palestine.
Thank you, Chair. Singapore appreciates the centrality and vital work of the WHO in promoting, providing, and protecting health globally. We thank Director General Dr. Tedros and his team at all three levels of the WHO for their tireless work on global health, particularly in health emergencies and preparation for pandemic threats, advancing universal health coverage and primary health care and health promotion. Given the budgetary concerns, there is greater impetus to advance the transformation agenda to make WHO leaner and more effective. Member states, too, must play their part to help WHO prioritize its work to those that are most impactful, informed by country and regional contexts. We agree that WHO must be adequately resourced to do its work. Hence, Singapore was one of the first to pledge our support for the WHO investment, and we also support proceeding with the proposed 20% increase in assessed contributions as previously recommended. Thank you.
Thank you, Singapore, and I'll give the floor to Palestine, to be followed by the plurinational state of Bolivia.
Thank you, Honorable Chairperson, Your Excellency Minister of Health and Wellness of Barbados, Excellency Director General, Excellencies, ladies and gentlemen. Palestine welcomes the Director General insightful report. Palestine-occupied territory, Gaza Strip, and the West Bank, including East Jerusalem, has long been overwhelmed by multiple emergencies. And 2024 was our worst year ever since the Nakba in 1948, 77 years ago. Polio outbreaks during the Israeli care facilities and personnel, and the collapse of the public health system due to the Israeli war for more than 15 months. Our health and the humanitarian workers in the occupied Gaza Strip enclave say this war was the most brutal, horrific, and severe they have ever witnessed. The occupation continues in the Gaza Strip enclave and the West Bank, including East Jerusalem. We need a strong commitment from the international community, helping rebuilding the Palestinian public health sector and supporting the mental health programs. The trauma is huge, so help us to preserve the remaining of our humanity. WHO has been an essential health provider along with the UNRWA and partners, and the State of Palestine Health Ministry providing health for all in Palestine. We call for a sustainable funding of WHO programs in the world and leaving no one behind. I thank you, Mr. Chairperson.
Thank you. Thank you, Palestine. I give the floor to the plurinational state of Bolivia, to be followed by South Africa.
Thank you, Chair. We'd like to thank the Director General for the report, and we reiterate our commitment and gratitude to him for his work and also to his team. The progress described by the Director General cover the 5 pillars since the previous exercise, and we reiterate the importance of the organization's work at international level. We're living through a difficult time due to the various crises that we're facing in the world, and these activities are there are activities trying to undermine multilateralism. Therefore, it is essential to promote dialogue and consultation that will help to bolster the work of the WHO, as well as its proper functioning in order to tackle the current challenges. For Bolivia, it's important to have joint efforts that will help us to defend the right to health. It's essential to work to bolster healthcare systems and to work on the prevention, preparedness, and response in the face of future health emergencies. On this matter, we hope that we'll be able to adapt an ambitious agreement that will place the principles of equity and solidarity at the heart of the agreement in order to ensure more equitable access to health. We also believe in the importance of the programs of the WHO not being politicized. It's also important for a gender approach to be included, including indigenous peoples and people in particular situations of vulnerability. On this matter, we'd like to highlight the traditional medicine strategy 2025-24. We need to respect the knowledge of indigenous peoples and ensure that they are preserved. At regional level, we held a recent meeting alongside the PAHO, and we'd like to reiterate our willingness to foster cooperation and joint actions, as well as to implement our national plans, strategies that help to ensure high-quality services and to promote health within our policies. Bolivia would like to reiterate its support to the WHO and our commitment to promoting the right to health for all. Thank you.
Thank you, Bolivia. I now give the floor to South Africa, to be followed by the Islamic Republic of Iran.
Thank you, Chair. South Africa thanked the Director General for this well-articulated report, highlighting several challenges in alliance to the statement delivered by the distinguished delegate of the Republic of Cameroon on behalf of the 47 member states of the Africa region. We also thank the Director General for outlining the need to protect, promote, as well as provide health as the core function of WHO. And therefore, we support the funding, predictable funding, continued predictable funding that WHO is supposed to have, and applaud member states for the decision that they've taken in 2022. The program budget to implement the 14th general program of the World Health of the GPW 14, 2025 to 2028, came at a time of the financial and political difficulties with new political directions. The global community should remain resolute to bring an innovation in what we are doing. We still support the view to continue with assessed contribution coupled by robust resource mobilization efforts with the investment round which was launched in 2024. We are at a critical time of global health where the most of 2030 Sustainable Development Goals need to be brought back to track. Thus, the solidarity and commitment by all is very critical. Our commitment on building resilient health system through strengthening primary health care and ensuring universal health coverage remain fundamental and a foundation to achieving health equity. To this end, we note that addressing the universal health coverage is critical, and particularly for human resources and the 6 pillars that WHO has put on the table. Therefore, human resources and financing become critical. That is why the finalization of the intergovernmental negotiating process of WHO for the pandemic instrument remain an agent to build member states' capacity to deal with.
Thank you, South Africa. I now give the floor to the Islamic Republic of Iran.
Thank you, Mr. Chair. The Islamic Republic of Iran thanks the Director General of the World Health Organization for his report. Iran would also like to express its support for the work of the WHO. We do pay tribute to all healthcare heroes in saving the lives of the people around the world, especially in humanitarian situations and humanitarian crises such as Gaza. At a time when multilateralism and its institutions are under severe pressure, it is important that we, the member states, take the necessary steps to strengthen solidarity among nations and promote the principle of equity at the global level. Our common endeavor toward filling the existing gap between developing and developed countries would contribute in full enjoyment of the highest attainable standard of health for everyone across the world. No one and no country should be left behind. In this context, and in light of the recent financial and budgetary concerns, a realistic and comprehensive approach for adjusting or resetting priorities of the organization would ensure better pursuit of the lofty goals of the institution in the months and years to come. The consultation process should continue to be inclusive and with the participation of all member states. This is the case for countries and regions like Eastern Mediterranean region, which are affected most by debilitating challenges, including the scourge of war and hindered access to health-related products. Mr. Chairman, Iran remains committed to continue its support to the work and cause of the World Health Organization. Thank you.
Thank you, Iran. I now give the floor to the Republic of Tanzania, to be followed by Malaysia.
Thank you, Chair. Tanzania aligns with the statement made by Cameroon on behalf of the African Group. The United Republic of Tanzania commends the Director General for the exemplary leadership in addressing global challenges, including geopolitical tensions, humanitarian crisis, and climate change, which have resulted in health emergencies. The comprehensive report highlights notably achievement and ongoing challenges. Tanzania also appreciates WHO efforts in improving health care, combating infectious diseases, and enhancing well-being globally. We value the organization's support in addressing cholera outbreaks, advancing maternal and child health, and also conducting joint evaluation and the universal health and prepared review. We congratulate the Director General for guiding member states in amending the IHR and drafting the pandemic agreements, and therefore we urge member states to finalize negotiations through the Intergovernmental Negotiation Body. Chair, despite progress, challenges persist, including limited healthcare access, inadequate health infrastructure, and the need for robust health data systems. Addressing this requires corrective efforts among member states and partners. Tanzania reaffirms its commitment to working with WHO and other stakeholders to achieve shared goals, strengthen health systems, and prioritize citizens' well-being. Thank you, Chair.
Thank you, Tanzania. And I'll give the floor to Malaysia, to be followed by Zambia.
Thank you, Chair. Honorable Ministers, Director General, and colleagues, we thank the Secretariat for the comprehensive report provided by the Director General and reaffirm our commitment to multilateralism, supporting the WHO in its pivotal role in advancing global health. We endorse the GPW 14, which is based on priorities identified by the member countries and the base program budget that must be responsive to the unique needs of individual member states and dedicated to strengthening country capacities and enhancing WHO's accountability. We remain committed to the proposed 20% increase in AC to achieve predictable financing, which should be accompanied by appropriate governance reforms, along with further enhancements in transparency, efficiency, accountability, and compliance within the organization. We call for additional voluntary contributions by supporting the investment round. Mr. Chair, urgent attention is required to address health challenges such as increasing burden of NCDs, communicable diseases, and climate change. Malaysia continues to improve its health system through systemic and structural reforms in order to respond to these health challenges and to ensure greater equitability, sustainability, and resilience of the health system. We also commend the exceptional work under WHO Health Emergencies Programme, which continues to save lives in challenging circumstances and remains committed to delivering health services to those affected by emergencies and disasters. Hospitals and health facilities must remain safe havens for patients and health workers. Malaysia continues to advocate for the rights of the Palestinian people and will play a role in the reconstruction of rebuilding of Gaza, Palestine. Malaysia will co-chair the Conference on Cooperation among East Asian Countries for Palestinian Development to establish a dedicated fund and invite countries to mobilize efforts to rebuild Gaza, its occupied Palestinian territory, and alleviate the suffering of the Palestinian population. Malaysia will continue to contribute as we chart the course for public health in an uncertain global environment to achieve health for all. This commitment reflects Malaysia's belief in promoting equity, solidarity, and transparency as the fundamental principle of a stronger and more resilient global health landscape. Together, we can make significant strides in improving health outcomes to achieve the SDGs. I thank you, Co-Chair.
Thank you, Malaysia. I now give the floor to Zambia.
Thank you, Chair, for giving me the floor. Zambia aligns itself with a statement delivered by Cameroon on behalf of the 47 member states of Africa. We thank the Director General for his comprehensive report and commend the WHO for the significant progress made, such as the establishment of the WHO Academy in France, the WHO Foundation, the WHO Dashboard for tracking Secretariat Implementation Plan on Reform Actions, the investment round, and the continued support of the WHO at country levels, including in humanitarian settings. Zambia wishes to reaffirm its continued support to the WHO and its strong advocacy for global health and multilateral diplomacy. We are confident that collectively we will continue to build on gains that we have made. Cognizant of the complex challenges we face in view of the prevailing economic and financial context, we underscore the importance of the principle of realistic and pragmatic budgeting and the priority setting criteria in budget allocation with a focus at country level and the core functions of the WHO. We support the request made by the Executive Board for the Secretariat to prepare a comprehensive analysis on priority setting and the impact of additional activities on the program and budget for the May 2025 meeting. We also support the need for a further review of resolutions and decisions, considering that 57 recent resolutions have a budget implication of 2.3 billion on the 2026 to 2027 program and budget. In this regard, resolutions should be streamlined to avoid budgetary burden. We also support the need to find innovative ways to broaden the donor base in order to reduce dependency on strictly earmarked funds. To conclude, we wish to reaffirm our support to the noble cause of the WHO. I thank you.
Thank you, Zambia, and I'll give the floor to Slovakia.
Thank you, Honorable Chair, Director General, and esteemed colleagues. Slovakia aligns itself with the statement delivered by Poland on behalf of the EU and its member states. We thank the Director General for his report and for outlining both the achievements and persistent challenges facing WHO and global health in 2025 and beyond. While we recognize the significant progress made across WHO's core missions, the challenges ahead require decisive action, strategic prioritization, and sustainable commitment from all member states. Innovative approaches are essential to addressing challenges and sustaining critical programs. This requires close collaboration with member states through transparent priority area assessment, enhancing financial sustainability with flexible funds and innovative financing, and a stronger governance framework based on science-led gap and risk analysis to ensure new commitments align with available resources. While progress has been made, half of the world population still lack access to essential health services. Therefore, we call for acceleration of efforts to strengthen regulatory oversight to ensure equitable access to medicine and health technologies, particularly for vulnerable populations and those in humanitarian needs, and sustainable financing models to prevent catastrophic out-of-pocket spendings and deepen pockets of the poverty. Non-communicable diseases remains, as you have reminded us, leading cause of global mortality and exacerbated by environment and lifestyle factors. Therefore, we must more invest on the technical but also financial level in the leadership of WHO's role in developing of behavioral and social science to continue to shape effective public health innovations. WHO currently stands at critical junction, and the financial realities we face must result into the reforms, efficiency and stronger global cooperation. Therefore, we call on us, member states, to support WHO financial sustainability measures, including the proposed 20% increase in access contributions, to engage constructively in governance reform, ensuring the WHO remains focused on its important and most pressing priorities and normative role, and strengthen global solidarity and multilateralism, recognizing that well-funded and effective WHO is the collective interest of all nations. As we move forward, we must ensure that WHO's vision of health as a right for all remains a reality, not a privilege. Let us act with urgency, responsibility, and share commitments to global health security and equity to ensure that DG's reports in upcoming years will be more positive, sharing more achievements at all 3 Ps level, and strengthening our multilateral effort to improve global, regional, local, and individual health with all and for all. I thank you.
Thank you, Slovakia. I now give the floor to Togo.
Merci, Monsieur le Président.
Thank you, Chair. Togo aligns itself with the regional statement delivered by Cameroon on behalf of the 47 countries of the African region. Togo would like to thank and commend the Secretariat for the progress achieved and for its role as coordinator in health interventions across the world. Togo appreciates WHO's work in member states in combating communicable and non-communicable diseases and in responding to health emergencies. And Togo is implementing its Health Development Plan 2023 to 2027, which is focused on strengthening the health and community-based systems and in combating diseases and in responding to health emergencies and social protection, which meets the criteria in the pillars of the GPW of the WHO. Togo invites the Secretariat to broaden the base of donors and to ensure the optimal use of resources that are mobilized while underscoring regional priorities. Togo would also like to encourage the Secretariat to ensure flexibility, transparency and predictability in financing and in strengthening solidarity. Thank you, Chair.
Thank you, Togo. I see no further requests from member countries. Are there any requests from observers, UN organizations, or intergovernmental organizations? Thank you. I see no requests. I would now like to give the floor to the Director General to respond. Dr. Tedros, you have the floor.
Yeah, thank you. Thank you so much. I think these are clear support and guidances, and I don't know if there is any need to respond, but I will say a few words. First of all, thank you so much indeed for your confidence in the multilateral system. I think many of you have already said why multilateralism is important. But in that, many of you have also underlined the central role that WHO plays in global health. And thank you for your support on that as well. Maybe I will take one, I will quote one, WHO's role as a guardian and defender of the most vulnerable. I think that's from, I wrote that with forgetting who actually said that, but I think that represents WHO very, very well. I think that's from Micronesia, I remember. Yeah, it's from Micronesia. So thank you so much for your confidence in WHO. And at the same time, as Canada said, organizational reform never stops. So you have a confidence in WHO, and you also want WHO to evolve. And these two go together, and that's what we assure you that we will make sure that that happens. So thank you for your confidence, and we will continue to work hard to make sure that this organization evolves to meet the evolving situation. And then thank you also for your support on, especially for the sustainable financing. We started this together 7 years ago, almost 7 years ago, when we identified together the major risk of WHO is its dependence on a few number of donors, and that poses actually a risk for WHO. That's a main risk. By the way, that systemic problem is related or affects many of our work, as we have analyzed at that time, which is the same position. For instance, with lack of flexibility of funding and the volatility of the funding, we cannot plan, and we cannot support countries based on their priorities. That's really a major problem, because as many of you also say today, we're off track from SDGs, and in order to achieve SDGs, we should support countries based on their priorities. The flexibility of funding actually can help make that happen. So we have identified that together, and you know it affects the result or the impact because of lack of flexibility of funding. But not only that, the contractual modalities as well with staff. Many staff are working on temporary contracts, a good number on 60-day rolling contracts. It's this staff also which has been working very hard during COVID, passing through a very stormy weather and delivering. So the sustainability of the financing can address this, and it can help this chronic problem that many of our staff are facing. So your commitment and support the last 7 years, and including this year, very strong support on sustainable financing, is really heartwarming. And on behalf of my colleagues, all WHO colleagues, I would like to express my deep appreciation and gratitude. Of course, with that, this is what I see now developing. 2 years ago, you have agreed to increase the assess contribution by 50%, and the first tranche was done. And I think what now we have in our in your hands is the second tranche, and which is going to be very important, especially given the current situation. And if there is one ask I will have, is for all of you to really push this, and this becomes a consensus, and we have the second round of the assess contribution on time. That's the only ask I will have, but of course I have seen already full support from many of you in your interventions, and I believe that this will happen. Then you have also indicated some of the new financing mechanisms we're thinking about. Of course, we have discussed this during the retreat as well, especially the endowment, and would really appreciate it if you can explore that, and if you can give us any advices you have before we make a move. With that, I think, thank you so much again. Really, we're on the same page. Really appreciate all the comments, the guidance, and the advice that you have given us. And thank you also for your kind words. And I wish us a successful EB. And with that, back to Chair. Thank you.
Thank you, Dr. Tedros. I see no further requests for the floor at this time. I want to thank the Director General and the Board for this very fruitful discussion. The Director General's report is noted. And this concludes the Board's consideration of Agenda Item 2. We shall now consider Item 3, Report of the Regional Committees to the Executive Board, contained in document EB 156/3. This report summarizes the proceedings of the WHO regional committees based on the reports of the committee chairs. It has been prepared pursuant to the proposals for enhancing alignment between the regional committees and the Executive Board, and a decision by the Health Assembly that chairs of the regional committees should routinely submit a summary report of the committee's deliberations to the Board. The report focuses on the key issues and outcomes of the regional committees, particularly those that are of global significance and those that respond to decisions of the Health Assembly and the Executive Board. The floor is now open for discussion. Kindly raise your nameplate should you wish to take the floor. I give the floor to Qatar.
Honorable Chair, distinguished delegates, ladies and gentlemen, the Eastern Mediterranean region thanks the Director General for his report. And with reference to the key outcomes of the 71st session of our Regional Committee, held in Doha in October 2024, our discussions reaffirmed our shared commitment to strengthening health systems, improving access to essential health services, and addressing pressing health challenges that disproportionately impact our region. We recognize that achieving universal health coverage and sustainable development requires collective action, political will, and strategic investment in public health. The endorsement of the Regional Strategic Operational Plan for 2025-2028 shows our ambition to build more resilient, responsive, and equitable health systems. This vision will be translated in action to face our public health challenges, such as trauma care in humanitarian settings, antimicrobial resistance, and mental health support in emergencies. Strengthening local capacities in vaccine production, laboratory services, and digital health transformation of the health system will be crucial for ensuring that our populations receive timely and quality healthcare services. We remain committed to accelerating progress on the Immunization Agenda 2030, recognizing immunization as a cornerstone of disease prevention and health security. Effective governance and sustainable financing are essential in translating strategies into actions. Discussions on WHO's investment case, the program budget, and ongoing global health negotiations reinforce the importance of securing predictable resources and ensuring that WHO remains fit for purpose in responding to global and regional health challenges. We also reaffirmed our commitment to addressing non-communicable diseases, extending, for example, the mandate of the Ministerial Group on Tobacco Control, and fostering stronger regional and global collaboration in tackling other public health threats. As we move forward, the Eastern Mediterranean region remains firm in its dedication to health equity, resilience, and international solidarity. We will continue to work closely with the Executive Board and the wider global health community to turn our commitments into concrete actions that improve the health and well-being of our populations. Thank you very much.
Thank you, Qatar. Now give the floor to Zimbabwe.
Thank you, Chairperson. I make this statement on behalf of the Africa region. The Africa Regional Committee passes a condolence message on the unexpected passing of the WHO Africa Regional Director-elect, Dr. Faustine Dukulile, in November 2024. Africa region notes the important issues discussed by the various regional committees and that they are progressive for global health and advancement of the universal health coverage agenda. The reports addressed critical issues and themes that require urgent attention and critical to strengthen the global health. Of importance to the Africa region are the discussions around, one, rising burden of non-communicable diseases, There is a rising burden of non-communicable disease in Africa due to an aging population, urbanization, globalization, and trade, and limited healthcare infrastructure in Africa. The prevalence of hypertension, diabetes, and obesity is increasing in many countries, while cancer is a growing concern. Hence, Africa is now grappling with double disease burden of communicable and non-communicable diseases. The Global Framework on Diabetes Compact was adopted for implementation with the 2030 global coverage targets noted. 2, the pandemic agreement. The Africa region notes with concern the slow pace at which discussions around the pandemic agreement are progressing, considering the outbreaks of Mpox, Marburg, and cholera in the African region. 3, sustainable health systems. On climate resilience, Africa notes and supports the discussion around climate resilience and sustainable health systems. Climate resilient programs have become important due to the necessity of protecting livelihoods, enhancing food security, supporting human health, reducing poverty and inequality, and promoting sustainable development. So climate resilient programs need to be upscaled in Africa. On health financing, the African region is in full implementation of WHO's first investment rounds, which have been adopted by other regional committees. The investment rounds will enable us to have the WHO we want, a body capable to lead and support pressing global health threats and initiatives. Furthermore, the African region notes with satisfaction the initiatives from other regional committees, especially the Southeast Asia Regional Emergence Fund. Such an emergence fund in Africa will help enable a swift response to natural disasters, epidemics, and other crises, improving coordination and collaboration, enhance preparedness and resilience, and increase accountability and transparency. Access to medicines, vaccines, and technologies. Africa calls for multilateral collaboration in its efforts to manufacture medicines, vaccines, and other technologies locally. The lessons from the COVID pandemic have taught us the importance of local production, which will improve access to vaccines, create jobs, improve health security, and reduce dependence on external aid. The Africa region, therefore, recommends the adoption of the report by the Executive Board. I thank you and I submit.
Thank you, Zimbabwe. I give the floor to Moldova.
Thank you, Chair. Mr. Chair, distinguished members of the Executive Board, the Republic of Moldova takes note of the report to the Executive Board. We acknowledge the comprehensive nature of this report and commend the efforts of the WHO Secretariat and the regional committees in fostering alignment between regional and global health priorities. We particularly recognize the key issues and outcomes highlighted within the report, which emphasize global health security, preparedness, and the continued efforts to strengthen health system across all WHO regions. With respect to the Regional Committee for Europe, we express our support for the adopted decisions on health emergency preparedness, response, resilience, as well as the regional framework for resilient and sustainable health systems and an emergency medical team's regional action plan. We also take note of the discussions surrounding equitable access to medical products, local vaccine production, and health workforce resilience, which are essential for achieving universal health coverage and sustainable healthcare financing. These issues remain particularly relevant for the Republic of Moldova as we strive to enhance our healthcare system efficiency and resilience. I thank you for your attention.
Thank you, Moldova. I now give the floor to Togo.
Thank you very much, Chair. Togo aligns itself with the regional statement delivered by Zimbabwe on behalf of the 47 countries of the African region. Togo would like to present its sincere condolences to the Tanzanian people and to the WHO on the passing of Dr. Faustin Ndugulile, Regional Director-elect of the WHO African region, and we would like to commend the regional directors for their reports and for the progress achieved to promote health and primary health care for universal health coverage. Togo, in particular, would like to commend the African region for its implementation of its transformation program and flagship initiatives in favor of prevention, preparedness and response to public health emergencies. Togo advocates for the Director General's support in concluding an expedited procedure to nominate a new regional director for Africa. Togo invites the Secretariat to ensure an equitable distribution of resources while taking into account regional priorities and to expediting negotiations for a pandemic agreement and strengthening multi-sectoral collaboration. We take note of the report. Thank you, Chair.
Thank you, Togo. Are there any other requests for the floor from the EB members? See no requests. Are there requests? Indonesia, you have the floor.
Chair, we thank the Secretariat for its report, including deliberations of our reassignment from CHRO to WEPRO in respective regional committees. For 74 years, as a CHRO member, Indonesia has contributed to the advancement of regional health priorities. The COVID-19 pandemic underlined the need for stronger collaborations with our closest neighbors, many of which belong to WEPRO, to address shared health challenges. Indonesia shares land and maritime borders with 10 countries and maintains direct flights to 18 countries, most of which are in WEPRO. This geographical positioning and extensive connectivity heighten epidemiological risk at point of entry, underscoring the vital importance for robust cross-border surveillance and response. At the same time, shifting demographics, rising burden of NCDs, and intensifying health risks of climate change in archipelagic nations like ours require comprehensive strategies with countries that share similar epidemiological profiles. Our reassignment to WEPRO would align our health priorities with our neighbors and ASEAN member states, whilst providing ourselves and the regions with opportunities for mutual learning and collaboration. Our reassignment would not diminish our long-standing bonds with other CHRO members. We would continue our engagement through bilateral and multilateral platforms to advance shared health priorities. We remain deeply committed to the WHO's values and objectives and believe this reassignment will allow us to contribute more effectively and bring greater impact to regional health agenda. Thank you, Chair.
Thank you, Indonesia. I see no further requests. At this time, I'm going to ask the 6 regional directors to respond. I'll start with the region and Africa region. You have the floor.
Thank you very much, Chair and distinguished members of the Executive Board. The 74th session of the WHO Regional Committee for Africa convened over 600 participants to discuss the region's health priorities. I very much appreciate the summaries and comments made by our member states on this discussion. As has already been said, Dr. Faustin Ndugulile, from the late now Dr. Faustin Ndugulile from the United Republic of Tanzania, was nominated as the next regional director for Africa. I was very much looking forward to transitioning with him after his appointment by this session of the Executive Board. And tragically, this was not to be. We mourn Dr. Faustin's untimely passing, and again, would like to extend on behalf of all my colleagues in the region our deepest condolences to his family and to the country of Tanzania. The Regional Committee reviewed the impact of the transformation agenda in the African region, as has already been noted, which has led to enhanced resource allocation to country offices, faster outbreak detection and response with enhanced country capacities, the lessons learned from the COVID-19 and climate change emergencies being transformed into strategies to strengthen national health systems. And today, nearly 90% of our countries having national health system strategies based on primary health care. And I'd like to say that a recurring theme was the close connection between epidemic preparedness and response and health system strengthening, which has already been echoed here in the Executive Board. In addition, we reviewed during the Regional Committee the experience of the small island development states having pooled procurement, established a mechanism which enabled them in some cases to reduce the cost of essential medicines by over 40%. This is an experience that we are sharing with the rest of the region, and we are working to share also with the African Union as it establishes the Africa Medicines Agency, because we know that the procurement of medicines in our region is one of the highest costs that our member states face. Another area of progress that we would like to share and was shared was that the nearly 23% increase in the percentage of women in professional and higher categories between 2017 and 2023, which we agree we need to continue to build upon. In addition, key frameworks were adopted in the following 5 areas. First, building climate resistance health systems, local production of medicines and vaccines, diabetes prevention and control, echoing the fact that non-communicable diseases are fast increasing in incidence and prevalence in our region, data integration and digitalization, strengthen the health system's preparedness and response architecture. Further, the meeting emphasized the need for predictable and flexible funding. In response, member states have indeed reaffirmed domestic health financing commitments and backed an increase in assessed contributions to WHO. Subsequently, during the WHO investment round session, during a successful session, Africa member states pledged over $45 million to the investment round in an unprecedented show of support, which we deeply appreciate and continue to build on. In my last regional committee as regional director, I thanked the ministers and partners sincerely for their collaboration and support throughout my mandate, and I thank you too, Chair. Thank you.
Thank you, Director. I now call on the Director of the Region of the Americas.
Thank you, Mr. Chair. Distinguished members of the Executive Board, Director General, ladies and gentlemen. The 65th Directing Council of the Pan-American Health Organization and 76th session of the WHO Regional Committee for the Americas was held from 3rd September to 4th October 2024 at the PAHO headquarters in Washington, D.C., and presided over by Dr. Maria Teresa Baran, the Minister of Health of Paraguay. In relation to topics for global discussions, the Regional Committee discussed the draft proposed program budget of WHO for 2026-2027, emphasizing transparency, efficiency, and measurable impact. Member states noted the proposed 20% increase in assessed contributions and asked the Secretariat to outline various funding scenarios. The Regional Committee reviewed the work of the Intergovernmental Negotiation Body. Member states stressed the importance of regional participation and reaffirmed their commitment to the ongoing global discussions. On the process for the election of regional directors, Member States expressed confidence in the current election process while showing openness to potential improvements. They stressed the importance of preserving the region's autonomy in the election of the regional director, given PAHO's dual status as both a WHO regional office and an independent organization within the Inter-American system. An event titled WHO Investment Round, celebrating the Americas' contributions to a sustainable WHO, was held. Under the leadership of Brazil as G20 President, Canada, and the United States, the event gathered representatives from member states and a wide range of NSAs, donors, and stakeholders. Regarding topics of regional significance, the Regional Committee endorsed the proposed roadmap for the next PAHO Strategic Plan for 2026-2031, which addresses regional priorities from the Sustainable Health Agenda for the Americas 2018-2030 and global priorities from the GPW 14. Efforts to achieve the health-related SDGs will continue under this new strategic plan. The Regional Committee adopted 14 resolutions by consensus. These resolutions include policies, strategies, and plan of actions on equity-oriented health sector action, climate change, epidemic intelligence for early warning of health emergencies, strengthen public health functions, long-term care, strengthen health information systems, integrated emergency, critical, and operative care, reducing the burden of sepsis, flexibilities in our pool procurement mechanism to leverage regional production of vaccines and health technologies and tobacco control. Additionally, Member States received briefings on issues of relevance for the region, including the elimination initiative for communicable diseases, telehealth to enhance equity and care, and cervical cancer elimination. The Regional Committee's agenda effectively addressed the region's priorities, leading to a record number of participants and interventions from Member States and NSAs. This concludes my presentation, Mr. Chair. Thank you.
Thank you, Director. I now call on the Director for the Eastern Mediterranean region.
السيد الرئيس، أصحاب المعالي والسعادة، المدير العام، السلام عليكم.
Thank you, Chairman. Your Excellencies, ladies and gentlemen, Director General, it is my pleasure to present to you a brief review of the 71st session of the Regional Committee for the Eastern Mediterranean. I am very happy that we had support given to us since I took over as Regional Director last year. We have adopted an operational strategic plan which will be used in the implementation of the General Programme of Work 14 in our region. We are taking initiatives to promote work to improve the health situation in our region, and we are trying to make sure we have better access to and supplies of medicines across the region. The plan is also going to further action to transform the organization and to certify procedures to improve support given to member states and to ensure we make the best possible use of partnerships through our Regional Health Alliance, which we think will open up new and better prospects for everyone. Our member states are perfectly aware of the enormous humanitarian problems in the region and the need to plug the gap between growing needs and shrinking financing. We have adopted a regional executive framework to assist people suffering from trauma as a result of humanitarian crises. We have a regional mental health plan and a particular plan to help people in emergencies so that we can prepare for them better as well. We've adopted many regional instruments on major issues such as controlling antimicrobial resistance, promoting digital health systems, implementing vaccination programs between now and 2030, encouraging local production of vaccines, and improving the services provided by health laboratories. I will conclude it there. Thank you very much for your attention.
The Director of the European region.
Mr. President, Dr. Tedros, honorable delegates, the 74th session of the WHO Regional Committee for Europe marked the end of my current 5-year mandate as the Region Director. 5 years of unprecedented turbulence. We learned there is no national security without health security. Hence, we are grateful that the RC74 adopted Preparedness 2.0 strategy along the first regional action plan for emergency medical teams. We learned that rebuilding trust in health institutions is essential. Hence, RC74 adopted the new framework for resilient health systems. Transparency, accountability, and efficiency are critical for member state trust in time of fiscal constraints. Hence, we are grateful to the countries for continued groundbreaking work on participatory governance. I was profoundly honored by the trust placed in me for my unanimous renomination as Region Director. we started co-creating the European Programme of Work number 2, EPW2, through a very innovative process. All 53 health ministers nominated a focal point to prioritize laser-focused WHO actions. We are organizing hearings around 5 megatrends shaping health in the region. EPW2 aligns with GPW14 and the SDGs, but we also are looking towards 2050 using foresight exercises. And this is the first broad consultation process using open AI, respecting privacy. The North Stars for EPW2 will be technical excellence and financial sustainability. Finally, let's remember the immortal words of the German philosopher Schopenhauer. Health is not everything, but without health, everything is nothing. Thank you.
Thank you, Director. I now call on the Director for the Southeast Asia region.
Good afternoon, Honorable Chair, Excellencies, Director General, members of the Executive Board and colleagues. The 77th session of the Regional Committee for Southeast Asia was held in New Delhi, India from 7 to 9 October 2024 under the chairmanship of the Honorable Minister of Health and Family Welfare, Government of India, who emphasized the need to harness the power of collaboration, innovation and solidarity to transform the health landscape of the Southeast Asia region and build a healthier, brighter future for all. The Honorable Ministers of Health from Bhutan and Timor-Leste were elected as the two vice chairpersons. I express gratitude to our member states for accepting my vision and refining it into a tangible, practical roadmap for implementation, a roadmap created, modified, refined, and crafted by the representatives of a quarter of all humanity. During my first annual report, the committee recognized the many achievements of our member states and of WHO throughout 2023. The collaboration and cooperation between countries and between WHO regional offices is instrumental in improving the health for all. The Director General's vision and commitments were well received by our member states. The committee adopted 4 resolutions and 2 decisions, including the Ministerial Declaration on Adolescent Responsive Health Systems. The declaration emphasizes cross-sectoral commitment for the physical, mental, and social well-being of adolescents, enhancing financial and human resource mobilization and allocation, and promoting research to integrate evidence-based, adolescent-responsive, or adolescent-friendly elements into our health systems. I am proud to announce that for WHO investment round, our member states and key partner organizations pledged over $345 million, including important in-kind contributions. The committee, via its resolutions, Southeast Asia, SEA/RC77/R2 agreed to increase the corpus of the Southeast Asia Regional Health Emergency Fund to $3 million. And SEA/RC77/R3 urged member states to achieve the elimination of measles and rubella in the region by 2026. The committee also endorsed the strategic plan for measles and rubella elimination and sustenance in the WHO Southeast Asia region 2024 to 2028. Member states congratulated the Secretariat for producing the 9th annual report on monitoring progress towards achieving UHC and the health-related SDGs, which focused on strengthening human resources for health. The committee also appreciated the progress report in 7 of its past resolutions and decisions. Member states of the region were facilitated for the excellent achievements. These are Bhutan achieving interim targets for cervical cancer elimination, India eliminating trachoma, Timor-Leste eliminating lymphatic filariasis, Maldives and Sri Lanka for hepatitis B control in children, Bhutan, DPR Korea, Indonesia, Maldives, Sri Lanka and Thailand for achieving SDG and global targets for reducing under 5 mortality and stillbirth rates. On Indonesia's request to transfer its membership of the organization to the Western Pacific region, other member states recognized Indonesia as a valued member of the region, considered the continued partnership and regional solidarity of over 7 decades, and thus requested Indonesia to reconsider. However, on Indonesia's reaffirmation of its wish, member states respected Indonesia's decision. On the agenda related to the WHO leadership positions, the member state co-leads, Mr. Jose Casio from Australia and Mr. Ding Yang from China addressed the committee. Member states commended the initiatives to strengthen transparency and accountability. The committee supported the proposed measures on nomination and appointment of RDs and agreed to establish an evaluation group to assess the suitability and qualification of candidates for the regional director. In conclusion, I'd like to reiterate my words. If our cause is improving the health of our people, I will stand by you. The Southeast Asia Regional Office will stand by you, and the World Health Organization will stand by you. Remember, the best antidote for crisis is cooperation. Thank you.
Thank you, Director. I now call on the Director for the Western Pacific region.
Thank you, Chair, DG Tedros, distinguished members of the Executive Board, ladies and gentlemen. It is my pleasure to share with you the outcomes of our 75th session of the Regional Committee for the Western Pacific. May I highlight the exemplary leadership of two women serving as chairperson and vice chairperson, a first for our region. Our chair was Honorable Vainatutai Rose Toki Brown, the Minister of Health from the Cook Islands, and our vice chair, Associate Professor Thi Lien Huong, the Vice Minister of Health from Vietnam. Together, they led us to a critical moment for the region, the endorsement of our new vision, weaving health for families, communities, and societies in the Western Pacific. In this vision, we use the metaphor of weaving a mat to represent the importance of working collectively to achieve the highest possible levels of health. And this vision is well aligned with GBW 14. The Regional Committee also addressed other key topics, including health financing, digital health, climate resilience, primary health care, and oral health. The resolutions and frameworks adopted will undoubtedly pave the way for better health outcomes for our communities. We were proud to showcase a new exhibition called Weaving Health for All, highlighting innovative and futuristic approaches to delivering health services even in challenging situations. We also had several side events, including the investment round, which showcased the region's solidarity and commitment with non-traditional donors and small Pacific islands, pledging support for WHO. As I pause and reflect on all of these achievements, I am reminded of the words of Helen Keller. Alone, we can do so little, but together, we can do so much. May I take this opportunity to thank the WHO Secretariat for preparing my first successful regional committee. To our member states, thank you for your dedication and contributions to WHO, especially during these challenging times. Together, we will rise stronger and healthier, united in our commitment to a brighter future. I thank you.
Thank you, Director. I see no more requests for the floor. I take it that the board wishes to take note of the report. I see no objection. The report is noted. This concludes the board's consideration of item 3. We shall now consider item 4, report of the Program, Budget and Administration Committee of the Executive Board. 41st meeting of the Program, Budget and Administration of the Executive Board was held last week from the 29th to the 31st of January. Document EB 156/4 contains a report of the committee. As I mentioned during the opening, the PBAC considered and had in-depth discussions on several items that appear on our agenda. As we turn to each of these items, I intend to draw the attention of the board to the specific recommendations of the PBAC and ask if the board concurs. I propose to first invite Dr. Catherine Marie Loftus of Norway, Chairman of the Program, Budget and Administration Committee, to introduce the committee's report. Then we will turn to the discussion, and I will invite the board to provide any comments on elements of the report which are not covered by items that will come up later on our agenda. In particular, I would like to invite comments in paragraphs 4 through 8 of the PBAC report, including the specific recommendations relating to the report of the Independent Expert Oversight Advisory Committee. We will have the opportunity to discuss all of the other elements covered in the PBAC report when we take up the subsequent items on our agenda under Pillar 4. Does the board agree with this proposal? I see no objection. I shall now ask Dr. Catherine Mary Loftus, Chair of the Committee, to introduce the report of the Programme Budget and Administration Committee. Dr. Loftus, you have the floor.
Thank you, Chair. Director General, Chairperson, Executive Board members, colleagues, ladies and gentlemen. I'm pleased to present the report from the 41st meeting of the Programme Budget and Administration Committee, PBAC. The committee met, as the EB Chair said, from the 29th to the 31st of January 2025 and considered 15 agenda items and sub-items. The full report, which includes specific recommendations for the Executive Board and the Secretariat, is contained in document EB 156/4. PBAC 41 was the first governing body meeting held against the backdrop of a precarious financing situation and the recent announcement by the USA of its intention to withdraw from this organization. We had difficult discussions, but thanks to constructive efforts from both PBAC members and other member states, we were able to agree on recommendation on a reduced program budget for 2026-27, a way forward for further budget revisions, and for increasing the assessed contribution by 20%. I would like to express my appreciation to all the PBAC members for their active engagement, flexibility, and joint work, which allowed us to have a successful meeting and provide meaningful recommendations to EB 156. The focus of my statement at this moment is on key outcomes of the PBAC, particularly those which require action by the Executive Board, noting that specific discussion will occur during the consideration of the relevant agenda items. Of matter considered by the PBAC, the Executive Board is recommended to consider and adopt 3 decisions and 4 resolutions, including 2 decisions under the item on governance reform, 1 decision on non-state actors in official relation, as well as 4 resolutions related to the WHO staff regulations and staff rules. I will explain in more detail the discussions of the committee when we get to those agenda items. With respect to the report of the Independent Expert Oversight Advisory Committee, the chairperson, Mr. Greg Johnson, provided us with an overview of the Advisory Committee's report, which the PBAC appreciated and welcomed the constructive observations and recommendations. The PBAC underlined the need for the Secretariat to continue to provide adequate funding to the internal audit investigative functions. With regard to the investigative function, the Secretariat clarified that the capacity of the Office of Internal Oversight Services had been substantially expanded. Regarding the critical function of risk management, the PBAC called for the Secretariat to continue to implement the risk management framework and the related recommendations of the Independent Expert Oversight Advisory Committee. The Secretariat confirmed that it had started the process to update the accountability framework as requested. Increased attention was being paid to the evaluation function and its recommendations, and that regular monitoring of all accountability function was being performed. The committee noted the report of the Independent Expert Oversight Advisory Committee. It further proposed, as guidance for the Secretariat's implementation of existing mandates, that the Secretariat should continue to implement the recommendation contained in the report of the Advisory Committee. The deliberations and recommendations of the committee on these specific issue are provided in paragraph 4 through 8 of the report of the PBAC. Thank you, Chair.
Thank you, Dr. Loftus. The floor is now open for discussion. Kindly raise your nameplate should you wish to take the floor. I give the floor to Senegal.
Thank you very much, Chairman. Chairman, Director General of the World Health Organization, ladies and gentlemen, ministers, distinguished delegates. Senegal has the honor of delivering this statement on behalf of the 47 member states of the WHO's African region. The African region would like to congratulate the chair of PBAC and pay tribute to her strong leadership and the patience which enabled her to build consensus on major and difficult issues. Our region is also grateful to member states for their cooperation and support, which built a foundation on which we could have useful and constructive discussions with much appreciated support from the Secretariat. The African region would like to reiterate her solidarity, her full solidarity with WHO in the current crisis. It's clear that the African region is going to be the most seriously affected by the announced withdrawal of the United States from this organization. We urge that people show solidarity so that this, well, what will be an immense gap for the African region can be plugged, and we also hope a sustainable solution, a structural solution could be found to this so that we avoid this kind of situation in the future. We intend to contribute, despite everything, to the investment cycle here in WHO, and we urge that the commitment taken on by member states to increase assessed contributions by 20% be respected. Turning to the 2026-27 program budget, this is the first budgetary cycle in the GWP 14. We welcome the assensus achieved on the option supported for its implementation. Nonetheless, we emphasize the need to strengthen the essential functions at country level, taking into account issues such as data, innovation, and research, as well as the principles of transparency and accountability. We urge the Secretariat as soon as possible to publish the results of the various resource mobilization mechanisms and the possible use of funds accrued over the next biennium. During this very difficult period, the African region would like to repeat its encouragement to the Director General and urge him to find resources to help with the most crucial priorities indicated by member states. As to exploitation, abuse, and sexual harassment, the African region urges WHO to promote preventive action on the basis of a multi-sectoral approach. Turning now to progress made in implementing reforms, we invite the Secretariat to continue its discussions with member states so as to identify further reforms, taking into account inter alia the need to strengthen impact at country level and evaluate implementation results. We would also like to hear more about the progress made on implementation and the evaluation of impact that any steps taken has had. We reiterate our commitment as a region to work with all member states to enable WHO to carry out her mission to protect global health for the benefit of everyone on this planet. Thank you for your kind attention.
Thank you, Senegal. I now give the floor to Brazil, to be followed by China.
Thank you, Mr. Chair. First and foremost, since we did not take the floor in the previous item, Brazil would like to acknowledge the report and the great work being carried out by the Regional Committee for the Americas, its director, Dr. Jarbas Barbosa, and the AMRAM team. Brazil, as one of the two representatives of the Americas region in the PBAC with Barbados, would like to recognize the work of WHO Secretariat and of Norway, spearheaded by Dr. Catherine Loftus, in guiding member states through challenging times. These past few days have involved extensive discussions, particularly during the 41st session of PBAC last week, which provided guidance and made recommendations for this executive board. I cannot stress enough this governing body's importance, as its discussions comprise some of the most critical aspects of this organization: human resources, governance reform, and sustainable financing. In the area of human resources, we deal with the lives and livelihoods of one of WHO's most valuable assets, its workforce in all its levels, headquarters, regional, and country offices. This dedicated staff deserves our highest respect. As for governance reform and sustainable financing, they go hand in hand. And it's our responsibility, member states and secretariat, to steer this organization with efficiency, transparency, and accountability. The World Health Organization has been, and continues to be, since its inception 3/4 of a century ago, the center of the global health architecture. It is our duty, as member states, to support this invaluable institution in our shared pursuit of health equity. I thank you, Mr. Chair.
Thank you, Brazil. I now give the floor to China, to be followed by Somalia.
Thank you, Chair. China thanks the work by Secretariat, particularly the work by PBAC and the leadership of Norwegian Chair Catherine Loftus. China has taken note of the PBAC report. Meanwhile, some countries expressed concerns about the budget-related elements in the report at PBAC's meeting last week. This requires deeper and broader discussions among member states, and China will make specific statements when we reach the item on the next biennial budget. Thank you, Chair. 谢中国，下面请说。
I give the floor to Somalia. The request for the floor. EB members, non-members. Well, thank you, those who've made contributions. I understand that the Secretariat will respond to any comments and questions raised during this discussion under the appropriate agenda items. May I take it that the Board wishes to take note of the report contained in the document EB 156/4. I see no objection. The report is noted. Thank you. This concludes our discussion of item 4 on our agenda. Let us now consider the sub-item 24.2, governance reform, which includes 2 discussions. The first discussion consists of items which have been previously discussed by the Program Budget and Administration Committee. The relevant reports are contained in 3 documents. The first document is EB 156/32, Secretariat Implementation Plan on Reform. The second document is EB 156/29, Member State-led Governance Reform. The Board is invited to take note of this report and consider a draft decision contained in document EB 156/29. The financial and administrative implications of the draft decision are contained in document EB 156/29 Add 1. The third document is EB 156/30, process of handling and investigating potential allegations against WHO Directors General. The Board is invited to take note of this report and consider a draft decision as amended and contained in document EB 156/4. The financial and administrative implications of this draft decision are contained in document EB 156/30 Add 1. As these items were discussed by the Program Budget and Administration Committee, I shall draw your attention to the report of the committee contained in document EB 156/4, paragraphs 24 to 33. I would like to invite the PBAC chair to read out the recommendations of the PBAC. Dr. Loftus, you have the floor.
Thank you, Chair. With respect to governance reform, the committee held 3 discussions. First, on the Secretariat implementation plan on reform, the PBAC expressed strong appreciation for the work done so far to put the plan into effect, especially the creation of the dashboard. The committee recommended that the Executive Board note the report. It further proposed, as guidance for the Secretariat's implementation of existing mandates, that the Secretariat should A. Continue its work to implement the remaining open actions in the Secretariat implementation plan on reform and meet the anticipated due dates, recognizing any resource capacity constraint and the need to ensure sustainability. B. In view of financial constraints, provide additional information on how to prioritize the work going forward. C. Ensure efficiency by fostering interdepartmental cooperation, maximize synergies with existing work streams and mandates, and apply best practices. D. Continue to promote culture and behavioral change at all 3 levels of the organization and provide an overview on how progress will be tracked during the entire period of the 14th General Programme of Work 2025-2028. And E. Continue discussions with Member States to identify gaps and additional reforms needed, including strengthening country-level impact and assessment of outcomes resulting from the implementation of the reforms. Second, on Member State-led governance reform, the PBAC applauded the co-leads Jose Acacio of Australia and Ding Yang of China for their work and strongly supported the reform process as indicated in the report. The committee recommended that the Executive Board note the report contained in document EB 156/29 and adopt the draft decision therein. Finally, on the process for handling and investigating potential allegations against WHO Directors General, the committee thanked the co-leads for their tireless efforts to devise a process. Committee members stressed the importance of having a transparent and accountable process and of striking a balance between governing body oversight and ensuring the integrity and independence of the investigative process. The committee agreed to recommend to focus on the 2 remaining areas of divergence in section B2 and B3 through close consultations with all Member States to finalize by the 78th World Health Assembly. The committee recommended that the Executive Board note the report contained in document EB 156/30 and adopt the draft decision contained in Appendix 2 of that document as amended by the committee in document EB 156/4 after paragraph 29. Thank you, Chair.
Thank you, Dr. Loftus. The floor is now open for discussion. Kindly raise your nameplate should you wish to take the floor to comment on the recommendations of the PBAC. Senegal, you have the floor.
Merci beaucoup.
Thank you very much indeed, Chair. Director General, Ministers, distinguished delegates, Senegal has the honor of making this statement on behalf of the 47 member states of WHO's Africa region. The Africa region wishes to begin by congratulating the DG on the document on implementation of the reform plan, the document drawn up by the Secretariat. We commend the commitment of those who are leading the governance reform process, and we congratulate the 2 co-facilitators on the work done in the course of recent consultations. The Africa region is happy to note progress made. We now have moved from an execution rate for the plan from 39% to 88%, and that was achieved between January 2023 and November 2024. Nonetheless, member states of the African region have noted that the Secretariat document on the implementation of reform is mainly focused on headquarters. The document does not highlight results or key achievements that can be specifically attributed to the African region, despite our important contributions to global work in this area. Indeed, the Africa region has made significant progress when it comes to promoting governance reform. We have laid emphasis on a results-based management system at country level throughout the continent. When it comes to responsibility, the Africa region has put in place a mechanism to track implementation of recommendations from evaluation processes. As a result, the member states of the Africa region invite the Secretariat to do a couple of things. Firstly, to extend actions to regional and national level in addition to headquarters level in order to strengthen country-level impact. Secondly, in future documents and reports to include the results of achievement or implementation of reform. When it comes to the issue of resolutions and their costs, given the current context in which we live, the Africa region invites the Secretariat to submit to us an updated mapping that would give a clear indication of financial implications. We need a prioritization exercise to be held, and this needs to take due account of resolutions that are in force and the way that they link to current programs, with particular attention being paid to those in the area of digitalization. Further, as part of this exercise, the Africa region invites the Secretariat to adopt an approach that includes a human-centered approach. Turning to another issue, that of how to handle any possible allegations against WHO Directors General, the Africa region recalls the fact that key responsibility of the governing bodies of WHO is to ensure that the best interests of WHO are always upheld. That being so, they should be involved as decision makers at key stages in the process. Consequently, the Africa region does not support any kind of process that would give decision-making powers to an external investigation body. The Africa region believes that a decision to open an in-depth investigation following an allegation is a decision that should be taken by the EB with full participation of member states. In conclusion, the Africa region welcomes the draft decision that is proposed, the decision that recommends that EB chairs and PBAC chairs organize a consultation process that is full, inclusive and transparent, including all member states, in order to craft a consensus on pending issues. Thank you.
Thank you, Senegal. I now give the floor to Canada, to be followed by Somalia.
Thank you, Chair. We continue to make genuine progress together under the umbrella of member state-led governance reform. Canada greatly appreciates the efforts to strengthen meeting management processes and thanks very much the PBAC Chair in that regard. The imperative to approach agenda items in a comprehensive and integrated manner is key, and to be explicit in how and where they correlate to our core governing documents so that we can continue to shepherd forward a system focused on governing bodies' core purpose of providing appropriate guidance and oversight to the organization. On the process of handling and investigating potential allegations against WHO Directors General, we support the recommendation of PBAC for the EB and PBAC chairs to take up the work on resolving the remaining areas of divergence on the proposed process through inclusive, transparent, and participative engagement with member states. We're confident that member states can come to agreement in the near future on a clear and thorough process to handle potential allegations against the head of the agency with appropriate investigational independence and member state oversight. This is the best way to ensure that any future potential allegations are handled quickly and fairly, protecting the WHO's integrity and reputation. Completing our work will also demonstrate that member states are actively strengthening organizational governance and transparency with the support of the Secretariat. We understand that there are consultations ongoing on the 2 remaining outstanding issues, and that it is feasible to have agreement this week. We would therefore request to not close this item before we have an opportunity for consensus to be reached. Thank you.
Thank you, Canada. I now give the floor to Somalia to be followed by Poland.
Honorable Chair, distinguished delegates, the member states of the Eastern Mediterranean region reaffirm their commitment to the principles of due process, accountability, and the integrity of the World Health Organization's governance structures. We recognize the importance of establishing a robust and transparent framework for handling and investigating potential allegations against the WHO Directors General, ensuring that such procedures adhere strictly to the established legal and procedural frameworks of the organization. In this regard, we acknowledge the ongoing member state-led governance reform efforts, including the consultations and recommendations outlined in document EB 156/30. We stress the importance of preserving the independence of the investigative process while upholding the authority of WHO's governing bodies, particularly the Executive Board and the World Health Assembly, in overseeing such matters. We underscore the necessity of ensuring that any investigative procedures remain free from external interference or politicization. The integrity of WHO must be safeguarded by ensuring that investigations, when required, are conducted by an independent entity in a manner that respects confidentiality, protects all concerned parties, and maintains the trust of member states in WHO's governance. Furthermore, we emphasize that any finalization of procedures must carefully balance transparency with the protection of due process, ensuring that investigations are conducted with fairness and in accordance with the internationally recognized standards, including those established by the United Nations Joint Inspection Unit and relevant oversight bodies. We encourage further member state deliberations to resolve outstanding areas of divergence while maintaining a strong commitment to the principles of accountability and good governance. WHO's institutional framework is fully equipped to manage such process internally, reinforcing the credibility and efficiency of the organization. Thank you, Chair.
Thank you, Somalia. I now give the floor to Poland to be followed by Bulgaria.
Thank you. Dear Chair, distinguished delegates, I have the honor of delivering this statement on behalf of European Union and its 27 member states. The candidate countries, Turkey, North Macedonia, Montenegro, Albania, Ukraine, Republic of Moldova, Bosnia and Herzegovina, and Georgia aligned themselves with this statement. The EU would like to express our gratitude to the Director General for the comprehensive reports provided on governance matters. We value the commitment to transparency and accountability demonstrated in this work. We acknowledge the progress made in the strengthening the governance of the WHO in recent years, including the follow-up work of the Working Group on Sustainable Financing and Agile Member State Task Group, and the significant contributions to previous executive board chairs. We appreciate the inclusive process in the development of the GPW14, which represents a step forward in fostering greater engagement and ownership by member states and in reaching consensus among member states. Furthermore, we welcome the discussion on the role and functions of the Executive Board Bureau, and these deliberations are critical to enhancing the effectiveness of our governance mechanisms. However, we must recognize that room for improvement remains. In order to ensure that EB is equipped to perform its functions, we need a better understanding of the interconnections between the proposed resolutions and the GPW and their effect on program budget. Too often, these discussions occur in silos, limiting our reliability to grasp the cause and effect relationship that underpin our decisions. This fragmentation hinders our collective capacity to prioritize and allocate resources effectively.
We therefore call for enhanced efforts to elucidate how resolutions align with the relevant GPWs and their essential priorities and contribute to reaching its objectives. Evidence of impact, including the potential to achieve meaningful health gains, considerations of reaching equity in health outcomes are also issues according to which we could prioritize interventions. Enhance financial transparency and the comprehensive understanding of the cost and impacts of proposed resolutions, such as detailed estimates of implementation costs, resource requirements for staffing, and long-term financial sustainability are also fundamental to ensure responsible and evidence-based decision-making. This would enable us to identify which elements of proposed resolutions are both meaningful, potentially impactful, and feasible, ensuring that our decisions are evidence-based and financially viable. Moreover, we need to prioritize the number of proposed resolutions according to available funding and resources, both in terms of resources and agenda management. This is a responsibility of the Member States, but also requires the support of the Secretariat. Given the funding and budget constraints expected for the organization, the EU poses its co-sponsorship to resolutions while awaiting the revised and reprioritized proposal for PB 2026-27. We request the WHO Secretariat to share and update overview of the expected cost of all resolutions, taking into consideration the expected availability of financing in 2025 and the revised program budget 2026-27 proposal, which we will take into account when deciding on resolution co-sponsoring in the run-up to WHA 78. Chair, let me end by emphasizing once again the importance of accountability as well as independent oversight. The EU strongly believes that an independent body selected and appointed by the Executive Board should be made responsible for investigating allegations against the Director General rather than the WHO Executive Board itself.
Thank you, Poland. I now give the floor to Bulgaria, to be followed by Thailand.
Honorable Chair, distinguished delegates, Bulgaria aligns with the statement made on behalf of the EU and its member states. In order to be effective, the reform in the functioning of the organization should be carried out in an integrated and systematic way, aligned at its three levels and taking into account how a change in one component of the system would affect the functioning of the others. We thank the DG for his report and welcome WHO efforts to reform its governance in terms of transparency and accountability of the budgetary, programmatic, finance and governance processes. In view with the latest developments and the need for stricter financial management, Bulgaria proposes to discuss the possibility of a preliminary indication of intent to submit draft resolutions in order to avoid the malpractice of tabling resolutions similar in topics and content. The indications could be provided to the EB session in May, for example. In addition, EB can consider preliminary support for WHO member states on these intentions, with a minimum number of countries supporting the project, for example, 30, including financial implications. We need a better alignment of the proposed resolutions and the GPW, considering their effect on the program budget. Therefore, we suggest the introduction of resolutions to be consulted, coordinated, and supported in advance by a number of countries as well as financially secured. On the process of handling and investigating the potential allegations against the DG, we echo the statement of the EU and its member states that an independent body selected and appointed by the EB, followed by an EB decision, if not the executive board itself, as mentioned by others, should be in charge, determining whether to close the case or proceed to a full investigation.
In the second option, the EB should have an inclusive involvement in the procedure, not only through its chair or a bureau, to secure unbiased and transparent procedure and minimize the possibility of political pressure. On the discussion questions, to mitigate the risks associated with limited human resources, an improved selection process has to be put in place. In addition, optimal use of human resources capacity against their talents and strengths is needed. This is delegate the right functions to the right persons. For the financial aspect, we call for a realistic budget, balancing ambitions and capacity to achieve planned outcomes with due prioritization and a closer coordination with governments on domestic health challenges to better address their needs and enhance country impact, as well as GPW14 implementation. The above even more so with the recent development of a potential withdrawal and the financial restriction it entails. Thank you.
Thank you, Bulgaria. I now give the floor to Thailand, to be followed by Australia.
Thank you, Chair. Thailand's intervention is on prioritization of the resolutions. The member states have the right to propose agenda and the draft resolutions. This right should be protected. It would be easier to manage each resolution if we focus only on the operative paragraph and keep them to a few paragraphs rather than a long resolution. Prioritization on the budget allocated should be the mandate, the authority, and responsibility of the Director General. The challenges also come from the Secretariat that technical department convinced some member states to propose the agenda or the draft resolution, or even prepare the draft for the member states. This is just to ensure and secure the budget for the department. The Director General should implement a system to manage this kind of actions within the Secretariat itself. Chair, WHO may not need that much money or budget to implement each resolution, but to use its name on social credit to get to the target. We would like to reiterate that just a drop of ink of the signature of the Director General or the communication with leaders around the world can change the situation. Thank you.
Thank you, Thailand. I now call on Australia, to be followed by Switzerland.
Thank you, Chair. Australia thanks Member State leads and the Secretariat for their reports and their large amount of work. On Member State-led governance reforms, the implementation of governance reforms must be a priority for Member States. We recognise achieving this will take time and that longer-term measures will require piecemeal reforms to take place first. We consider it necessary to reorientate the structure and cadence of the governing bodies, with the goal of the board being more strategic and the World Health Assembly becoming more action-oriented. This will reduce duplication and enable Member States to meaningfully engage on the right issue at the right level at the right time. We also need stronger systems in place. Currently, we are negotiating a high number of resolutions and decisions, which makes meaningful engagement near impossible. We need systemic controls to moderate the number of resolutions and ensure they are timely and aligned with the general program of work. This morning, there was also mention of a suggestion from the informal EB session yesterday of the possibility of developing a white paper by the Secretariat to come back to the World Health Assembly to outline some principles. I think this would be a very useful initiative to us to consider, to look at issues to do with Member State control and decision rights, transparency and processes that would be relevant. We support the draft decision to develop an enduring model for Member State-led governance reform, continue work on the recommendations and report to the Executive Board next January. On the question of the DG allegation process, Australia is pleased with the productive and positive PBAC discussions and developing a draft procedure for handling potential allegations against the WHO Director General. The final procedure must ensure independent investigations are conducted in a manner that provides full due process and protects all parties without being hindered by politicisation, interference or conflicts of interest. We should continue to be guided by these principles as we work towards resolving outstanding areas of divergence. Whilst we hope this process will not need to be utilised, establishing robust processes based on these principles will strengthen organisational transparency and accountability. We're very pleased by the suggestion that the PBAC chair and the EB chair can work up final proposals to be taken forward at the 78th World Health Assembly. However, I listened with interest to the Canadian suggestion that we could potentially do this earlier. Whether we leave the decision open or we modify the decision to say that the report and recommendation should go no later than the 78th World Health Assembly, I think that would be a worthwhile opportunity, potentially to take advantage of that we're all in Geneva this week and we could potentially resolve the issue. So I would suggest we amend it to leave it open to resolve this issue earlier than the 78th World Health Assembly, but make it clear we'd like to resolve it no later than that meeting. Thank you, Chair.
Thank you, Australia. I now call on Switzerland to be followed by Norway.
Merci, Monsieur le... Thank you, Chair. Chair, I'm taking the floor for the first time today, so I wish to begin by extending to one and all a very warm welcome to Geneva. The eyes of the world are upon us this week. We are facing significant challenges, and we need to send a strong signal from this executive board. The governing bodies of WHO are required to give guidance to this organisation in order to allow WHO to fulfil the terms of its mandate. In order for that to be possible, we need a certain amount of space within which we can discuss matters of substance and take well-founded decisions. Last week, we were all at PBAC, and we spent most of our time there discussing the WHO's budget. The WHO's financial situation is grave. As we heard, the house is on fire. And it's at critical moments like that that we, as member states of WHO, have to shoulder a heavy responsibility, and we have to focus on the smooth functioning of the governing bodies of this agency, because WHO has crucial work to do and has areas where it can bring to bear significant added value. If we are to do that in the current situation, we need to establish very clear and strict priorities. We're not going to be helping WHO if we overburden it. Already, we know that we're talking about more than 20 new resolutions that have to be implemented. We therefore support the proposal from the African group, also a proposal that's been put forward by the EU and others. In other words, this is a proposal that we get from the Secretariat, an overview of all of the new proposals that have been made. This overview would include financial implications. In addition, like other members of this EB, we call for a more efficient resolution management system, and this would include early review systems being included. We also think that we have to look at the way in which member states might coordinate among themselves better around WHAs. That might make the system more efficient. So let's recognize that we have to do our own housekeeping here in WHO first and foremost, and we within governing bodies have to look carefully at what we do and at the kind of mandates we give to this organisation. Bearing all of that in mind, we support the proposals from PBAC, and we also support that the reform work be continued by member states.
I now give the floor to Norway to be followed by China.
Thank you, Chair. Reform is necessary to make the organization more transparent, accountable and effective, especially in times of financial constraints. Transparency and accountability create trust, an important premise for flexible and predictable financing. Member states also need to continue improving efficiency and accountability of the governing bodies. We appreciate the measures piloted during PBAC last week and look forward to seeing them used in all governing body meetings. We appreciate the tracking dashboard, and we fully support the continuation of both the SIP and member state-led reform. On remaining reform process that considers both the Secretariat and the member states is the finalization of the procedure for potential allegation against Director Generals. We would like to thank the MS leads, China and Australia, who have done an important job in getting us close to the goal. Some procedures that will protect the integrity of WHO, of the leadership, and of the governing bodies. To this end, we need accountable, independent, confidential, and trustworthy procedures in place, procedures that protect the confidentiality of all persons involved, including the DGs. We recognize diverging views on where the balance is to be found between the need for governing body oversight and the need for ensuring an independent investigation free from any political influence. We support the decision point and encourage all member states to engage actively in order to finalize the procedures by the World Health Assembly 78. Any prolongation will put in jeopardy both the reputation and the financing of this organization. Finally, we need an honest discussion among member states on how to best address the proliferation of resolutions in a time where both Secretariat and the member states need to prioritize. Thank you.
Thank you, Norway. I now give the floor to Lebanon.
Thank you, Chair. China appreciates the extensive work done by the colleagues Jose and Ding Yang in advancing WHO governance reform. China believes that WHO is a member state-driven international organization, and its reform concerns all countries. China welcomes interested member states to take on leadership roles and looks forward to the engagement of all nations in the reform process. Given WHO's current financial constraints, we believe that it's necessary to prioritize reform initiatives, addressing the most urgent ones first, particularly those related to cost saving and efficiency gains. When putting forward new reform suggestions, member states should fully consider their necessity and financial impact. The structure of governing bodies should not be further expanded. We support flat hierarchy decision-making to reduce burdens. China emphasized that all reforms must adhere to the WHO Constitution. Regarding the relation between resolutions and budget, China believes that for existing resolutions, in light of the current financing situation, especially given the potential funding shortfall, the budgetary needs should be reassessed and expenditures be further reduced. China requests additional information from the Secretariat. Regarding future resolution submission procedures, China hopes that based on areas identified under GPW 14, the Secretariat should review and publish annually, for example, every September, the number of resolutions and further steps required. This would help member states make decisions on proposed drafted resolutions. Regarding the investigation process in relation to the DG, China emphasized that WHO is a UN agency led and driven by member states. The process must ensure fairness and transparency while allowing meaningful participation of governing bodies and member states. We believe the current draft, while ensuring the independence of the process, should also strengthen the role of the EB. Regarding the next steps, China does not oppose a plan to make all efforts to submit the document to the WHO in May this year, and China will participate actively in this work. However, given the significant differences among member states on key investigation steps, the intensive negotiation on pandemic agreement to be held before this year's WHO is also foreseen. China suggests maintaining some flexibility on the timetable. Thank you.
I now give the floor to Lebanon, to be followed by Slovakia.
Thank you. Lebanon aligns itself with the statement delivered by Somalia on behalf of the Eastern Mediterranean region. As an integral part of the region, Lebanon reaffirms its commitment to due process, accountability, and the integrity of WHO's governance. It supports the establishment of a robust and transparent framework for handling allegations against WHO Directors General, ensuring alignment with the organization's legal and procedural frameworks. Lebanon underscores the importance of an independent investigative process, free from external interference and politicization, while maintaining appropriate oversight by WHO's governing bodies. The investigation should be conducted by an independent entity composed of member states, separate from the Secretariat, to uphold confidentiality, fairness, and internationally recognized standards, including those set by the UN Joint Inspection Unit. Finally, Lebanon encourages continued member state discussions to address outstanding concerns while reinforcing WHO's institutional capacity to manage such processes effectively, safeguarding trust, accountability, and good governance. In the event that no agreement is reached on the procedure during PBAC 42, we suggest deferring this topic to EB 157 for further discussion. Thank you.
Thank you, Lebanon. I give the floor to Slovakia.
Honorable Chair, esteemed colleagues, Slovakia aligns itself with the statement delivered by Poland on behalf of EU and its member states. We welcome the Secretariat's extensive work behind the report and recommend the unwavering commitment to lead and implement the transformation of the organization in the collaboration with the member states called governance reform under collaborative leadership of Jose and Dink. How to handle possible allegations against Director General? We really need to be responsible and to take the responsibility also during this EB, and therefore I would like to request on our behalf our dear Chair to find appropriate slot where we can discuss and potentially to find the solution during this session to close this until February 11. Reform has introduced a couple of new technology tools, and we welcome all the innovations, and we would like to be glad to see even more during other governing bodies meetings, including EB and WHA, including e-voting. WHO faces increasing financial and geographical challenges requiring strategic and data and evidence-driven approach to the adoption of the implementation of the resolutions. To ensure the resolutions effectively respond to global health needs, financial realities, and scientific priorities, we propose establishing structural gap and risk analysis framework and a dedicated resolution management mechanism during intersessional period until upcoming PBAC and EB in May. A gap and risk-based approach should guide not only resolutions prioritization, but also in short-term evaluation of all programs currently implemented at HQ and in the regions, assessing scientific justification, financial feasibility, health equity impact, and risk of inaction. We need to establish framework to clear sets of evaluation for propositions, preparation and implementation of the resolutions, at least in two categories. First, urgent, addressing health emergencies through an accelerated mechanism, and second, planned, supporting mid and long-term strategies with multi-year financial sustainability. A technical advisory group on resolution prioritization working together with WHO Science Department should evaluate resolutions based on the scientific rigor, strategic alignment, and cost effectiveness. A specialized governance reform should formalize submission criteria, define urgency threshold, and enhance member states' engagement. To ensure financial sustainability, WHO should require financial plans and roadmaps for implementation of all resolutions, limit the number of new resolutions annually, and expand flexible multi-donor funding, including NSAs, under new regulatory framework. This science-led, structured approach will enhance WHO's governance efficiency, ensuring resources are allocated to high-impact, evidence-based priorities while maintaining WHO global leadership. I thank you.
Thank you, Slovakia. And I'll give the floor to Brunei Darussalam, to be followed by Ethiopia.
Thank you. Dear Chairs, Excellencies, ladies and gentlemen, Brunei Darussalam expresses its deep appreciation to the member state leads for their tireless efforts in advancing governance reform and their commitment to fostering a more effective, transparent, and accountable WHO governance framework. On member state-led governance reform, Brunei Darussalam acknowledged the significant progress made in strengthening governance processes. We recognize the challenge posed by the increasing number of resolutions, decisions, and agenda management. As a small developing country with limited delegation capacity, keeping up with all these elements can be demanding. Therefore, we support discussions on innovative, evidence-based approaches to prioritization, ensuring a fair, inclusive, and efficient decision-making process that aligns with WHO mandate and the general program of work. On the process of handling and investigating potential allegations against WHO Directors General, we reaffirm that the importance of transparency, accountability, and due processes in addressing such matters. To safeguard the credibility of WHO, it is critical that investigations remain independent and free from conflicts of interest or being politicization. While we acknowledge the role of Executive Board in governance oversight, any investigative framework must ensure a balanced and impartial approach, possibly by drawing on existing best practices from other UN organizations. We support inclusive consultations to finalize this process, ensuring all member states are adequately represented. On the Secretariat Implementation Plan on Reform, Brunei Darussalam commends the substantial progress made, particularly the 88% of recommendations clearly already implemented. The real-time dashboard is an important step in enhancing transparency and accountability. Looking ahead, we encourage clear strategies for prioritization to optimize the use of financial and human resources. Given the evolving needs of the organization, we also see value in regular evaluations, such as member state surveys, to assess the impact of reforms and identify areas for further strengthening. The ongoing efforts to foster a culture of integrity and accountability at all levels of WHO are commendable, and we look forward to further discussions on this initiative. Brunei Darussalam remains committed to actively engaging in governance reform discussions and working collaboratively with all member states to ensure effective and sustainable reforms that benefit the entire WHO membership. Thank you.
Thank you, Brunei Darussalam. I now give the floor to Ethiopia, to be followed by the Maldives.
Thank you, Chair. Ethiopia aligns with the regional statement delivered by Senegal on behalf of the 47 member states of the African region. We thank PBAC Chair for the great leadership and appreciate the robust discussion on program budget and governance matter. We also thank the Secretariat for the report of the Secretariat Implementation Plan, request further emphasis on strengthening country-level impact and assessment of outcomes resulting from the implementation of the reforms so far. We appreciate the ongoing work around the governance reform and thank Australia and China for their work this far. We also support the proposal for the development of a more sustainable model for member states-led governance reform. It would also be important that the next EB takes stock of what the WHO reforms thus far see and how also best to move forward from this. We have noted that significant time and resource went to negotiation recently and proposed resolutions and decisions, and we strongly encourage further work to be done to address true drivers and for proposing resolutions and further deliberations to find ways for advocacy, resource mobilization, and support to countries. We also support efforts to improve accountability and transparency in the organization. So we support the need to have a process and a system in place for handling allegations against the executive heads of the organization. We believe that there needs to be a balance between maintaining the independence of the investigation process, availability of and timely information, and decision-making role of the WHO governing bodies. We have taken note of the PBAC recommendation for the EB and the PBAC chair to conduct a thorough and inclusive consultation with all member states. Thank you.
Thank you, Ethiopia. I now give the floor to Maldives, to be followed by Barbados.
Thank you, Chair. Maldives appreciates the efforts of the working group and welcomes the progress made under this agenda item. Change is a constant. Our ability to evolve and adapt defines our strength and ultimately our outcomes. As noted by member states, WHO governing reforms envision efficiency gains and sustainable financing reforms are essential for optimal results. Finding the appropriate balance between these two elements is particularly crucial for small states like Maldives. A realistic budget, one that reflects the realities we face, is a fundamental starting point. For nations with limited resources, exploring avenues to increase access to contributions is vital to ensure the long-term financial health of the organization. However, financial sustainability alone does not guarantee effectiveness. Equity in decision-making must be at the heart of governance reforms. Central to our discussions must be the questions of participation. How do we ensure broad and meaningful engagement, especially from small delegations like Maldives, who often face significant resource and capacity constraints? Governance structure must foster inclusivity, ensuring that all voices, regardless of financial contribution or delegation size, carry weight in shaping global health priorities. This is directly linked to our need to prioritize in an agile manner, adapting to evolving circumstances and focusing on the most pressing issues. We must carefully consider current outcomes and use them to inform our decision making. Another key area for improvement lies in resolution management. As highlighted by many member states, we must address the challenges of member states' participation, the often ineffective costing of resolutions, and the identification of resolutions that do not mandate concrete work. Maldives' concerns with the need for resolutions to require coordination, alignment with the GPW14, and transparency. Furthermore, it is vital to identify the underlying reasons for proposing resolutions and to work towards an accountable mechanism for their implementation. We appreciate the effort of the working group thus far and share its desire to maintain momentum. Finally, as we move forward, it is imperative that we link these discussions with the ongoing budget discussion to ensure a coherent and sustainable approach. I thank you.
Thank you, Maldives. I now give the floor to Barbados.
Esteemed Chair, distinguished delegates, Barbados extends its heartfelt compliments to the PBAC Chair and the leads of the member state-led governance reforms for their unwavering dedication to advancing WHO's governance reforms. We would like to specifically commend Jose from Australia and Ding Yang from China for their exemplary work. The proposed decision aims to develop a durable model for member state-led governance and highlights a steadfast commitment to long-term enhancement and accountability. Furthermore, it outlines a clear and structured pathway to advancing these reforms, capitalizing on the collaborative efforts of member states, the Director General, and the Executive Board. Additionally, it underscores the importance of continuous dialogue and collaboration. By focusing on developing a sustainable governance model, we can ensure that reforms are not only implemented but also maintained over time, promoting stability and continuity. Regular progress reports reporting forces transparency and accountability, enabling necessary adjustments. These elements are critical to achieving genuine and lasting reforms that enhance the organization's functions and governance. Furthermore, Barbados firmly supports the meticulous process for handling and investigating potential allegations against WHO Director Generals. The fundamental principles outlined in the report, ensuring full independence, due process, confidentiality, and protecting all parties, are paramount to any agreed process. Balancing transparency with confidentiality is essential to maintaining the integrity of the process. We urge all members to adopt a balanced and solution-focused approach as we strive to finalize the outstanding issues. Pragmatism and consideration of all members' views will result in an outcome that equips WHO with an independent process and a balanced determination of the Executive Board's role. In conclusion, the Government of Barbados believes that the recommendations and draft decisions are meticulously crafted, addressing key aspects of government reform and ensuring effective, sustainable improvements aligned with member states' needs and expectations. I thank you.
Thank you, Barbados. I give the floor to Bangladesh, to be followed by Philippines.
We thank the Secretariat for the reports. Reform is a dynamic and continuous process, so the member state-led discussion may be continued to make the reform process responsive to contemporary requirement. We notice proliferation of resolutions beyond the capacity of small delegations to attend them. However, we don't support to limit the resolutions within GPW because new pressing initiatives may remain unattended with time. In this regard, Bangladesh echoes the suggestion made by Thailand that member states' right to propose resolutions shall be preserved. We suggest to finalize the conception of resolutions through a consultation of the Secretariat with the member states. This would help avoid conception of unnecessary resolutions. In handling and investigating potential allegations against WHO Director General, member states' participation in decision-making would help avoid politicization by any quarter. We welcome further discussion in this regard to arrive at a consensus-based decision on the remaining divergent issues. Finally, we appreciate Secretariat's ongoing efforts in implementation of governance reform. I thank you, Chair.
Thank you, Bangladesh. I now give the floor to Philippines.
Thank you, Chair. The Philippines welcomes the report and commends the efforts of the leads and the Secretariat in facilitating consultations to advance the recommendations of the Agile Member States Task Force. We reaffirm our commitment to strengthening WHO's governance structures to enhance transparency, efficiency, and inclusivity. We recognize the need for continuous improvements in the functioning of the governing bodies, particularly in optimizing the EB's deliberations and refining the process for proposing draft resolutions and decisions. In this regard, we support the introduction of systemic controls such as clear submission timelines and prioritization criteria to enhance the quality and feasibility of resolutions. We advocate for greater clarity on financing plans for proposed resolutions to prevent implementation gaps. The Philippines also underscores the importance of balancing efficiency with inclusivity. While we recognize the need to manage the volume of draft resolutions, we caution against measures that may inadvertently limit the participation of member states, particularly low and middle income countries, in shaping the agenda of WHO. We should ensure that there are equitable opportunities to contribute to WHO policy direction. As we move forward in refining the model for member state-led governance reform, the Philippines calls for a balanced approach. We believe that an inclusive, transparent, and efficient governance structure is vital to WHO's ability to effectively and equitably respond to global health challenges. Thank you.
Thank you, Philippines. I now give the floor to Monaco to be followed by the Russian Federation.
Thank you, Chairman. Monaco welcomes the efforts of the WHO to step up transparency, accountability, and effectiveness in its governance procedures. The recent announcement that the United States is planning to leave WHO has raised considerable concern about the impact on the budget and the activities of that on the organization. It also highlights our need to step up our efforts to mobilize resources and extend our pool of donors. We urge WHO to do more in this respect to ensure sustainable and lasting and predictable financing for its programs, especially those related to health emergencies. With restricted finances, all measures to facilitate the best use of budgetary and program mechanisms should be made, and that also means we need greater transparency. The Principality would like to congratulate WHO on what is already done here, including preparing a dashboard accessible to member states. We agree that we should limit the accumulation of resolutions which will be difficult to implement and have priorities for our projects so that we can allocate resources more efficiently. We also need to better align with the GPW. Lastly, we welcome the ongoing work on strengthening internal inquiries and the adoption of clear procedures for dealing with any possible allegations made against WHO Directors General. As we indicated during the various rounds of consultations, it is essential that these mechanisms be based on the principles of independence and transparency in order to preserve the organization's integrity. The Principality would like to close by reiterating her commitment to WHO and the reforms proposed, and hopes that any recommendations relating thereto will be effectively implemented. Thank you.
Monaco, I want to give the floor now to the Russian Federation, to be followed by Germany.
Thank you very much, Chairman. To begin with, we would like to thank the coordinators for the very high quality of work they've done on governance reform. We note the high level of transparency of the consultation processes and the creation of conditions necessary for the involvement of all member states. We should like to underscore that any initiatives to improve the functioning of the governing bodies should be such as not to lead to worsening the quality of the discussion. Additional restrictions on member states, particularly in respect of the work of the PBAC, will make it impossible to have a focused discussion on very specialized issues. We think it will be better to extend the length of the PBAC session in those years when we are considering a draft budget, the GPW, and other very important issues for the organization of the work of the organization. As to the investigation of allegations against WHO Directors General, the slower we introduce those, the higher the risk for WHO in respect of monitoring and accountability. It is essential that we conclude the work on this issue as quickly as possible, and this with the participation of all member states who are interested. We are grateful to the Secretariat for its efforts to implement the reform program. We believe that we need an online instrument which would enable us to track the progress of the reform initiatives. In accordance with the principles of results-based management, we believe it essential that with time we carry out an evaluation of the reform with the participation of member states so that we can draw conclusions on the value added they have brought to the Secretariat. Thank you.
Thank you, Russian Federation. I now give the floor to Germany, to be followed by Japan.
Thank you, Chair. Germany, of course, aligns itself with the statement delivered by Poland on behalf of the EU and its member states. Germany remains fully committed to strengthening WHO's governance.
Germany, could you slow down slightly, please? Thank you.
We commend the Secretariat's efforts, which have already fundamentally improved transparency, accountability, and efficiency. However, sustained commitment to reforms is essential to ensure long-term impact, particularly in light of the current severe financial constraints. On the member state-led governance reform, we thank the co-leads for their dedication. We support measures to enhance strategic decision-making, including refining the process for draft resolutions, while keeping costing in mind. Better integration of resolutions into WHO's strategic priorities will improve resource allocation and decision-making efficiency. Regarding the process for handling and investigating potential allegations against WHO DGs, we stress the importance of a transparent and independent process. Ensuring that investigations are conducted by an external independent entity is essential to maintaining credibility and fairness. Avoiding politicization while maintaining strong accountability mechanisms is key. Finally, we commend the Secretariat's implementation run on the reform, which has strengthened financial management, risk mitigation, and governance structures. Given the current financial constraints, prioritization and efficiency remain critical. We encourage continued efforts to enhance transparency, particularly regarding the financial implications of governance decisions. Thank you.
Thank you, Germany. I give the floor to Japan, to be followed by France.
Thank you. Thank you, Chair. Japan appreciates the progress report from the Secretariat and the contributions and the leadership of the member states' colleagues, Jose from Australia and Ding Yang from China. We commend the Secretariat's work on WHO reforms and the high implementation rate of the SIP. We encourage the continued implementation of all reforms, which is vital for future increase in assessed contributions, and we will monitor progress closely. To sustain WHO reform, sufficient human and financial resources must be secured based on prioritized discussions with member states. We appreciate PBAC's recognition of the need for member states to discuss how to prioritize and manage the large number of draft resolutions in the current financial situation. Regarding the process for handling potential allegations against WHO Director General, we emphasize that developing and approving this process is essential for strengthening WHO governance. While recognizing diverse opinions from member states, we believe this process should be based on the 4 basic principles outlined in the document, and we hope to reach consensus on remaining issues by the next WHA. Japan remains committed to WHO reform and will actively engage in future discussions. Thank you.
Thank you, Japan. I now give the floor to France, to be followed by the United Kingdom.
Je vous remercie, Monsieur le Président.
Thank you, Chairman. France would like to associate herself with the statement made by the European Union and its member states. We welcome the progress made over the last few years in terms of governance because they contribute to making our organization more effective, more accountable, and more transparent, and her governance more inclusive. We are particularly grateful to the facilitators of the group, and we congratulate the Secretariat on the results that have already been achieved in implementing reform. Current circumstances mean that we not only have to continue with our efforts, but also to step them up. First of all, we need to continue with what we've been doing and conclude. We welcome the draft mandate to enhance the effectiveness of the officers of this executive board, for example. We also think we need to conclude the preparation of a standardized model. A robust, open process without any interference or any politicization is what we need in line with our commitments. We agree with those member states who think we should use this executive board meeting to bring our work to a conclusion. We believe that the work on this question is not something that should be continued beyond the next WHA. We also need to breathe new life into the efforts we've already made. The exceptional situation in financial terms of the organization means that substantial adjustments are going to have to be made to the budget. The situation should also encourage us to carry out a thorough overhaul of our governance mechanisms. It is essential that we really have alignment between the GPW, the budget, and the programs. We often don't. There's also the question of the connection between strategic guidance and the priorities set collectively in GPW 14 and the increasingly large number of resolutions we have each year submitted by member states. Any suggestions to rationalize the process, some of which have been mentioned today, would be extremely welcome. Thank you.
The floor to the United Kingdom.
Thank you. We welcome the collaborative efforts of the Secretariat and the Member State-led group to monitor and implement the AMSTG and SIP recommendations. The UK is committed to working with colleagues to drive forward the transformation agenda to ensure WHO is the strongest, most agile and effective organisation it can be. On the process of potential DG allegations, we join others in thanking the Member State co-leads for leading such a consultative process. Transparency and due process are important principles for the UK. Agreeing this process is a key part of WHO's transformation agenda, which is now more critical than ever. We support Canada and others in encouraging the PBAC and EB chairs to use this week to facilitate inclusive discussions with Member States on the two outstanding issues in line with standard practice. We believe it is feasible to finalise the process at this executive board. It's important there is a clear process to resolve any allegations quickly and fairly, protecting WHO's reputation while ensuring WHO can publicly demonstrate its commitment to effective governance. On the SIP, we recognise the notable progress on the remaining actions, as well as the role Member States play in supporting efforts. We look forward to working closely with others to progress the final SIP items and to drive forward the wider transformation agenda. Thank you.
Thank you, United Kingdom. If there are no more requests for the floor, I shall ask members of the Secretariat to respond to the various queries. Okay. First, I'll start with Dr. Gaudine Silbersmith, Director of Governing Bodies.
Thank you, Chair. We have heard two requests for additional documentation. The one was a request for an overview for this EB on the financial implications of all resolutions and the options of how to address this. We can inform you that we will be ready to produce an information document for tomorrow morning, which gives that overview of basically the information you largely have in the multiple add-1 documents on the costing, but in a single overview table and the options on how to address that. And then there was a second request for a paper to go to the governing bodies in May. Australia, you were speaking of Health Assembly. I guess it's rather the Executive Board just following the Health Assembly, because it's usually addressing those things before going to the Health Assembly for final decision through the Executive Board. Some others were referring to the Executive Board. So that would mean Director General's report on governance reform, focusing on agenda, resolution and costing management. We would, of course, work very closely with the co-leads and consult in advance with Member States for that report. And it would also mean to add an agenda item to EB 157 on governance reform in order to be able to discuss that report. Thank you, Chair.
Thank you. Now I'll ask Mr. Raoul Thomas, Assistant Director, General Business Operations, to comment.
Thank you, Chair. And perhaps first to appreciate the comments from the Member States. I think it's very encouraging in these times to hear the support and acknowledgement of what we've been able to do with the Secretariat Implementation Plan, despite the constraints that we face as an organization. And just to remind that we've always said that it would be a dynamic plan, and we have reacted to that when Member States have asked for additions. And then in terms of the transparency, the acknowledgement around the dashboards that we've done, we had last week a lunchtime session explaining how they can be used to give Member States the ability to deep dive into exactly what the organization is doing, and then to give us back some feedback, because we do need your feedback on how we improve. As the Director General said this morning, change is constant. We expect it to be constant. But I would also like to highlight the comment made by China that, we need to prioritize reform initiatives, and that was discussed at PBAC as well, and putting in place a process with Member States to help in the prioritization and actually focusing on those that are going to bring us the efficiencies that we need, particularly at this point in time in the organization's history. Then just maybe to react to Senegal's questions around regional offices and country level. Whatever you see in that dashboard is not exclusively HQ. A lot of the feedback or the actions that are taken are actually taken at country and regional level, and then they're aggregated and fed up into the overview that you see. But I take the point that somehow we need to be able to better articulate what is actually contributing from the region and the country levels. So we'll see what we can do with respect to that. And then on Ethiopia, the question around country impact and strengthening country level impact. You'll see in the Secretariat Implementation Plan, there is the delegation of authority, empowering our WRs. We have implemented that. So there are a number of activities in the plan that actually speak to strengthening country level. The other is the core predictable country presence that you all know about, which is actually putting human resources into countries so that we can better respond to the needs of member states at country level. And with that, Chair, I'll pass back to you. Thank you.
Thank you. As I see no further requests for the floor, may I take it that the board concurs with the PBAC's guidance and that the reports are therefore noted? I see no objection. The reports are noted. Thank you. Let us now consider the draft decisions. First, we shall consider the draft decision containing EB 156/29 on member state-led governance reform. Having considered the report and recommendations of the PBAC, is the board ready to adopt the decision? I see no objections. The decision is adopted. We also have before us the draft decision as amended by the PBAC as contained in document EB 156/4 on the process of handling and investigating potential allegations against WHO Directors General. I've also heard several proposals that we suspend this item in order to allow more time for informal discussions on this matter. May I propose that we consider the draft decision on the understanding that if the informal discussions during this session of the board reach a successful conclusion, we may come back to the decision as necessary. Are there any objections to this proposal? I see none. May I ask if the board is ready to adopt the amended draft decision as contained in paragraph 29 of the document EB 156/4. I see no objection. The decision is adopted. The item is suspended. Thank you. Let us now consider the second discussion of sub-item 24.2, Member State-led governance reform. The relevant reports are contained in two documents. The first document is EB 156/31, draft terms of reference to strengthen the effectiveness of the functioning of the officers of the Executive Board. The Board is invited to note the report and consider a draft decision point as outlined in paragraph 6 and as projected on the screen. The financial and administrative implications of the draft decision are contained in document EB 156/31 add 1. The second document is EB 15633, involvement of non-state actors in WHO's governing bodies. The Board is invited to take note of this report and provide guidance with respect to the questions outlined in paragraph 21 and as projected on the screen. The floor is now open for discussion. Kindly raise your nameplate should you wish to take the floor. I remind delegates that, as mentioned earlier, NSA constituency statements will be delivered on this item, specifically on the involvement of non-state actors in WHO's governing bodies, and these will be interspersed after EB members and among those member states not represented on the board. I give the floor is now open for comments. I give the floor to Canada.
Thank you, Chair. I'll be very brief. Wish to thank the Secretariat very much for the draft terms of reference for the officers of the board. It's important, of course, that new officers have clear guidance on the time and engagement that is required to successfully carry out the roles aligned with the processes to guide the work at hand. And we very much recognize that the terms of reference are based on the current criteria for officers to consider additional items, and would like to highlight the need for member states to work together in the near future to update this criteria so that officers are equipped and better equipped and actively supported to adopt more strategic decisions, in particular by considering the proposed role for the board on any new agenda items put forward. Thank you.
Thank you, Canada. I give the floor to Switzerland, to be followed by Senegal.
Merci, Monsieur le Président.
Thank you, Chair. Chair, Switzerland wishes to commend the work done by the Secretariat and also the work done by the Member States' co-leads when it comes to reform. From our own experience over the past few months, we know that it is important to reinforce the mandate for Bureau members. This is important in order to improve targeted preparation for meetings. We therefore support the idea of establishing these terms of reference. The increasing length of agendas for governing bodies within WHO is worrisome. I've already said that. And we would appeal for strict respect for our agendas. That makes it possible for member states to deal with key issues with the attention and diligence required in order to give strategic guidance to the organization. In order to support the work done by the Bureau, Switzerland believes that it would also be useful to put in place a troika model. This would ensure continuity and would facilitate long-term planning. It's also vital to establish a clear schedule for agenda items and resolutions to be submitted. This is necessary in order to give members of the Bureau an overview of the situation prior to meetings. Those two important things should be part of the terms of reference. Lastly, Switzerland supports improvement being made to the process for onboarding new members of the EB, and we advocate better training, better introduction for new members in close cooperation with the Secretariat. The requirements of being a member of the EB or being an officer should be clear to all. Thank you.
I now give the floor to Senegal, to be followed by Yemen.
Merci beaucoup, Monsieur le...
Thank you very much, Chair. Director General, ladies and gentlemen, ministers, distinguished delegates. Senegal has the honour of making this statement
and we speak on behalf of the 47 member states of WHO's African region. The WHO Africa region wishes to congratulate the DG on this document. That is to say, the document on governance reform within this organization. We consider that the effectiveness of WHO's governing bodies involves leadership from the Bureau and the EB, and also full support of member states. Indeed, we welcome the fact that informal consultations are now held more and more with member states, and this allows us to work towards drafting an appropriate draft terms of membership, terms of reference for the Bureau. We therefore would invite the Director General to facilitate implementation of the approach that has been decided on, and also intersessional coordination between the offices of the EB and members. As for NSAs, for a long time now we have recognized the importance of the participation of non-state actors within regional committees of our region. And in close cooperation with NSAs, we have worked to put in place appropriate policies for this organization. The contribution made by NSAs is especially important when it comes to the sessions of the WHO Regional Committee for Africa. We wish to emphasize, however, that the participation of NSAs in the governance process for our organization is something that can only be improved if we put in place a package of measures. This involves strengthening cooperation across the board between WHO and NSAs. Therefore, we would invite the Secretariat to ensure that the way in which NSAs interact with the organization is strictly defined and operates within certain parameters in order to ensure that the interests of all are respected, and also the credibility and overall interest of WHO. In conclusion, we would invite the EB to take note of this document. Thank you all for your kind attention.
Thank you, Senegal. I now give the floor to Yemen, to be followed by Thailand.
Thank you, Mr. Esteemed Chair, Your Excellencies, Director General. On behalf of WHO member state in the Eastern Mediterranean region, we thank the Director General for his report on implementation of the framework of engagement with non-state actors, FANSA. And we thank the Secretariat for all their efforts in this regard. Constructive engagement with non-state actors is critical for advancing public health outcomes. Strategic collaboration with such actors can enhance our collective capacity to address health emergencies, achieve universal health coverage, and tackle the social determinants of health. However, partnership must fully respect the sovereignty of member states and align with national health policies. They must prioritize strengthening national health systems, guided by the principle of transparency, accountability, and alignment with public health objectives. The Regional Office reviewed 233 regional engagement in 2024, a notable increase from the previous year. This raise reflects our region's response to escalating global emergencies and highlights the value of proactive engagement strategies in enhancing preparedness.
Excuse me, Yemen. I believe you are not on the agenda item that we are dealing with right now.
I thought it's 33 or not?
This document. This is sub-item 24.2, the document.
Yeah.
EB 15633.
I thought that we will take it, both of them. So,
what do you advise?
Thank you, Joe. To clarify, there is this agenda item which is only of the involvement of non-state actors in governing bodies.
Yes.
The overall FANSA engagement agenda item is a separate agenda item which will come later in the week.
Okay. Okay, I think I can keep going, or what? I don't know.
I would suggest not.
Okay.
Thank you. These things do happen sometimes.
Okay.
Thank you.
Thank you.
I now give the floor to Thailand.
Thank you, Chair. Thailand supports the draft decision and approves the term of reference of the officer of the Executive Board. Thailand also notes the report on the involvement of the non-state actors in the WHO's governing bodies. Non-state actors are the important partners in advancing global health, and their meaningful participation in WHO governance process is essential. While non-state actors can participate in the governing body meetings through constituency statements, they also need to adhere to the FENSA principle. Clear rules for the NHA involvement will help strengthening WHO's engagement with them. Thank you.
Thank you, Thailand. I now give the floor to Norway.
Thank you, Chair. We thank the Secretariat for an inclusive process developing these terms of reference. Terms of reference are important to authorize the officers to make the proceedings of the governing bodies more effective, in particular when it comes to set the agenda for the EB and hence the World Health Assembly. We welcome in that regard the proposed quorum for the meetings. We also welcome that the officers of the board are to have strategic discussion when deciding on the additional items. Going forward, the member state might look into additional criteria for the agenda management, and we welcome as well the proposed review by EB 161. We support the implementation of these terms of reference. Thank you.
Thank you, Norway. And I give the floor to Bulgaria.
Thank you, Chair. Bulgaria welcomes DG report and the development of the draft terms of reference to strengthen the effectiveness of the functioning of the officers of the Executive Board. In view of the past experience of EB functioning, this document introducing housekeeping rules for strict agenda and time management to optimize EB work is very timely. Bulgaria fully supports the responsibilities listed as crucial for the proper functioning of the board. We would like to bring to the attention the following considerations. First, strict management and prioritizing the EB agenda. We support the proposal adding an option of separating topics for discussion in EB session, and which topics should only be considered within the WHA to avoid duplication. The EB might wish to consider which agenda items to have biennial cyclical character every 2 or more years added by Secretariat. EB might consider the option to delay consideration of an agenda item to another EB session, which could more fairly distribute the burden between EB sessions. Second, dissemination of agenda documents. In accordance with Article 5 of the EB Rules of Procedure, this should be disseminated to Member States not less than 6 weeks before the start of the session. Unfortunately, this deadline is rarely respected, including for the present session of the EB, which hinders the timely preparation of positions on the agenda items by the EB Member States, given the need to comply with their national procedures. An engagement of the EB officers in monitoring the process could be a game changer. Third, EB interventions and strict time management. Previous practice has shown that time limits for speeches are not respected. Improving the discipline in plenary by strict management of speaking time would prevent prolonging EB sessions, including evening ones, and achieve a healthier working style, and we look forward to seeing it in practice. Fourth, quality of statements. Prioritizing expertise and technical discussion within the EB will only add value to its sessions, make the board fit for purpose, and differentiate it from the WHA style. Fifth, last but not least, we would like to thank our member state leads on government reform, Australia and China, for their dedicated work within the member state consultations on this matter, for their analytical reading of the possible workable solutions, and for having prepared the tables that presented the whole complexity of the debate in a digestible way. Thank you.
Thank you, Bulgaria. I now give the floor to Lebanon, to be followed by Japan.
Chair, distinguished delegates, ladies and gentlemen, the member states of the Eastern Mediterranean region thank the Director General for his report and reaffirm our commitment to supporting WHO's governance processes. We welcome the draft terms of reference aimed at enhancing the effectiveness of the officers of the Executive Board and recognize their essential role in facilitating the smooth functioning of WHO's governing bodies. The Eastern Mediterranean region values efforts to further clarify roles and responsibilities, enhance coordination with member states, and ensure a fair and inclusive approach to decision-making. Maintaining the independence of the officers while fostering open and transparent engagement with all member states is key to reinforcing trust and collaboration. Strengthening agenda management and procedural oversight will help support the board's effectiveness while ensuring that governance processes remain adaptable to evolving needs. We appreciate the discussion to refine the terms of reference and encourage continued dialogue to align them with the principles of good governance, accountability, and inclusivity. A periodic review of these terms will allow for necessary adjustments while ensuring they remain relevant to the organization's objectives. The Eastern Mediterranean region remains committed to constructive engagement and looks forward to working collaboratively with member states to further strengthen WHO's governance. Thank you, Chair.
Thank you, Lebanon. I now give the floor to Australia to be followed by Slovakia.
Thank you, Chair. Australia thanks the Secretariat for developing the draft terms of reference for Office of the Executive Board and the report of the involvement of non-state actors in WHO's governing bodies. We welcome the draft terms of reference and the formalisation of the roles and expectations of the officers of the Board. Officers of the Board should be empowered within their role to determine the Executive Board's agenda from a strategic lens. We also support the meaningful engagement of non-state actors in the WHO governing bodies. We recognise their right to speak and the value of their unique expertise and insights into individual and lived experience. Noting the need for efficiency, we welcome efforts to enable more non-state actors to join constituency statements. Thank you.
Thank you, Australia. I give the floor to Slovakia to be followed by Japan.
Thank you, Honourable Chair. We would like to appreciate terms of reference which are really important for more strategic discussion, strengthening and allowing more effective governing bodies sessions, and therefore we welcome and support the implementation of them and to pilot them for 1 year. And we would like to request Secretariat and also officers of the EB to provide the evaluation in 1 year and to come back with the feedbacks and proposals for possible improvement. We have the hope that, as we discussed during last 3 years, this matter, that we can also introduce new practice with possible engagement, not only us member states, but first of all, we have to lead by example, but also NSAs to submit in advance our statements online. Nevertheless, they can be really lengthy and they can explain our positions and our great examples from our countries, but the officers of EB could really step in and take the responsibility and divide the duties and to provide the summaries among those submitted statements and ideas and present it at the beginning of each item. It will really decrease repetitions and also it will bring up good ideas for consideration, and it could potentially facilitate the discussion which will be more fertile. So these are just gentle proposals for the implementation process, but otherwise we very much welcome the update and implementation of terms of reference. I thank you.
Thank you, Slovakia. I now give the floor to Poland.
Thank you, Chair. Just would like to echo colleagues from Bulgaria and Lebanon, and we support the continuation of the discussion on the terms of references. Thank you.
Thank you, Poland. I now give the floor to Japan.
Thank you, Chair. Just a small comment. Japan appreciates the Secretariat's consultation on the draft terms of reference of EB officers in strengthening the functions of the governing bodies. While we value the consultation process, we have a question regarding the proposed text, specifically about the role of regional coordinators. If we understand correctly, we recognize that regional coordinators are not officially defined roles. Therefore, we have proposed an amendment to this paragraph. Although we do not oppose the attendance of regional coordinators, our concern lies in the descriptions of inviting a representative who is neither an official body nor formally defined. In this context, we kindly request the Secretariat to clarify the justification for this current description. Thank you.
Thank you, Japan. I now move to the NCD Alliance.
Thank you, Chair. The following statement is supported by the NCD Alliance, along with the World Cancer Research Fund International, the Union for International Cancer Control, the World Dental Federation, World Heart Federation, International Federation of Medical Students Associations, HelpAge International, International Association for Dental Research, and Save the Children International. Distinguished delegates, we welcome WHO's continued efforts to enhance the participation of non-state actors in governing bodies through meaningful engagement, such as constituency statements. However, we also believe that more can be done to address the ongoing challenges highlighted in the Director General report. One key concern that remains is the oversubscription of certain agenda items. This dilutes the messages of different parties due to the limited number of constituency statements that are allowed. To address this, we call for greater flexibility, such as the ability to submit additional constituency statements when items are oversubscribed. Moreover, to further enhance the process for constituency statements, we ask that relevant information be shared at least 2 months prior to governing body meetings, while maintaining the option for also doing individual statements to allow for more nuanced and representative expression of diverse views and inputs. We call for better interactions between NSAs and member states throughout the year. We asked you to consider the following propositions: calling on WHO to establish a mechanism to give the option for member states to consult non-state actors during resolution preparation processes, as we have recently seen with the past resolution on rehabilitation and social participation. Organizing pre-meetings for non-state actors ahead of the executive board sessions, as with the World Health Assembly, and inviting non-state actors to information-only sessions organized for member states. This would ensure a more transparent and inclusive engagement of non-state actors. We ask that information sharing and logistical arrangements for non-state actor participation in governing body meetings continue to be improved. This includes providing comprehensive pre-meeting materials, ensuring space for non-state actors in main meeting rooms, and allowing video statements to overcome barriers faced by those dealing with logistical, health, or financial constraints. Overall, we want to ensure NSAs can engage in WHO processes in a transparent, flexible, and inclusive manner, allowing for their full representation in global health governance. Thank you.
Thank you, and I'll give the floor to Bangladesh.
Thank you, Chair. We thank the Secretariat for the report. We draw the attention of the Secretariat seeking more information in some paragraphs of the report 33 on the involvement of non-state actors in WHO's governing bodies. In para 11, agreement of over 55% of the respondents and disagreement of 6% respondents are mentioned. In paragraph 13, it is mentioned that 75% responded agreed. Similar kind of approach is also mentioned in paragraph 14. We would like to know from the Secretariat how many respondents are consulted in those consultations. In paragraph 15, it is concluded that overall the experience of constituency statement was positive among both member states and non-state actors in official relations. The affirmation from 55% of the respondent member state does not seem to be a correct figure to justify such a conclusion. This is our naive view. In paragraph 19, we are of the view that constituency statements on agenda items would be useful and they may be allowed to make joint statement. Member states may benefit from specific statements of individual CSOs. I thank you, Chair.
Thank you. Bangladesh, I now give the floor to the Global Health Council.
Thank you, Chair.
I'm reading this statement on behalf of the following organisations: Global Health Council, ANASVAD Foundation, Association africaine des centrales d'achat de médicaments essentiels, HelpAge International, Humatem, International Agency for the Prevention of Blindness, International Alliance of Patients Organisations, International College of Surgeons, International Federation of Gynecology and Obstetrics, International Federation on Aging, International Planned Parenthood Federation, International Society of Physical and Rehabilitation Medicine, International Union for Health Promotion and Education, Lifting the Burden, Save the Children International, Sight Savers, the Royal Commonwealth Society for the Blind, International Lactation Consultant Association, the Task Force for Global Health, Women Deliver, Women in Global Health, World Federation for Mental Health, World Federation of Haemophilia, World Hepatitis Alliance, Worldwide Hospice Palliative Care Alliance. We greatly appreciate the efforts WHO has made to ensure FENSA is fully implemented at all levels of the WHO. We are pleased to hear the results of the June 2024 Member State survey on the proceedings held at the 77th World Health Assembly, where more than half of respondents agreed NSA joint statements improve the quality of debates. We agree that NSA joint statements should remain integrated into the overall proceedings in between Member State statements to ensure NSA views are listened to and considered throughout the debate. Overall, we welcome the opportunity to continue NSA joint statements. However, because joint statements reflect the perspectives and calls to action from various diverse NSAs, it is often difficult to provide in-depth information and actionable recommendations from experts on specific agenda topics. We believe in continuing to provide NSAs with the opportunity to submit individual statements that give Member States more specific views and actions. We urge Member States to ensure that individual statements are not reduced, as doing so could limit NSA's meaningful engagement in governing body debates. We take this time to remind Member States that NSAs, particularly civil society organisations, serve on the front line of public health. Many NSAs include people with lived experiences who continuously face growing public health challenges, and many others that provide critical health and care services. These actors understand the public health problems and needs of populations, particularly those who are the poorest and most at risk. Without their meaningful participation, WHO cannot fulfill its mandate to create a healthier and safer world for everyone. Lastly, we were gravely concerned with the events at the 154th Executive Board meeting, requesting further discussions regarding the WHO Secretariat's recommendation for civil society organisations to enter into official relations with WHO. While satisfied with the outcome of these discussions during the 155th Executive Board meeting, we ask that moving forward, Member States adhere to the objective criteria used to evaluate NSA applications and uphold the recommendations and independent role of the WHO Secretariat. Thank you, Chair.
Thank you. Colleagues, you might be wondering, but I'm trying to conclude this agenda item before we adjourn. So with your support, I give the floor to Panama.
Thank you very much, Chairman. The Panamanian delegation will be referring to the draft mandate to strengthen the effectiveness of the offices of the Executive Board. Here, we would like to welcome the document which has been presented and which deals with the draft mandate. We think it would be a good idea to guarantee the availability of documentation, incidentally, as early as possible, so as to make the work of those of us on the Executive Board easier and make the EB more effective. We appreciate increased transparency, and we also think that the integration of regional coordinators with rules and work clearly defined will be helpful. Thank you.
Thank you. Thank you, Chair. We thank you for the DG's report on the governance reform involving NSA in WHO's governing bodies. The selection of agenda items for NSA constituency statements may not allow meaningful engagement and hinder the right of them to speak. We understand the need for time management and efficiency, but we caution against the expense of not hearing varying perspectives from NSA. Efficiency should be examined in the terms of inclusiveness and diversity of views and effective ways of taking into account those insights. We feel that NSA should be allowed to make individual statements and especially to bring unique views on board. We call Secretariat to take note of some of the points raised and provide some flexibility to the current practice to further improve the NSA's involvement in WHO's governing bodies. I thank you.
Thank you. I now give the floor to the International Pharmaceutical Student Federation.
Thank you, Chair. Honorable Chair, distinguished delegates, IPSF, representing over 500,000 pharmacy students and recent graduates, recognizes the importance of governance reform and the meaningful participation of NSA in WHO's decision-making processes. IPSF commends WHO's efforts to enhance NSA participation through initiatives such as constituency statements, the Civil Society Commission, the Youth Council, and informal pre-meetings. IPSF further calls for clear guidelines and early access to agenda items, greater flexibility on the range of agenda items that can be considered for constituency statements, and meaningful youth engagement with global platforms for discussion, as well as formation of youth councils in all regions of WHO. We urge WHO to strengthen NSA participation under FENSA and the 14th General Program of Work to ensure policies reflect community needs and uphold transparency in decision-making. Thank you.
Thank you. I give the floor to the International Baby Food Action Network.
Thank you. As a critical friend of WHO for 47 years, IBFAN was key to the adoption of the world's first consumer protection tool, a code of marketing and 20 resolutions that are in law to some extent in over 100 countries. Despite fierce opposition from industry, these policies have saved millions of children's lives. IBFAN knows that the independence, integrity, and trustworthiness of institutions such as WHO must be protected to empower all governments to protect health in all fora, including in trade, where IBFAN works to promote WHO policy. No single country can do what WHO is constitutionally mandated to do. The call to increase in assessed contributions is excellent, but please don't forget to screen NSA collaboration and funding for conflicts of interest. Thank you.
Thank you. If there are no more requests for the floor, I shall ask legal to respond to some of the queries raised.
Thank you. Well, I will respond on the... I'll respond in a moment.
Sorry, Kuwait, you have the floor.
Thank you, Mr. Chair. With the reference to the Yemen intervention regarding the non-state actor and my capacity as a regional coordinator, I expressed my reservation on the manner in which the region's presentation was interrupted during the mentioned statement, especially since some countries spoke in the same context. Moreover, the two topics are interrelated together. I would also like to take this opportunity to emphasize the right of the member states and the region to express their views within the allocated time without any interruption. Thank you.
Thank you. I've noted your comment, Kuwait. Hand over to the legal.
Thank you. I will briefly address some of the comments which are made about the terms of reference for the officers of the Executive Board. I think there was one question and a few suggestions for additions. The question was from Japan, and it was about the sentence in the terms of reference which, and I'll read it out, representatives of coordinating mechanisms for WHO regions may be invited to observe meetings of the officers held for this purpose, and this is the purpose of deciding on the agenda. What I would say about this is that this reflects the current practice. For the past several years, it has been the practice for the regional coordinators to be invited to the meeting between the Director General and the officers of the board that look at the proposals for additional items to be added to the agenda. During the discussions, the informal consultations which were held on the draft terms of reference, concerns were expressed about referring directly to the regional coordinators because of their informal nature and the fact that they're appointed slightly differently in different regions. And so a more generic formula was proposed, and that's the formula that I just read out, talking about representatives of coordinating mechanisms. Now, of course, it would be possible to adopt the terms of reference without any reference to the regional coordinators, but in light of the existing practice, there's concerns that if that is done, it may give rise to questions as to whether the regional coordinators or other representatives of the regions could continue to attend those meetings. What I would say is that this is simply a permissive sentence. It says that they may be invited to observe meetings, so they have no decision-making role, and they have to be invited, and they may be invited. It's not a requirement. And so with that, that would be the explanation that the delegate of Japan asked. But of course, you're free to amend or delete as you wish. These are your terms of reference. I would like to mention that a number of delegations have made further suggestions for things that could be added to the officers' terms of reference going forward. Some very interesting ideas, some of which have been raised in the consultations earlier about updating the criteria. Several people spoke about agenda management and the officers' role in that. And also there was a very interesting idea for a troika model that was raised by Switzerland. Perhaps if I can just explain what this document is. This is the first set of terms of reference for the officers of the board, and the approach that was taken, at least so far, is to reflect the current practice, the current mandate and role of the officers of the board, with a few enhancements which were agreed upon, which don't require amendment to the rules of procedure and don't prejudge the outcome of the wider reform discussions which are going on. I would say that we have built into the decision that you would take, if you take the decision that's proposed, a review after 2 years rather than one. Slovakia, you could make it 1 year if you prefer, but 2 years is what's suggested, so that in 2 years' time you could have a look and see whether there are enhancements that you would like to add at that point. And I would also point out that adopting these terms of reference now doesn't prevent you changing them sooner than 2 years. If, for example, in the wider discussions on reform, you decide on new roles for the officers of the board, these can be added. This isn't written in stone forever, so it doesn't prejudge your ability to do that. So I'm assuming that the comments which were made were made in that spirit rather than as proposals to amend this text. But of course, you'll let me know if that is not a correct assumption when we come to try and adopt it in a few moments. All right, thank you very much. If there are any questions that I've missed, I do apologize, but no doubt you will ask me them again. Thank you.
Thank you. Are there any more requests for the floor? As I see no further requests for the floor, may I take it that the board is ready to note the reports contained in documents EB 156/31 and EB 156/33. I see no objection. The reports are noted. Thank you. Let us now consider the draft decision contained in paragraph 6 of the document EB 156/31 on the draft terms of reference to strengthen the effectiveness of the functioning of the offices of the Executive Board. I'm not sure that the board is ready to adopt this, but I will put it to. Is the board ready to adopt this decision? Sister Swillen, you have the floor.
Thank you, Chair. Thanks also for the explanations by legal. I think that was very helpful, and it is a new text. We just believe it would be a pity if we do have some open questions and we do have the discussion coming up on resolutions and agenda management, that we adopt the text now and that we don't take another year to let this discussion basically just go into the text before we adopt it. Just a word of caution on this.
Is the board ready to adopt this decision? I see no objection. The decision is adopted. This concludes our second discussion of sub-item 24.2. EB members, colleagues, this has brought us to the end of this afternoon session and to the end of the first day session of this 156 EB. We will adjourn shortly and we will start tomorrow morning with agenda items 23.1 followed by 23.2. I thank you all for your participation and your suggestions and queries, and I look forward to seeing you tomorrow morning at 10 a.m. This session is adjourned.
Congratulations.
Thank you.
One of the 8 days.